In India, the rate of mental health practitioners is 0.3 for every 1 lakh people as per the World Health Organization.
There is a great gap that exists between the providers of health and people in need.
With this global pandemic, things have gotten worse, and it is predicted that after this, we will be having a mental health pandemic.
We are a growing population with complex issues but not enough resources for help.
Psychology is seen as an interesting blend of science and art. It is becoming a popular choice for many students.
However, there exists a taboo regarding mental health and the field of psychology. This prevents a large section of society in urban India from seeking help, while rural India suffers from a lack of resources.
The mental health scenario in our nation is highly disorganized to pockets which are inaccessible to the most. The regulatory bodies are not structured either.
All these reasons have added a lot of instability and lack of guidance for students who want to come in the field as well as have a rewarding career.
There's a huge scope and imbalance psychology despite what people might be telling you. So come join with us and explore the field of psychology as well as latest trends which you might have never heard before.
I'm super excited to talk about Encyclopedia event. It's one of its kind in the world. It is designed by the student for the student. There are eminent speakers coming from the various field of psychology to discuss, to answer all your kind of a question, whether you are a PhD student, you are a UG student or PG student or school student.
In India, the rate of mental health practitioners is 0.3 for every 1 lakh people as per the World Health Organization.
There is a great gap that exists between the providers of health and people in need.
With this global pandemic, things have gotten worse, and it is predicted that after this, we will be having a mental health pandemic.
We are a growing population with complex issues but not enough resources for help.
Psychology is seen as an interesting blend of science and arts. It is becoming a popular choice for many students.
However, there exists a taboo regarding mental health and the field of psychology. This prevents a large section of society in urban India from seeking help, while rural India suffers from lack of resources.
The mental health scenario in our nation is highly disorganized to pockets which are inaccessible to the most. The regulatory bodies are not structured either.
All these reasons have added a lot of instability and lack of guidance for students who want to come in the field as well as have a rewarding career.
There's a huge scope and imbalance psychology despite what people might be telling you. So come join with us and explore the field of psychology as well as latest trends which you might have never heard before.
I'm super excited to talk about Encyclopedia even. It's one of its kind in the world. It is designed by the student for the student. There are eminent speakers coming from the various field of psychology to discuss, to answer all your kind of a question, whether you are a PhD student, you are a UG student or PG student or school student.
In India, the rate of mental health practitioners is 0.3 for every 1 lakh people as per the World Health Organization.
There is a great gap that exists between the providers of health and people in need.
With this global pandemic, things have gotten worse, and it is predicted that after this, we will be having a mental health pandemic.
We are a growing population with complex issues but not enough resources for help.
Psychology.
A very good morning to each and everyone present here this morning. I am Angela Arikat, your host this fine morning, and one of the head organizers for this event. With immense pleasure, I take this opportunity on behalf of my fellow colleagues Gloria D'Souza and Ria Khamkar to welcome you to day 2 of 3G Psychology's International Psychology Career Summit Encyclopedia 2021. Over the next 2 days left of the event, we present to you eminent industry experts from various domains of psychology to help you expand your horizons, get authentic information, and gain valuable insights to help you make the best out of your career in psychology. With that said, over to Shaheen to introduce our first guest speaker.
Good morning to all. It's my greatest honor and proud privilege to invite our very first speaker of the day, Ms. Vishakha N. Punjani. Vishakha Punjani, the youngest co-founder of the Astitva Clinic, bridges the generation gap of ethicality and practicality and also nurtures the authenticity of the ongoing generation. She has worked in the Department of Psychiatry and Pediatrics of varied municipal and government hospitals. Being a practicing psychologist and having a keen interest in research, she has also been an assistant junior researcher at the Department of Evolutionary and Neurosciences, Oxford University, UK. Also, she is a visiting faculty at Ramnarayan Rua College, Matunga, and the University of Mumbai. Her ability of conducting mental health and well-being workshops and reaching out to people has led to extending her honorary work to our country's largest component of the armed forces. Nonetheless, she is a consultant at the Pre-Litigation Center, High Court of Bombay. Welcome, Ms. Vishakha. We're so immensely happy to have you here with us. The dice is now all yours.
Hi Shaheen, hi Angela, can you all hear me?
Yes, ma'am, you're audible.
Can you all see me?
Yes.
Perfect. So finally I get to see you, Angela. Very good morning to all the participants, that is Irfana, Nidhi, they're all 3G Tech, Jessica, and everybody else who's present in here. Very good morning. It's fantastic to have you all present here at 10 a.m. on a Saturday morning. I'm sure you all nicely got up early in the morning, figured how you're looking, what you all have to do. And I hope I really pronounced the name correctly. I introduced her correctly. Guys, I think you're doing a fantastic job. So it's amazing. Keep the good work going. And I think errors and mistakes keep happening, and that's okay. That's how we learn. So please, we start with patting ourselves by saying that, okay, we had a good morning and now we are nicely here talking to each other. So high five, guys. Let's start this. Give me a minute and I'll start the presentation. Okay, host has disabled participant sharing. So please, can that be allowed? Perfect. Is it visible?
Yes, ma'am.
Okay, give me a minute. Perfect. All right. So I wouldn't be able to see you all, I think, because I am on the presentation. I'm not really good with these Zoom sharing links. So yeah, so not wasting much time. Thank you very much again for having me here. I love speaking to students. I love interacting with them. So we make it a point, guys, that I don't know what is the discipline of this Zoom meeting, but they are allowed to unmute and speak. So irrespective, I would request y'all to make it a little interactive because it's the first session and I'm sure you'll have a long way to go. I might skip reading the chats. So I would request either one of y'all, the ones who are coordinating, please just keep me posted if there is anything that these guys would want to speak. Okay. Thank you for the lovely introduction. Very kind of you, Shaheen. Thank you very much. So starting with, I chose the topic of domains of psychology because I knew there were many students who were going to attend. And I was like, it's very important for us to know, apart from what are the theoretical domains, I put up that, okay, probably what all we can discover and basically what is the academic practice and research route towards psychology. Because this comes from a personal experience. While I was doing my undergrad, I actually didn't know that, okay, I will complete my bachelor's in psychology, but what next? And I think all of us are kept under pressure, right? Okay, what next? Abhi kya karna hai? Becoming old, this and that. Do we want to do further studies or no? So I chose this topic. So for the ease of you all, so you'll understand that how are we supposed to go about it. So moving ahead, hi guys. My first question I always keep asking is, how are you feeling today? So quickly use the chat box or unmute yourselves and quickly tell me how you are feeling today. Okay, thank you, Khushi. Good, happy, fresh, great, fresh, great, fantastic. Like so much of enthusiasm. Nice, it's really nice. Yeah, anxious and excited. Yes, I think because the pre-anxiety all of us have, like including me. I'm like, okay, I'm a speaker. Hope technically things work well. Hyped, yes, excited, all good, very good. Fantastic. So good to know. Incredible. Wow, Kavya, Ishita. That's my Facebook profile pic. I feel seen. Okay. Fantabulous, fantastic, energetic, nice. Now, as we are discussing that, okay, what we're going to do and what is psychology, don't we have this age-old question that we're always thrown with that, okay, why people do things the way they do? What do you all think, guys? Why people do the things they do? Quickly. So why people do the things they do? Passion, okay. Intrinsic motivation, okay. Achieve some goal, yes. Because of the beliefs, mindsets, experiences, yes. Because they've been conditioned into doing the way all the lives correct. Everyone has their own mindset, yes. Interest, yes. Because they get an intuition, yes. Beliefs and behavior, perfect. So why people do things has and numerous responses to it and reasons to it, right? Yes, of course, it makes them feel good. Social influence as well. Yes, correct. So that's like an age-old question. Repeating myself in here is exactly what psychology is all about. We usually are very curious to know what is happening, what is leading to what. And I keep saying, wherever there is a human mind, a psychology can be applied. A psychologist comes in play. A mental health professional comes in play. Okay, so moving further, for the domains of today's topic, I have, put them in 3 pockets. That is academics. Give me a minute. Yeah, that's education, practice, and research, as you all can see up in there. Now, when I'm talking, so I'll be speaking in depth on these 3 pockets, that is education, practice, and research, because these 3 are the domains as I see in the career of psychology. And being at a career summit, I have tried simplifying as much as I can. So education-wise, bachelor's degree is what I would, recommend people to have complete 600 marks. That is 6 papers in psychology. That is complete holistic specialization in psychology, because that helps and becomes a foundation when you're applying for your master's degree. Following with your master's degree, so now master's degree can be either done in a deemed institution, or then we have also universities, state universities that you can do it from. Guys, before I just go ahead, I would want to know that we have participants across India, right? Angela? Yeah. Okay.
And
Okay.
some also from Southeast Asia and the UAE.
Okay, perfect. Because here, when I'm specifically talking and addressing, I'm addressing these practice. Of course, I could take it national and international wise, but education wise, here I'm specifically, narrowing it down to the practice in India. Okay, your education academics in India. So I just want to give you all a thumb rule here. Followed by, thank you for answering that, followed by master's degree, that's your post-graduation, wherein a post-graduation helps you to understand in-depth knowledge of a specific specialization that I will come to it while I'm speaking about practice. Now, majority of us go with the flow and are understood that, okay, we have to do an undergrad, and after undergrad, we know we have to do a postgrad. What next? Now, when it comes to psychology, guys, I would want you all to read up the Mental Healthcare Act. The Mental Healthcare Act is what will help you all to understand, depending upon, what you all want to practice and what specialization you all want to take in. Because there are too many things coming up with our national education policy and our Mental Healthcare Act, that is 2017. I would want you all to read that up, because that puts us in different pockets as to what do we want to take up when we are practicing, and what is the degree required under licensing that we be allowed to practice. So MPhil degree under the NEP program has been cancelled, stands cancelled for now, but I would request you all to take in updates when you are planning to do your further education in the field of psychology. Then comes in PhD, that's our doctoral degree. PhD stands for Doctorate of Philosophy. Most of us, would have heard, because we do extensive research into a specific topic, and then move ahead with that, and then we get a prefix of doctor. But here I would want to tell you all that there is something called as PsyD. I don't know if how many of you all have heard about it or know about it, that this course that exists, of course, comes in overseas, but there are certain universities who are taking it up in India as well. Okay, have you all heard about PsyD? You all can use a chat box. Yeah, so Malik says yes. Perfect. No. Ishita says no. Yes. So no. So I see majority of no's, but some of yeses as well. So here, if I have to discriminate between your MPhil degree and PhD, there's a lot of confusion that begins in there, that after my master's, do I want to have work experience and get into my PhD, that is my research doctoral degree, or should I take up MPhil degree? Now, again, putting it in year after masters is preferable that we do a MPhil, because that again adds like a foundation to your PhD or PsyD that you're doing. Now, PhD stands for Doctorate of Philosophy and PsyD stands for Doctorate of Psychology. PhD is basically ideal for those in clinical practice, academic and research. Its central point and strong focus has always been on research when I'm talking about PhD specifically. When I'm talking about PsyD programs, international and overseas universities give a fantastic PsyD programs, which I think it's a tenure of 3.5 to 4 years. And there's hands-on, straightforward practice towards psychology, and is dedicating phenomenal time. Your phenomenal time of a dedication when you're doing your PsyD program goes completely towards clinical practice. And the one major difference between your PhD and PsyD is PhD works specifically on your research, whereas PsyD centrally focuses on your clinical practice. Now in India, if you probably Google the PsyD programs, there is NIMHANS and there is Amity University who's giving it in. So in case if you are interested, it will help you all to understand what the course is and how to go about it. So that comes in education with respect to your psychology. Now again, there are various different exams that you all will have to give in. Okay, Umang, is it okay if I take in your question in the end, if you don't mind? So I've kept the question answer. I've kept 15 minutes for question answers itself. And probably I can address all those. Yeah, thank you. Thank you. Yeah. So that's the difference between PhD and PsyD. Of course, when I'm talking about these degrees in education, I would request you all to figure out to read through the websites and to figure out that what are the entrance exams, because most of the private and deemed universities have entrance exams, which is not the case with the state universities. So keep an eye on when are the exams, and some of the universities also have a personal interview interview that they're taking in, and then they decide whether you all can be a part of the university or no. Nonetheless, when after you're completing your master's degree, and if you are interested in teaching in psychology, again we have different net exams, that is national entrance test and state entrance test, that probably you all can take it up if you are interested in teaching, because that's like a compulsory entrance exam that you all have to give in. And that also helps, and it's like a take point, check-in point, even while you're doing your PhD or PsyD. PsyD is not what I think it's not in the state university, like Mumbai University doesn't have it, but Amity has it, which is private again. So this comes, this is one pocket of education which I thought that, you all must know or probably can consider that how to go about it, and some more clarification than Googling it up and, getting all confused about the same. Then comes in practice. Then comes in practice. So practice, these are very traditional 4 practices that we have come, we are coming from. So that is clinical psychology, counseling psychology, industrial and organizational psychology, and social psychology. I also very much come from the times where these were the only 4 specializations, that was given to us, and we had to select from it. Now people think that, okay, clinical is in the top tier, or is the top thing in the hierarchy of psychology when it comes to specialization. But guys, that's not the thing. That completely depends upon what your interest is in, what is the population that you want to cater to. At the same time, how much are you willing to take up certain things that is beyond your threshold. So let's not put them or categorize them into an hierarchy that, okay, clinical comes in first, then comes industrial, organizational, and then comes social. It completely depends upon the wave. So being in the academic field as well, I have seen that completely depends upon, what the influence is on. So we have seen waves. That at times there is a wave where the clinical is high, where majority of the students want to take up clinical. Then we go down with clinical, and then industrial comes up, that everybody wants to take up industrial psychology. Okay. So now when I'm talking about these 4 specialization, clinical, counseling, industrial, and social, I will give you in brief what each of the area measures. So when I'm talking about clinical psychology, I also have my specialization in clinical psychology, where basically we work towards, mental health mental disorders. We follow the DSM-5, that is the latest version, and we help treat and intervene. And we do a lot of assessment, psychometric assessment, to understand that, okay, how can we hunch the diagnosis with? Okay, so that is clinical. Purely clinical population or clinical psychologists, or we see that they're working in the psychiatry, departments of varied hospitals. They might have a clinical practice of themselves, just the way I do. And they can also work in clinics or hospitals wherein, they're working with psychiatry, wholesome psychiatry as a specialization. Second, now one thing again, when I'm talking about clinical and when I'm putting in words like psychiatry, we do not have the license in India to prescribe medicines. With time and understanding and reading about medicines, there's an entire book that you all will be studying when it comes to clinical psychology, if that's a specialization. But we are not allowed to prescribe medicines, and neither we're allowed to comment to stop or taking medicine. So one thumb rule, guys, please remember. So that is what I would want to put in when I'm speaking about clinical psychology. Second comes in counseling. Now counseling again, so people say that I'm a counseling psychologist and I'm a clinical psychologist. It's as simple, it's counseling psychology. You are a counselor. Wherein here, if I'm specifically speaking about the state universities, you would be completely, you all have testing and assessments. Majority of the students think that counseling does not have testing and assessment, which is a myth. There are testing and assessment, probably not psychometric and diagnostic screeners, because that's a part of clinical, and you are given a different kind of training in that. But whereas when you are studying counseling, you are working with family relationships, you are working with students, you're working in schools, you're working in NGOs, you're working in institutions where it's required. But again, when it comes to counseling, anything that during the process of a counselor realizes that this requires clinical attention, and this is not probably working as a part of counseling sessions, she would recommend or refer, or he or she, the person would recommend or refer it to the clinical psychologist or a psychologist having a specialization in clinical for intensive therapy. Okay, there is a slight difference. People keep using counseling and therapy as interchangeable terms, but that's not the case. So that's with counseling. We have many school counselors. We have counseling people who are actually working and trying to create a difference in the society. Whereas clinical completely works on diagnosis and intervention, counseling is a little, how would I put across? It's not pure psychiatry, but that doesn't mean it doesn't get to deal with. But probably when it requires intensive intervention, of course, the counselor will make it a point to send that or to recommend to a clinical psychologist or a psychiatrist. Then comes in industrial and organizational as a practice. Again, a very, very upcoming career that these guys are taking up. They always think that, okay, they would be working with a human resource person, or do they have to do MBA? So it's nothing related to the HR department or the MBA. Industrial and organizational, basically as a counselor, you work in keeping the team building spirit together. Okay, so probably you will work on burnouts. You understand what's the employer-employee relationship. You understand that why is an employee probably behaving the way it is. At times when we are working in multinational companies or in an industrial setup, we know how taxing the job could be, because it's very vertically hierarchical. Like it has vertical and horizontals, which is completely very hierarchical and dominant in nature. So probably while we are working longer hours, of course, and then we as human beings also have certain things that we carry from home, and probably we are disturbed with the society things that is going on. So the main job over here of an industrial organizational psychologist would be to design different kinds of activities, to design certain kind of role plays, activities, games, to understand and to bring in better productivity of the organization. So when I'm speaking about IO, it's completely working through their stressful stressors or stressful situations that they are in, the attitude that they have, or probably the way they're presenting themselves. Ultimately, it is how to get in the best productivity and keep the team going stronger together. Next comes in social. Now, majority of the times people think, at least what I have interacted in my teaching academia with students, people think that, okay, when you do not get clinical, counseling, industrial, okay, let's go for social. At least we'll be called as a psychologist. And I don't know why social as a practice has always been very kept at the lower in the hierarchy. Whereas, guys, I would want to bring to your attention that social psychology, again, is a very, very upcoming, field. So, for example, social psychology is not only about psychologists who are working into NGOs and they're, trying to work at a lower levels. It's not that, or working with a MSW, Masters of Social Work. It doesn't really restrict itself to that. It is every human interaction with another. So there are so many people, so many advertising companies who are, or consumer advertisements that are actually hiring social psychologists to understand that, okay, how are a certain specific population is getting governed with everything that we're seeing. So it's the interaction with respect to the community, the society, and the study of it in the same forms. Okay, so for example, a fantastic group of social psychologists very recently had done a study about a group of women, why women as soon as they turn the age of 30, they complain of feeling weak and there is no strength in the body. And through which they took they had a completely different line of research that they took it up, and it was seen that because there was lack of vitamin D in the body. Now, vitamin D, of course, the main sources when we get it from the sunlight, we need to be out. But because right now we are so high on social media and everybody wants to look so picture perfect, no dark circles, no tanning, everybody wants to be fair, everybody wants to put up the faces, which is absolutely right for them. And that helped us, the group of social psychologists helped us to understand that how there was a positive correlation between lack of vitamin D and high demand of being picture perfect on social media, especially Instagrams. So this is a good checkpoint. If you are really interested in all of these things, please do not put down or put below social psychology, because it's fantastic. So there's so many concepts. I myself, being a clinical psychologist, try using it and try reading about social psychology. So social psychology is also a part of the curriculum in your undergrad degree in your second year in your introduction to psychology. That's your bachelor's degree. I'm talking about SYBA or SYBSc. You all can have a look in it. So that's about social. When I'm talking about 4 traditional practices, then comes in research. Why did I put up research? Is because people think research is only compartmentalized into quantitative and qualitative, and I would want to come here and bust the myth that no, research does not only stop to quant and qual. It has many other things to do. Okay, so for example, designing experiments, we have different kinds of experiments. So for example, when I gave an when I narrated the episode of the research under social psychology, was nothing but they designed an experiment to know that, okay, why is it doing so? So it's not only about discriminating into the, okay, we'll do quant, qual or case study, but okay, if this is what I'm curious about, I would take up a social topic, or I would take up a clinical case study, and I would probably design an experiment and then try to use it about, okay, how can it work and what is it doing? Second, analyzing psychological data. Analyzing psychological data means when we're doing different kinds of testing, we are using testing instruments and screeners. It's not only about doing the test, but we also need somebody who can analyze the data for us. Okay, where is it heading? What are we getting? What does the trend seem like? Okay, what age population is fitting in what? So basically, analyzing, interpreting, working through the normal distribution curve, figuring out the outliers, is nothing but analyzing the psychological data. And third thing that is very, very important, that is evaluating in quality and fairness of the tests. Now, when I'm talking about psychology, what happens is we have different kinds of tests and screeners, majorly paper pencil, but right now, I'm seeing a lot of people, who are trying to work and to get it online for us. Now, here, when I'm talking about quality and fairness, guys, I would want to give on a heads up that it does not include your Facebook, Instagram, and other online tests that we take up. You know, that, okay, what do you think you're good at, or what's your attitude, what does your body language have to say about you? It doesn't distribute that, because those tests, if you see, they are not fair, standardized, and validated. But whereas in the case of research, specifically under psychology, there are different tests that we use. We use psychometric tests, we use educational testing and assessment, we have personality tests, we have aptitude and attitude tests, we have IQ, that is cognitive tests. So there are various tests that we keep working on. So traditionally, they are normed, standardized, and validated in the, during the times when the test was, developed. But with time, there are different updates that we need. With time, there's different exposure that has been given. With time, we need to understand that how we have evolved and how the practice, or probably the questions that are put in the test, or what does the test have to measure, is reducing. So evaluating in the quantity and fairness, that means, is the test still measuring what it's supposed to measure, is what we looked at. So that's the part of research. So education done, practice done, research done. Now your research, when I'm putting in it, I am not only restricting to research as a part of your PhD. It can also happen as a part after your master's degree, when you're interested to work in any institution and to develop, to understand and analyze the data, basically playing with numbers. Even if it is qualitative, you're playing with numbers. Even if it's quantitative, you're playing with numbers. And even if it is a case study, you will have to put in that, okay, I saw X number of studies and this is what the trend that I have seen. This is with respect to your education, practice, and research. Moving forward, are you all with me? You can just put in a thumbs up. It's been 30 minutes that I have been speaking. Are you all with me? Perfect. Perfect. Fantastic. All right. Okay. So moving Thank you, guys. You are fantastic in responding. Great audience. Yeah, everybody who's raising their hands, if it's if it's with respect to your questions, please put in the questions. I'm sure Angela would read it for me. Yeah. Okay. Quickly, as it's been 30 minutes, can we do just certain kind of movement? Can we just stretch? Where are we sitting, or move our hands, or just stretch a little bit? We just feel more alert and more nice. Yeah. I did so. I want you all to do it too. Yeah. Moving forward, great. Moving forward, we have, I thought of also introducing to you all the emerging practices in psychology. Now, again, when I have put in these few words or few practices which are emerging in India, traditionally speaking, this did not have a super specialization or a or a specialization where you would be called as a developmental psychologist or a rehabilitation psychologist or a neuropsychologist. But right now we have many institutions who are taking it up. So after your formal studies or your formal degree in psychology, you all can actually take in a specialization into any of these. So these are the emerging, according to the statistics that I was reading through while I put up these emerging practices, these are the ones probably you all would be interested or would want to take it up. Again, it's very different for different states in India, and again how the private institutions are putting it across. Are they floating it as an elective paper, or are they floating it as a full-fledged course in it? Again, thumb rule, when you are picking up any of these practices as a part of your academics, I would request you all to do it from a known institution, UGC recognized, and probably even if it is deemed, but you need to know what is the course of study, who are the facilitators, and do they have the license to teach so or no? Because right now I'm seeing a lot of students who pay a good amount of money, to do REBT, CBT. The REBT is Rational Emotive Behavioral Therapy. CBT is Cognitive Behavioral Therapy. And they just want to move with the flow, and they're like, no, we'll take up this, we'll take up that. But then you'll need to remember that if you're doing those courses, do you all have the license to practice, or can you all call yourself as a trained professional? And what is the tenure that you all took this up? After taking it up, did you all just study about it, or could you all, have a hands-on training with the practice in it? So if I'm talking about the few emerging practices in psychology, just give me a minute. Yeah, you can keep the questions. I'll take all of them at the end. Yeah. Now, when I'm talking about developmental, so I've put in developmental, forensics, evolutionary, environmental, sports, followed by engineering, health, rehabilitation, neuro, and educational. So right now, because of this pandemic, you all would have heard a lot of trauma-focused, trauma-informed therapists as well. Now again, here, when I'm speaking about trauma-focused, trauma-informed, we did not have any paper, or we did not have any super specialization that gave us the right to be calling us that we're trauma informed therapists or no, because you have to stick and abide to what comes in your degree, what is on paper to call yourself. So my degree says I have my master's degree in applied psychology and my specialization is clinical. So I would be calling myself exactly like that, and I wouldn't be putting myself that, oh, I'm a clinical psychologist, because that, according to the new policies, they have discriminated us because we are from the UGC and we're not from the RCI. But yeah, you need to stick and abide to what your degree says, and you got to follow that. Does not mean because you floated one paper and you have more interest in it, that means okay, I'll call myself as a sports psychologist. Doesn't work like that at all. Probably with time you can understand what your expertise lies in. Like psychology has a spectrum. You can understand what your expertise lies in. So probably I have done my MA in clinical. I've understood that I am more interested into the evolutionary part under it. So probably I can say that my expertise lies in evolutionary psychology, but my degree and as a practitioner, I have to put in psychologist, the specialization in clinical. So please guys, I think it's high time that we play fair on our terms. Even right now, I know as many people are helping under the pandemic and under the COVID-19 scenario that there are way many mental health professionals. But it is important for each one of you to ask, and important for each one of you to know that, okay, who is a psychologist, what is her or his degree, and what is the expertise. If you all are asking that, you'll also have to be ready that when you all come in full-fledgedly in the practice, this is how you all would be introducing yourselves to. Okay, so developmental psychology, if I'm specifically talking about, they understand on a lifespan that how humans develop, what's the age, what is the cognitive development, what is the emotional development, what is the language development. So they completely study the developmental. So my clinic, so it aids in psychiatry and neurodevelopmental pediatrics as well. So as a part of my psychiatry, when I was in one of the municipal hospitals, I also served as a psychologist in the neurodevelopmental department. So neurodevelopmental completely has children as a population, therapy with them, testing with them, understanding the lifespan, the growth of completely in the developmental aspect. Second comes in forensics. I think many of these students these days are interested in taking up forensic psychology. So it's basically about understanding in a legal perspective, understanding into investigation, understanding that, okay, what would have led to what. So that's forensics. Again, in India, there are amazing universities who are giving in a full-fledged degree as an MA degree only in forensics psychology. So I think Gujarat University is doing a fantastic job with it. So probably you all can read on it. Followed by evolutionary psychology. Now, as a student, I remember when I was taught as a part of my university curriculum, I was very passionate and I really liked the subject. I wanted to know that, okay, how brain is the oldest and how brain has unconscious, subconscious, and conscious levels, and how it can have an impact, and how we have developed through years together, and then how we got into communities and how it has an impact on our overall development. Evolutionary also had one of my favorite topics, that was your preference, survival of the fittest. Darwin comes into the picture. How anything that is attractive can have and hold more attention of you as compared to something that is not very attractive, and what are the preferences that we see, like while I'm selecting a mate, how unconsciously I, would discriminate that, okay, this is the kind of a person I want to date, or this is the kind of a woman I want to date. So that's what about evolutionary psychology is. Environmental psychology is a very upcoming thing. My professor from the University of Bombay, Dr. Vivek Velekar, he's doing a fantastic work when it comes to environmental psychology, where we study how it has an impact on the overall human beings. So if I have to put in, there was under environmental psychology, I read a research paper that said that how different kinds of seasons and how different kinds of environment can have an impact on our overall well-being, your thinking, your problem solving, your decision making, your overall processing as a whole, and how it can have an impact on you as a whole. Then we have sports psychology, resilience, endurance. I think Morel is doing an entire presentation on it. I think she's scheduled for tomorrow, so I will leave that on her. She's fantastic, and she is a sports psychologist herself, and how she has specialized into completely working into sports, and what is the role of a psychologist under sports. So that's again a very upcoming subfield under psychology that is coming up. Then we have engineering psychology. Engineering psychology, not many of you would have heard of, but the APA, that is American Psychology Association, has put up engineering as a subfield, as a very upcoming subfield, because everything, if I have to take it globally, we are all getting online. We want to get easy access. We have machines in front of us. We are working on it. We want to reach out to people overseas. So how a machine, like even right now when I'm talking, how a machine can have an impact on my cognitive functioning as a whole. Okay, or people who are working day in and day out with machines, listening to a certain screech, listening to a certain noise, completely being online. We have no paper pencil, we want to do tests online, we want to reach out people online. So how that can also have an positive as well as an adverse effect in understanding the human behavior as a whole. Health psychology, again, understanding the health is very simple, works with physiology of the system and the psychology of the system. So psychosomatic, like how the mind, how your psychosomatic is how your mind can have an impact on your somatic, that is soma, that means body, how your mind can have an effect on your body. So that's what about is under health psychology. Rehabilitation psychology, so we also have palliative, we have rehabilitation, to understand that okay, after you are done everything clinically, to understand and work onto your maintenance is where we have psychologists and counselors come into picture. Neuropsychologists, again, a lot of people whom I know who call themselves a neuropsychologist, but again, important for you all to know that, okay, have they specialized into it is basically understand and reading through your EEGs, PET scans, MRIs, fMRIs, and putting that how certain brain activity is, functioning at, what are the areas that are getting highlighted when a certain problem is given. So it's working through readings of EEG, PET, MRI of the brain and trying to analyze those. And educational psychology, again over here, education is basically school counselors. So when I'm talking about education, which is a broader umbrella, does not only work where you have to work with children and you're working in a school, but education also means that, okay, how age appropriately, what curriculum can be set age appropriately, what is the attention span and when do we have to design or put in breaks for students in the school. And also catering different kinds of behaviors, screeners, parent-child relationship, and teacher and child-student relationship comes into the play. And also how under education, how different teachers and different specialized academic people can improve the teaching styles and make it more conducive in the setting that they have for children to learn better. So these are the emerging practices that are coming up in psychology in India, and it's really nice to know that there are people who are taking it up. Yeah. Moving forward, I think I've covered it all. Yeah. So I always like putting in certain questions after I do immense amount of talking for like 45 minutes now that I have been talking to you wonderful people who are listening to me. So I always want to end like, okay, there are 3 questions that I would want you all to answer to yourselves. One is, what makes me me? That means what makes me as a person, or what makes Vishakha. Okay, so probably you all can ask yourself that. So for example, if I have Shaheen, sorry, I just read your name first. We'll be like, okay, Shaheen would want to answer, okay, what makes Shaheen Shaheen? That's question number 1. This is like a homework that I want you all to do for yourself. Question number 2, what am I doing of all the information post attending and listening to experts in the field? Like, I remember as a kid, again, a very personal disclosure, I used to get really very confused. I'm like, okay, these guys are so good. I used to also feel pressurized at the same time. Okay, will I be able to do what they are doing? Will I be able to create a mark or no? I still want to study. But guys, here, when I have put up, what am I, doing of all the information post attending and listening to experts in the field, is that I just don't want you all to, passively listen or actively listen. I would want you all to do something. I would want all to take away certain information. I would want all to work through of all the information that you all are getting in. That's very important. So please answer that to yourselves and see that, okay, where it is. And again, if majority of you all right now are students, one request as a clinical practitioner would be, please study. First, get your academics in place. and then get into working and interning and observing or under mentorship programs. But at least first finish studying what you have to study. Get your concepts, get your knowledge in place. And I'm sure there are people out in the fraternity who would want to help. And then you can have your experience in it. Because I know a lot of people who are undergrad and then they'll call me and tell me that, hi, I want to work with you, ma'am, please a 4 more date. And I tell them that, I know age is just a number, but we have certain age that we have to play according to it. So for example, if they want to come and do observership under me, and if I'm clinically practicing and seeing, varied amount of patients on a spectrum of psychosis to neurosis, and that person might not still have the ability to take it up because the person might not know what I'm doing. So please guys, get your academics, in hand first, and I'm sure there are people who would want to help you. So answer that yourself. I'm again repeating, what am I doing of all the information after attending and listening to the experts in the field? And the third question to yourself again is, how am I going to make a mark and create a difference as a psychologist? Whatever may be it your specialization, but how am I going to make a mark? What am I going to do? Why do I want to take up psychology? And how am I going to create a difference in whatever is my specialization? Because I'm working with human behavior at the end of the day and all the interactions that they have. Okay, how am I going to create a difference? Yeah, I think I'm very much on time because I had kept 15 minutes for the questions, to address all your questions.
Thank you so much, ma'am. It was a very relevant presentation for every psychology student out there. So I would, without wasting any time, start with the questions so you can directly answer them.
Yeah.
So the first question here is, what is the difference between MPhil and PhD?
Okay, so MPhil is again a degree that that's your Masters of Philosophy. Yeah. So your MPhil degree won't give you. So when you're doing your MPhil, that can become your foundation to your PhD. It has a curriculum that they follow that you want to do MPhil in what. Whereas PhD, you decide what you want to do research in. So that's like a striking difference between the both. Now again, MPhil is only a 2-year program with a designed curriculum in different universities. Whereas PhD, again, you decide what topic you want to take it up, and it's an intensive research that you do it by yourself, and you are allowed and you get in a degree as your prefix as a doctor because you have done intensive research into the field. So again, your PhD does not have a designated tenure, goes anything between 3 to 5 years. But MPhil, there is a course, there's a syllabus that you have to follow that has statistics as a part of it, and that just helps you to do your PhD as a whole. So yeah, if that answers your question. So MPhil has a curriculum, has a syllabus, design, structure. PhD, you get to do what you want to do.
Okay, great. So there are a few similar questions which I'd like to combine. So basically the question is, after masters, can we directly do a PsyD course? Or what is the work experience that is required to do a PsyD course? Like, is there anything required after masters, or directly we can go opt for a PsyD course?
Okay, so technically after masters, I would personally suggest that you all take in some experience, because your masters gives you probably not a complete hands-on training, but you know what your specialization. So masters gives you a specialization, correct? So later on, you also need to apply, right? Everything that you have theoretically learned, you need to apply. So I remember while I finished my masters, I always thought that I'm excellent with kids and I'm very good with kids, until I realized that, okay, I am good with kids when it comes to testing and assessment, but probably I'm not very good with kids therapy, because they are just so cute for me to, get them crying or make them unlearn their behaviors and turn them into learning. So I realized with time that, okay, that's not my expertise. Probably, of course, when I'm put under pressure, I might want to take it up, but I always do a referral when it comes to child therapy, is because I know that probably I do not have expertise in it. So please take in your experience, understand, try to apply. So we have so many schools of thought under therapy. There is like we have psychoanalysis, we have cognitive, we have existential, we have marginalized. So there's so many schools of thought. You try understand that, okay, where are you comfortable working with, or are you just eclectic? So although I'm very very psychoanalysis at my heart, but I again tailor it very much as per what my patient or client needs, because the generation now specifically is very CBT oriented. They want evidence, they want to cognitively rule it out, they want to know why they are feeling what they're feeling, they want to know what they're thinking, why they're thinking. So if I have to tell such a patient or a client, okay, now please close your eyes and tell me whatever thoughts are coming to your mind, I might do harm to them. And the least, if I can't do good, at least I do not want to do harm to them, right? So please take an experience. And again, for PsyD, after masters you can take it up, but completely depends upon what institution you're taking it up, what university, and do they have any entrance test or person interviews followed by the entrance tests. So yes, if that answers your question, take up a 2-year experience after your masters. You have been studying, understand what you want. PsyD is again very clinical, but again, to understand or do it or taking it up PsyD, I wouldn't want your guide to mentor you. You know what, that I think you should be doing a PsyD in this. You all should be the one telling your guide that, you know what, I want to have my clinical expertise into it, right? So understand.
Yes, so that's correct. So as you mentioned a bit about child therapy, there is a question related to it. Do we not have child psychology as an engaging practice? I guess basically it's about the scope of child psychology.
Okay. So there is so educational again. So when I'm talking about child psychology, there's education that comes into place. There is developmental that comes into place. That comes behavioral therapy that comes into place. So again, the specialization when you're talking about child psychology is depends upon your expertise. So after you completed your masters, and if you're taking up certain courses that completely cater to child psychology, it completely helps, because I think that's how children, you start working with children and the vicious cycle, you can try to break the vicious cycle of thinking and parenting and understanding that, okay, are parents doing harm or are parents doing good, or are they trying to put their conflicts and their pressures onto the child. So again, child psychology, I don't think it is a part of many curriculum or syllabus. Developmental psychology is, but child psychology again could have a course. There could be a licensed or there could be a validated course that you can take up. जैसे कि certificate courses है, where they will just teach you that, okay, what all comes in a child psychology, what are the different coping strategies under child psychology, what are the different behavioral modification schools of thought that work under child psychology. So yeah, you can do develop. So if you want to practice into or becoming into child psychologist, I would say that take up floating papers such as behavioral therapy, take up floating electives such as developmental psychology. All of that will help, because even in the clinical practice, I think there are barely 30 pages of neurodevelopmental disorders, and then we completely go to mental disorders, like complete full-fledged psychiatry mental disorders. Because when I'm talking about child psychology per se, here comes in the role of both a developmental pediatrician and also a psychiatrist. Because even under psychiatry and clinical practice, we do study neurodevelopmental pediatrics. And because again, cognitive comes into play, right? Cognitive behaviors, whether it's age appropriate or no, developmental milestones are age appropriate or no. So depends upon what is the presenting complaint. I myself root out that, okay, do I need to bring in a psychiatrist into this, or do I need to bring in a pediatrician? Like all of us would have heard a pediatrician, but yes, we have a super specialization that calls, which is a course that says that, no, I'm a neurodevelopmental pediatrician. So that completely helps.
So there is a question that says, do we need a science background for clinical psychology, thinking of PhD and or PsyD?
Okay, fantastic question. I think parts of America and even parts of India gives psychology under BSc. So if you go down south, they do give in. They do, some of the universities do give in BSc in psychology. So science, of course, I wouldn't say that it's any different, but it probably just might help to understand the physiology. But again, science is only for the first 2 years, right? Your FIJC and SYGC. And after that, of course, you have psychology. So again, depending upon that, if you want a BSc, you can go down south. Otherwise, majority part of India is giving you a MA degree. So there is absolutely no correlation as such that I can say that okay, science is going to help you to do your PsyD or to do your psychology, because for undergrad anyway you have to take up psychology. So yeah, now that under psychology depends if you want to take up MA in psychology or BSc in psychology, but your science is just going to help you for the first 2 years.
There is a very inquisitive question for maths lovers. What is there a connection between mathematics and psychology?
Oh my God, there is a connection between mathematics and psychology, because probability comes into picture, research comes into the picture, quantitative analysis comes into picture. So Dr. Vivek, whom I'm talking about, he is doing amazing research in consumer psychology. He has a team, or he is a psychologist. He has a team from he has a student and a team from economics department as well, to understand the statistical analysis, and also a student from mathematics department, which will help us to understand that how quant can come into play. So yeah, mathematics and psychology, although we are taught that I was very weak in math, yeah, hence I took up arts. But guys, to give a reality check, we do have a fully fledged statistics paper. Of course, stats and math is different, but again, for me, if I have to put up, I think wherever there is numbers, I think math just comes into play. So even if I have to put up stats, for me that is math, because there are numbers. So yeah, so math can help you with statistics and research. It will just give you an easy way out.
Okay, that's great. So there is one more question that asks about the difference between PhD and PsyD.
Just did that. Okay, so PhD and PsyD, when I'm talking about PhD, completely revolves around research with numbers, taking in one topic and just trying to focus on that. Whereas PsyD gives you a hands-on training. It gives you a hands-on training only and only very, very goal-driven and specific to clinical practice only. So that is the difference between PhD and PsyD. Like here, probably I might have my 4 years of collecting data, understanding, interpreting data, what to do. But PsyD is application of your all psychology that will help you and put you in different compartments to understand that, okay, this is how I'm supposed to do, and understanding of the application. So completely clinical driven. And whereas for PhD, it's completely research driven.
Okay, so there is another question about neuropsychology and its career expectancy.
It's good. It's good. Neuropsychology is good. So I remember I didn't have the opportunity, but my professor back then, she had given us this example that how a neuropsychologist comes into play, especially when we are doing, especially when we are working, in a population where there is an accident or a trauma that has happened, and to understand the pre and post. So I remember personally interacting with a neuropsychologist who was placed in a surgical department, because there was long hours of surgery done, because there was a case of accident, and just to understand the pre and post of it, that okay, if I'm asking this question, what areas in the brain is getting activated, and probably what is the probability that this person might remember, or what is his orientation to time, place, and person post surgery. So we do have something that connects, right, your left hemisphere to the right hemisphere. So in cases of accidents, in cases of amnesia or delirium, okay, when there's a lot of forgetting that happens, and then that requires intervention, probably post your accident or post your trauma, how the different nodes and how the structuring of the neurons is impacting your overall being. So yeah, that is a very good thing. It's my personal favorite too. And I think IIT Bombay That's the Powai one is doing a fantastic job, because they have different courses only for psychologists, where they teach how to interpret PET, MRI, fMRI, EEG, and all of it. So even in cases of epilepsy, like, okay, when you are getting a seizure, okay, how so when you're doing the EEG before, how it was when the child was born, then you have an attack, you have epileptic attack, and then you understand that how the entire brain has changed. So with epilepsy, with substance, so right now, there are a lot of people engaging in a lot of substance, alcohol, so all of that will help us to understand. So yeah, it has a great scope in it if you know how to utilize, and if you have your knowledge in place. So first study and then get into this entire racket of work experience. So yeah.
Okay, thank you so much. So there is another one question which asks about people who don't have a background in psychology. How can they pursue a career and become a psychologist or psychiatrist with giving skillful certifications?
Okay, so psychiatrist is absolutely not possible, because that's a complete full-fledged program that you have to do your medicine, that is your MBBS, then you have to do your residency, then you again have an entrance exam, then you do your MD in psychiatry, or you do your DPM, that is Diploma in Psychiatry Medicine. So psychiatrist is absolutely not possible, because it requires science degree and your MBBS and MD in place. But whereas for psychology, there are some distance open universities, just say we have IGNOU, Indira Gandhi Open University, that is giving in your degree, your master's degree in psychology. They are not asking any back history that for taking up the course, but I would suggest that please take in a full 2-year integrated course as compared to these open university courses, because they come with their own lacunas. And I think right now we have to fairly understand between people who have got training. Like, I have been trained for 7 years. I'm practicing since good amount of years. Okay. And of course, there would be a difference, because I have been studying psychology right since the time I entered my college, that is my FIJC, till my master's. And then I have to keep updating myself with different, courses. So yeah, you can take it up, but again, when it comes to practice, there is a lot of licensing that comes into picture. Although India does not have licensing under psychology, but soon we are working towards it. Soon we are. So there's a lot of things that is happening. So yeah, we'll come in peace with it, or come in terms with it very soon.
Yeah, so last question I'll ask. There is a person asking about the scope of psychology in military. So if you could follow it with a recommendation of books for psychology lovers.
Okay, so if I have to tell you military, I myself, so although I did my specialization in clinical 2019, I think I was only moving across peace locations in India, where I took up mental health workshops for our Jawans, like amazing 1,500 Jawans, nicely uniformed and sitting, and I'm talking to them, and I feel so little in front of them, because they come with so much of power, strength, and discipline and decorum. And so I did for Jawans, I did for officers and their wives. So this is what I did as a complete gratis. When I mean gratis, was pro bono from my side. I thought I would want to go and help. But of course, under Army, you please log on to ADGPI. ADGPI will help you all to understand that what are the different, you can become a psychologist, because they also have in-house psychologists which completely are trained to work with endurance, power, understanding everything with respect only and only to Army. So you all can take that up. That's a full-fledged course. They also teach you, they have a different curriculum that they follow altogether. So yes, there is a lot of scope. There is a lot of scope. So yeah, and that's my personal favorite too. Of course, I can't go back to Army, but of course I can serve in little what I do, and that's what I have been doing since 2019. Yeah.
That's great to know, ma'am. So basically, we are here done with questions. You can end with a certain recommendation of books. There are many people asking for that. Your favorite
recommendation of the books, I think, is the last thing that I would do, because I always feel I do not like recommending, is because then there's just this passage that will follow that, what I had heard and I think I would want to do it. I would want y'all to find out. I would want y'all to know what I want to read. I would want you just start as simple as that. Okay, I'll give out a homework to do. Take the newspaper, open the newspaper, okay, and just try interpreting different figures in the newspaper. So if you probably see one actor, one actress, or you see there's a journalist, who has a straight face, or you see that they're showing in some image, just sit and start interpreting those. Start with that. So I wouldn't want to recommend any books because I wouldn't want you all to be influenced with what and how I read, because I might have a complete biased opinion because I'm from clinical. But you all figure out that for yourselves. And of course, I'm easily available. You all can find my clinic account on Instagram. That is Astitva Clinic, ASTITVA clinic on Instagram, and you all can follow that, because we keep putting in, it's a very small community that we have, because we actually don't work a lot on social media. I think I would have figured that out. I'm not very easily available on, Google too, apart from the work I do. So yeah, so I'm not going to recommend that to you all. You all start with the simple homework that I give you. Just open Times of India, Hindu, Indian Express, whatever, and start doing that and figure out that, okay, how are you all interpreting the human behaviors and what you're like. I think that is learning, It's very easy it's very easy for me to come and speak and to tell you all what I have been doing, or this is what you all can pick it up, because probably I, realized that when I had to, I didn't even know I would be taking up, psychology, and I'd be taking up, clinical as my specialization until I was in my master's program. So that, of course, doesn't mean that I want you all to do that, not in that context, but it's important for you all to be, explore, for you all to get curious, for you all to know that what you all want to decide on yourself. Because the least I would want to practice is influence. Because even when I see Instagram right now, I know I'm speaking to the generation of people that probably I don't fit in, and you all might not like what I'm saying next. But there is a difference between when you are a mental health influencer, and there's a difference when you are a mental health practitioner. So, this is what I just realized with time, that, okay, I know we are trying to be with the trend and we are trying to be at every pace of time. But yes, there is a difference, and you need to understand that where you want to. And it's not important to fit in, okay? Design your pocket, fit in your own pocket, understand that, okay, this is getting too comfortable, move out and try something different, because there's always a scope to create new mistakes, to learn from it. But at the same time, being liable that, yes, I have committed this mistake, and okay, how can I rectify it and make it better? So, yeah.
Totally fair, and that what you said about influencer and practitioner, it's so relevant in today's time, especially with social media coming up with so many mental influencers.
Yes, it's like it boils my blood too, when I see, and I'm like, okay, guys, I think it's great that you are moving with time. You're like taking in social media where it has to be. But yeah, where is the content coming from? What is the validity of content? Then I just know one person, sharing it. Then there are everybody who follows the fleet. And then I'm like, okay, at least just pause, reflect, figure out what you want to do for yourselves. So yeah, do that. Explore, guys. There's a lot of scope. Anywhere there is human mind, there is human behavior, there is a psychologist that is required. Just create yourself, build yourself first, and then probably there are a lot of people that can come. I'll mentor you all. Okay, no problem. I'm there to help you at any given point of time.
That's so relieving to know, ma'am. So thank you so much from me and my colleagues. And I'd like Shaheen to present the certificate and thank ma'am from the team of CG School of Psychology.
Thank you.
Thank you. Ma'am, that was a wonderful, wonderful oration.
Thank you,
I'm pretty sure all of us here thoroughly enjoyed your very informative session, because I definitely did. As a token of love from our side, it is our honor to present you with the e-certificate. I kindly request the technical team to please display on the screen. Thank you. Ma'am, please note that the certificate will be mailed to you shortly.
Sure.
Last but not least, thank you, ma'am, so much for being here with us today. And now I would like to pass on the dice to our next MC. Over to you, MC Andrew.
Thank you. Thank you, each one of you, for being present. Thank you so very much for having me. And just thank you. Have a fantastic day ahead. I would wait for some time and then I might leave because I'm in the clinic. You have to see my mask. I have, people to see. So I might take a leave. I'll wait for a few minutes, and good luck to each one of you. Please take very good care of yourselves. I'm not the ones who will discriminate mentally or physically, but yeah, just take care of yourselves. That's important. Yeah. Bye, guys. Take care. Thank you, Ria. Thank you, Shaheen. Thank you, Angela. And thank you, everybody, for being present. Bye.
Thank you, ma'am.
Okay, with that, let's quickly move on to our next speaker. I'd like to call upon Andrew to introduce to us.
Yeah. Good morning, everyone. This is Andrew Pope from 3G. Well, the next speaker is Dr. Meera Pade. It's my privilege to invite our next speaker, Ms. Meera Pade. She is an assistant professor at the University of Hyderabad. Her area of expertise and development and educational psychology, health psychology, and she has 24 publications to her name. She has worked on a research project funded by the UCG called the Indian Scale of Adherence Wellbeing. She has a doctoral thesis about adherence and quality of life of patients with type 2 diabetes. That's role of psychosocial factors. She has worked in the field of leisure motivation and well-being among adolescents and young adults. Now, I would like to welcome Meera ma'am to enlighten us with her knowledge and wisdom. So, ma'am, just a small reminder before we start. Before your speech could end, we'll just give you a short buzzer to just, just inform you that, your time of speech will end, and a long buzzer once it's done. So welcome, ma'am. Thank you so much.
Thank you so much, Mr. Andrew.
Thank you, doctor. Thank you, doctor.
Welcome all the participants of Crazy Psychology Career Summit Encyclopedia 2021. I will start my lecture with a quote: "He that will not apply new remedies must expect new evils." So I believe the investigation and application of positive human development in a new perspective that is needed now more than ever. So the topic I have chosen is Indian perspective of health. So it depends on I like to interact more while teaching also. If I get more questions from others, I like, as a health psychologist, my focus will be on health. And though I am teaching it is our department is the only center in India which offers degree in health psychology, MSc degree in health psychology, and we have integrated degree, MSc, we have PhD degree course, we have MSc course. So that is where I thought I will give some information regarding the health psychology. So instead of talking about the Indian Western perspective of health, I thought, why not Indian perspective of health? Whatever we teach, always we carry from the Western perspective. Now these Western people, they have taken our concepts, and after that we are following. I will give you the examples later. I have prepared more PowerPoints. I don't know if you need also, I can skip. So my first question, are you healthy? Are you healthy? What do you mean by health? What do you mean by health? If I ask a question, immediately people say, Madam, I am healthy. I don't have any diabetes. I don't have any hypertension. I don't have any illness. But does it mean that we are healthy? Actually, if we analyze the word health, what does it mean? The health, if we talk from the WHO's definition of health, it is the complete state of physical, mental, social, and spiritual well-being, and not merely the absence of illness. So when we talk about this health, what does this state of physical, mental, social, and spiritual well-being? My research area is well-being and quality of life. Before that, because Mr. Andrew introduced me, I would like to share a very good news that my topic, leisure, has been they had invited, and it has been accepted in Willie Blackwell's encyclopedia, the leisure for adolescents. Okay, so coming to the point health, there will be an interaction. I will keep more time for interaction, though I have a lot of PowerPoints for me to teach. Not to teach, but for the students, so that they will enjoy. So that is why when we talk about the Indian perspective of health, I thought, why not? I will talk about the Indian perspective, because we are not giving more importance to the Indian perspective part. So that is why our center offers Indian psychology, health psychology from Indian perspective, and a lot of people from India. Now Professor Girishwar Mishra, Professor Dalal, who recently died, Professor Ramkrishna Professor Ramkrishna Rao, they have done a lot of work on Indian perspective of health. So coming to the point of health, when I ask you whether we are health and not, people will say, no, we don't have illness, but I am healthy. It does not mean health and wellness, or health, illness and wellness comes in a continuum. They come in a continuum. On one side we have illness, and the other side we have wellness. And the middle point is we are healthy. So shall we then, I will share my PowerPoint so that it will be easy to, 1 minute. How to share? Is it visible?
Yes, ma'am.
Okay.
Yeah.
So when we talk about the Indian perspective of health, as I told you, I would like to focus more on Indian perspective of health. So when we talk about the Indian perspective of health, I request everyone, if by chance, if you feel no, these are not needed, I will skip those points also. But there is a problem. It is covering my PowerPoint. This how to adjust? Okay, 1 minute. I will. A sound body is the veritable instrument of the pursuit of the law. So when we have to find out, we have to maintain our holistic health. When WHO is defining health as a complete state of complete physical, mental, social, and spiritual well-being, it gives the importance of the holistic aspect of the body. So before that, when we are talking about the biomedical view of health, we are talking about the dualistic culture. Body and mind are different aspects. Both are different. Body does not influence mind, and mind does not influence body. But it does not. So when we talk about that body and mind relationship, according to Ayurveda, when we talk about the Indian perspective of health, Ayurveda talks that yes, body and mind are both influence each other. So we are not talking the dualistic aspect of the health, but the monistic approach of health. So 1 minute, why something creating problem about this, my laptop. Yes, now it is not a problem. Then comes the swasth. What do you mean by swasth? When I talk, sometimes my students, when I teach them Indian perspective of health, when I teach them Indian psychology of health, sometimes they say, Madam, it is difficult for them. I tell them, see, we are Indians. We have to give importance for the Indian perspective of health, because everywhere now, so many Western psychologists, they have written books, they have taken our construct, they have written so many things regarding our Indian concepts. So that is why I always prefer we should give importance to the Indian perspective of health. When we talk about from the Indian perspective of health, we call it swasth. What does it mean? When we call it swasth, the swasth consists of two aspects. One is swa, self, and stha means abide. So when we talk about it is the self-abiding state in which body and mind are at ease in natural equilibrium. When there is a balance between the body and mind, then we can say, yes, we are healthy. So, according to Ayurveda, we have two main goals. One is to maintain the health of the healthy and to heal the sick, physically, emotionally, mentally, and spiritually. You will like if I say something when we are talking from the biomedical view, I cannot say we cannot deny the biomedical aspect. When we talk about the biomedical aspect, you might have heard the word Asclepius. The Greek mythology, when we talk about the Greek mythology, Asclepius, the father of medicine, he had two daughters. One is Panacea, one is Hygeia. What does Panacea means? It is the remedy for any or every illness. When we talk about the Hygeia talks about the promotion of health. So the two daughters' name were Hygeia and Panacea. So on that basis, if we say it is not the Greek mythology, if we say our Ayurveda goes back again, if we say 1,000 years back, we are also talking about the promotion of health and prevention of illness. So according to Acharya Susruta, we have that there is a sloka. If we say Sama dosha samagnischa samadhatu malatkriya prashanang indriya manaha swastya iti avidya. What does health means? What does health means? And it is an established sense of self. It is a balance between three dosas, Vata, Pitta and Kapha. It is properly from dhatus, plasma, blood, muscle and fat. And efficient elimination of malas, it is the waste products. And well-functioning bodily processes and a blissful mind. So, Shama dosha shamagnischa samadhatu malatkriya prashanam indriya manaha swastyaiti avidyate. You cannot say that I don't have any illness means I am healthy, but we should be a blissful mind, soul and sense. The Anandamaya, I will come to that point also when we say Ayurvedic medicine. When we talk about the Ayurvedic medicine, it recognizes each individual is different. When we go to a doctor, when we are going to any doctor and Ayurveda, they will take your history, they will take your the genetic, hereditary aspect and everything, then they will provide you medicine. So the knowledge of Ayurveda consists of 5 elements and 5 dhatus. So when we are talking about 5 elements, it is called the Pancha Mahabhutas. These Pancha Mahabhutas are space, earth, water, air and fire. And that gives rise to 3 types of doshas, Vata, Pitta and Kapha. So if we talk about that, when we are talking about, as just now I told you, our body consists of 5 koshas, 5 layers. One is Annamaya kosha, second is Pranamaya kosha, third one is Mannamaya kosha, fourth one is Vigayanamaya kosha, and fourth one is Anandamaya kosha. So what do you mean by Annamaya kosha? It is the layer, it is the body, it is the physic, it is what we need for our body, the food. What do we mean by Pranamaya kosha? It is the air, breathing. Without breathing, it will be. Manamaya kosha is your psyche. And Vijnanamaya kosha is the intelligence. And Anandamaya kosha is your bliss. When we talk about this, there are 3 gunas, Sattvic, Rajasic and Tamasic. These 3 gunas play an important role in the development of the individual. And these are the primary personality aspects of this. So if we go, there is a chapter on personality by Professor Das. You will see how he has nicely explained about these 4 pancha koshas and 3 gunas, about the personality aspect of the individuals. And if we talk about the 3 doshas, they are Vata, Pitta and Kapha. So these are the Pancha Mahabhutas, and these Pancha Mahabhutas, Akash, Vayu, Agni, Jala and Prithvi. And how we get this The modality of perception is hearing, touch, vision, taste, and smell. And all these are our 5 sense organs associated with that. I have prepared a lot of PowerPoints. I think I will skip more because I will give more time for interaction. So these 3 doshas, when we talk about these 3 doshas, what we talk about these 3 doshas? These 3 doshas, when we talk, one is Vata, one is Pitta, and Kapha. Vata is the initiator. It is the promoter or biological activity. Pitta is responsible for generation of body heat and certain psychological attributes. And Kapha is also attributed to physiological and some psychological features. So when air and space are linked together, it gives rise to Vata. When fire and water, it will give rise to Pitta, and water and earth, it will give rise to Kapha. And depending on these aspects, we have different types of personality and we will get different types of illnesses. So that is what, when we are giving importance, we as a biomedical viewpoint, we will not give only importance to the aspect how doctors, they ask you what is your problem and they will provide you the medicine. It is not like that. Each and every aspect of our personality, every aspect of our different psychological factors we have to take into account. So there are the gunas. When I talked about the gunas, there are 3 gunas. One is sattvic, rajasic, and the gunas are sattvic, rajasic, and tamas. You know, all of us, we are talking about the sattvic, the purest of anything. Then comes the rajasic, it is the energy, and tamas is inertia. So when we talk about one Sanskrit shloka, I know that when I teach in my class also, students say, they look like oh, I am talking to a deaf. No, it is not like that. Urdhvam, I will tell you in a simple way, Urdhvam gachanti swastva, madhye trishtanti rajasah, jaganya gunavitishta, odho gachanti tamasha. So it is those who are established goodness rise upwards. And the passionate remains middle, it is the rajasic. And the dull step lowest, it is the tamasic. You know, depending on our food habits, depending on our behavior, we will develop that rajasic, tamasic, and sattvic behavior. So that is why people already, you know, and we have talked about more on the sattvic aspect. Now people from Western also, they are giving more importance to these 3 gunas. So when we talk about the health aspect, we have to talk about what are the important factors which influence health. One is, in order to maintain a good health, we should have ahar, nidra, and brahmacharya. It is not like that. It is when we talk about I told you from the beginning, we are giving importance to the monistic approach of health. When we are giving monistic approach of health, we should take into account both biological and psychological factors together. So when we take ahar, when we are talking about the ahar, our food, it promotes the sattvic, tamasic, it will influence our temperaments. The nidra is help. Nidra means sleep, toning up of our body and mind. And brahmacharya, it is the celibacy, body will make us young, energetic. That is why in previously we were following ashrama system. We were 4 ashramas. Depending on that ashramas, we were following different systems, and that was why people were different. But if you see the modern era, we are finding a different lifestyle. So as I told you, when I asked you the first question, are you healthy? It is not like, see, it is a continuum, illness to wellness. So the more towards left, it is the illness, and the more towards the right, it is the wellness. So according to Ayurveda, see, I have kept it is so that it will be, we have to see very much interesting it is how our 5 fingers associated with each aspect of our organs. Every system of our body is associated with each finger of our body. So that is why when we talk about the preservation and promotion of health, according to Ayurveda, what we talk about that, see, according to Ayurveda, when we talk about this Ayurveda, we have Ayurveda talks about there are preservation and promotion of health. It gives preservation of and promotion of health. It is not like a biomedical model. We will provide something, some medicine. If we are falling, we fell ill and we will go. No, but it talks about being ever imparting and implementing. We should being ever. What does it mean? It is the knowledge aspect. We should be aware of everything. It to the practice scale where we are talking about that, yes, in knowledge and practice. So that is why we should be aware of our health. How once we know there are, we have to implement. As we know, there are so many models of health. If we talk, there is a cognitive, there are so many psychological, that is the health, social cognitive models of health. If you read those models of health, it will be so interesting to talk about that. And those models, if we analyze, we will find each model have, each and every model has a genesis in Indian perspective of health. So that is why when we talk about the preservation and promotion of health, we have to talk about the Dinacharya, Ritucharya, and Sadhamrita. What does it mean? According to daily regimen, we have to follow. According to seasonal regimen, we have to follow. And we have also, there are different ways. When depending on the situation, we have to follow different ways of our take care of our health. So there are different types of disorders. As we know, there are so many types of disorders. But before talking about all those things, I have to tell about that. Or in interactive sessions also, we can say, why this health psychology? When I am from a health psychology, is it faculty from any health psychology, department of health psychology, I have to say, what does it mean, health psychology? It is the promotion of health, prevention of illness, identification of causes of illnesses, and improvement of healthcare system. These are the four aspects on which our health psychology is based on. So when we talk, there are so many disorders, but these disorders come from where? Either from us or from outside. One is external factor, another one is internal, endogenous and exogenous. What are those endogenous factors? That is endogenous, it is Nisa. And when we talk about the exogenous factor, it is called Agantu. So endogenous, naturally, so there are some factors, those factors are hereditary factors, and other factors, our lifestyle, the way of we do, whatever we maintain our health, that is the Nisa. And some exogenous factor, we will talk in a later part also, that is not in our control, where we suffer. And that is what these are. What are the barometers of diagnosis? Now, when we go to a hospital or whatever we are doing, what they do? They ask, they to talk about that. So when we are finding that, they immediately they will ask some questions. But if you analyze the Indian psychological perspective of health, we will see Ayurveda time or before that Susruta's time also, we know they were asking questions. We were calling the word darshan, see and observe. They see and observe the face of the individual and they were diagnosing the individual. Spurs, they were touching the individual and they were coming and they had some interviews. What we are asking now in counseling psychology and all, we have Prashna. And that is what Indian psychology was giving. So the three main causes of imbalance is we are overeating or we are not eating. All of you know anorexia nervosa and bulimia. All these are the causes of illnesses. And uncleanliness. It is not uncleanliness. We are not talking from the external point of view. When we are talking from the internal point of view, we are talking about what is this internally. Everything, all the negative thoughts are in our mind. Whatever, how much you try, you cannot clean. So in order to that, we have cognitive behavior therapy. And for that, everything, there are so many therapeutical aspects, we have to change our mind. Unless and until our negative thoughts are there, it will influence our physical health. So, and there are so many aspects where stress is the main cause of nowadays. Stress is the main cause of all. Why? Again, I'm coming to the point of health psychology. Why? Previously, people were suffering from what type of illness? People suffering from chronic, people were suffering from acute illnesses like TB, cholera, smallpox, measles, and all. And that is why people were cured. But nowadays, people are suffering from chronic illnesses. The difference between chronic illness and acute illness is that people who are suffering from chronic illness, they care for that illness, but there is no cure for this illness. We can manage these illnesses. What type of these illnesses? Chronic illnesses. Maximum, India is the country where you will find number of people, if you see the percentage, you will find number of people are suffering from diabetes, cancer, hypertension. And Andhra Pradesh, Telangana is the main point of diabetic patients. So because my area of research is behavioral diabetology and my PhD student, they have done a lot of work on diabetes, and including that the quality of life and well-being, we are doing the research. That is what, when we see that we are finding people are suffering from chronic illness. The cause of this chronic illness is nothing but it is due to stress and lifestyle of the illness. So that is why when we talk about the stress, if we see the Eastern perspective of health, if you see a book by stress management, it is a very good book of stress management by Western, it is by Sharma and another Western author. It is very nicely, they have written each and every aspect of Indian perspective of stress from Indian perspective, and for everything, how to manage the stress. A very book for practical aspect. So according to Patanjali, why? When we talk about it, if this is that, when we talk from the Buddhist psychology, also in Buddhist psychology, if we talk about from other Eastern perspective, we will find that stress is nothing but dukkha, klesha, kama, atma, and ahankara, adi, and pramen. It is due to pain, it is due to affliction, desire. The more we desire, the more we will get the pain. And it is due to the mental aberrations, mental negative thoughts, and OER, failure of lapse of consciousness. All these are the causes of stress. And our first and foremost point should be how to reduce the stress. According to Patanjali, all of you know, because if you read any book from Western perspective, you will find a chapter about Indian perspective of you. There is a book by, I think it is the book by Sanderson, or you will find in that book, you will find they have written about the stress aspect and how Indian rishis, how they had controlled the stress, and what are their yoga, how the influence of yoga, pranayama, mindfulness, meditation, how it is, these are useful for that controlling stress. So why we get stress? It is avidya, asmita, raga, dvesa, and abhinivesha. It is due to the first of all avidya. We don't have the knowledge. We are not clear about anything. We are asmita. It is self-appraisal, how we view ourselves and how we attach ourselves to others. So I don't want to take more on that. And when I talk about the stress, I told you we are getting stress due to mainly three factors. One is adhyatmic, one is adhibhautik, another one is adhidaivi. What is this adhyatmic? When we talk about that adhyatmic, it is due to personal factors. When we talk about the adhibhautik, it is the situational factor. When we talk about the adhibhautik, it is the environmental factors. So when we talk about this stress, there are so many types of stress. One is prasupta. I don't want to use those words. Sometimes I imagine, sometimes due to inefficient thing we are getting, and sometimes students are intercepted, that is student who is rejected for something about getting something. So it will be very interesting for you if we say that Krishna, Arjuna told to what it is difficult to control the mind. It is easy to control the wind, but what I have. Oh Krishna, it is falling from my hand. Controlling my mind. How my whole body is trembling. So what Krishna said, what he said, oh Krishna, Arjuna, don't worry about that. See, Chanchala you once you practice, you can control your mind. It's not like that. We can control our
Oh, okay. Ma'am is facing a few network issues. She will resume shortly. Just give us a minute. Please be patient.
Okay. Sorry, there was some problem in my internet.
No issues, ma'am. You can continue.
Okay. See, by chance, if you think that I will stop and more interactive. Okay, so then we talk about that. Am I not visible? Hello.
You are visible, ma'am. It's just the network issue, so your voice is lagging a bit. You can try talking slowly.
Okay. 1 minute. My screen is visible now?
No, ma'am. You will probably have to share screen again. Ma'am, if the issue is still there, you can try switching off your camera. That will reduce the network issues. Meera, ma'am, are you still here?
Is it okay?
Yes, ma'am. Now it's fine. You can keep your video off if you want, so the network won't fluctuate and you can continue with the presentation.
Okay. Because my internet connection is unstable. Okay. So
yeah.
Okay. So that is what, when we talk about the well-being, as I told you, I have to talk about the well-being. When we talk about in Indian perspective, when we talk about the Indian perspective of health, we are giving as please I am not talking from any caste, creed, and religion, because as from Indian perspective, when I have to talk something about the Sanatan Dharma. One only two slides, because it is very much important for this. So when we, according to religion, according to Upanishad, the body is a chariot and senses are like horses. The mind is like reins. In intellect is the charioteer, and the Atman is the master of chariot. What we have to do in order to control, we have to control our mind. So that is what is that. So coming to the point now, very interestingly, when as a resource person, when I go somewhere, I always like to, when I teach them emotional intelligence, which is very, there are so many factors for health. If I will come to the little about Western perspective of health, when we talk about the Western perspective of health, also in relation to Eastern perspective of health, we know there are so many factors that influence the health. How to control health? What are the factors? What are the opposite? We have optimism, we have self-efficacy, we have emotional we are always using the scales from
Hello, ma'am. Can you excuse me? We are so sorry for the inconvenience. We are trying to get her on board again. Please excuse us.
Till then, you can put in your questions in the chat box, and also please let us know how are you liking the session so far.
Keep asking your questions and we will address it to ma'am when she is back. She is back now and she will continue.
Ma'am, since you're facing network issue, it would be preferable if you keep your camera off so that the session is completed smoothly. Can you hear us, ma'am?
Am I audible?
Yes,
Am I audible?
Yes, ma'am, you're audible.
Yes, ma'am.
No. Am I audible?
Yes, ma'am. We can hear you. And if you wish to, you can switch.
Okay, I will see only just to share my screen. Is it visible?
No, ma'am, you will have to share the screen again. Ma'am, you're on mute. Ma'am, if you could unmute yourself. Ma'am, can you hear us? You're on mute.
Ma'am, you will have to unmute yourself with a button.
Yeah, we can hear you now. Yes, please continue.
When as a resource person, when I go to that as emotional, when I take that emotional intelligence class, I first tell them, see, I am teaching you emotional intelligence. It is the concept by Goldman. But it is the concept. But the Goldman, who has coined that term, bestseller book by Goldman, when we talk about the emotional intelligence, mainly emotional intelligence, when we say we control our emotion, we understand our others' emotion, and we understand our emotions, we control our emotion, we understand others' emotion, and we control others' emotion is emotional intelligence. So I ask whether your mind influences body or body influence your mind. Both interact each other. So see, a very interesting, I am telling you also, it is written, but I am not published, an emotional intelligence, and I am telling you a story about we are everything in our all mythology and all our books, Panchatantra. If you read, you will find each and every concept of psychology there. In Panchatantra story, you might have heard the story of the Mongoose and snake story. Have you heard? What happened? The farmer had kept a mongoose, and one day the farmer was not at home. The lady went to bring some water. The child was in the home. When the wife came from outside bringing some water, she saw the mongoose mouth was full of blood. What she did? Immediately she threw the pot and the mongoose was killed there and then. When she entered into the house, she realized that that mongoose had not created any problem to the child, but the mongoose had what? Fought with the snake and had killed the snake. What? Then she realized, oh, I made a mistake. It is not emotional intelligence. But how many of us we are talking about that Indian perspective from emotional intelligence story? When in Bhagavad Gita, when Arjuna is talking about that, my mind is, I am unable to control the mind. When Sri Krishna is talking, you better you practice, you will control the mind. It is not emotional intelligence, but how we are not thinking about Indian perspective. Another last point where is my work is based upon, I will go to the last, it is my last PowerPoint, I will be there. The screen is not visible.
It's visible, ma'am.
Okay, no, I don't want to talk about that because there are so many therapeutic aspects. I had kept everything ready, but I don't want to say because I don't get time to interact with others. So that is why I have done a lot of work on social support. As I told you, I have developed a scale on social support also. According to social support, there are so many people, they have done a lot of work on Western people, they have done a lot of work on social support. What is that? When they are talking about Cohen's book, if you read, they are talking about social support. And I am also teaching the structural aspect and the functional aspect. But if you see in India, we have a sloka, Ature Vyashane Prapte Durvikhe Shatru Shankate. Rajadware Smashane Jayat Tishtati Savanvaha. In sickness, misfortune, famine, danger from royal, anything, anywhere you are there, you are a support system to others. But we are not giving importance to that. So that is why there are so many, and also the self-efficacy. We have the belief about ourselves. We are giving auto-suggestions. When there is a problem, I ask others, if a person comes, madam, I am always feeling something, I am not finding okay, I am feeling that, okay, I am feeling depressed, and I think that I won't be success. I say, give auto-suggestions. What type of auto-suggestion? I will be all right, I will do better in my exam, I will qualify in that exam. I will show you my last slide here. See, this is the root chakra mantra. What is I am safe? I am confident, I am abundant, I am healthy, I am wealthy, I am everything I need, I am balanced, I am grounded. Do you think it is not auto-suggestion? Emily Crusoe, what he had said, it is the same thing. Only when Western people will take our consent, then only we will follow those concepts. We will say, we are doing a lot of research. There are a lot of points, but there are a lot. My internet created problem, and I didn't get time to say so many things. But I want to show my last slide here. Om Sarve Bhavantu Shukhina, Sarve Shantu Niramaya, Sarve Bhadrani Pashyantu, Ma Kaschid Dukha Bhave. May all be prosperous and happy. May all be free from illness. May all see what is spiritually uplifting when no one suffer in any way. This is now relevant for during the pandemic situation of the health psychologists are needed more. We have developed one health psychology, one surf group in Telangana. We have developed one helpline in Odisha Central University. I am a member there. Also Telangana surf group, our department has developed one association of health psychology. They have developed, thousands of people are coming from counseling. And that is what this pandemic situation, it is needed now. So where we have to, students, if they ask me question, I have kept ready also what is the needed of that. So I am keeping some time, I skipped, so I think I would like to interact more with the people than talking about the PowerPoints. So it will be, interactive sessions will be better. Okay.
Yes, ma'am. So actually, we have a few questions for you by our attendees, and I'd like to put them forth to you. So, firstly, thank you for this session. It was very informative, and an Indian perspective was really needed for us. So, thank you for this. I'll straight away move to the questions. The first question is, please explain more ways of dealing with stress besides pranayama.
Sorry?
Please explain more ways of dealing with stress besides pranayama.
So, tell me again.
Yes. Please explain more ways of dealing with stress besides pranayama.
Okay. That means how pranayama will be helpful.
Yes, along with pranayama, what are the things that can be helpful for dealing with stress?
Okay. I understood. So it is, so I am not talking about only pranayama. When I am talking about yoga and pranayama are different. Correct. So yoga and pranayama, it is one is breathing and another. But we have, when we are talking about the stress, we are, as I told you, when we should be more optimistic. And what are the other aspects? I told you guided imagery. Guided imagery. All of you know, when we are under stress, I always say, because frankly speaking, my relatives who are doing PhD in US, they are so stressful about while doing the research, they call and they say, oh, I am so stressful, 18 hours we are doing the research. So guided imagery is the best thing. When we are thinking, oh, how will I do? So many works I have to complete. So your mind will be stressful. So I always say, forget about that sometimes. You always bring the good moments, pleasant moment. So that is what it is called the visual imagery. You visualize yourself, the good memory. But another thing, if you want to do, sometimes we have also recording guided imagery processes where we put the something. In guided imagery, what happens? The counselor or the psychologist take the person, the client, to the situation. First, the counselor asks the client, which situation you like. Suppose I will say, I don't like mountain, I like the sea. So then the counselor will take me to the seashore and will say, think now you are walking near the seashore. A nice breeze is coming, you are feeling so happy, the pleasant situation. So slowly we'll take that person to that situation. So as a result of which we have, other than that, we have so many aspects about relaxation procedure, relaxation therapy. We have Jacobson's progressive muscle relaxation, but we are not following Jacobson's. Now we have Indian also aspects where we will follow those. So there are so many procedures I had kept also in my PowerPoint. So number of, and also if sometimes what happens, auto suggestions will work better. I always prefer auto suggestions. Mindful meditation. You know what is mindfulness meditation? Now mindful meditation is very much important compared to other type of relaxation and therapy, because mindful meditation is from Buddhist aspect. And you see so many books from mindful meditation. And in mindful meditation, we will not bring anything. Suppose I am eating an apple. What we will do? We will enjoy the apple. Nothing will come at that time. So mindful meditation will be the best one for stressful situation. Yeah.
Yes, that's correct, ma'am. That's very helpful. Another last question that I'll take for you for the day is: do you think schools should start having an Indian perspective to education and include concepts from Bhagavad Gita and very rich other Indian literature?
Sorry?
I'll repeat it. Do you think schools should start having an Indian perspective to education and include concepts from Bhagavad Gita and other very rich Indian literature?
Yes, yes. Actually, now our department has written to the Ministry of Education, and also we are planning to this Netherlands had everywhere when they are chanting the Bhagavad Gita. In Bhagavad Gita, and we have to apply.
I think ma'am is still facing some issues. Meera ma'am, are you still here?
Guys, all the questions that are unanswered, we'll send it to Meera ma'am, and when she answers it, we'll post it on the participant groups.
Yes, Meera ma'am, you can continue saying what you were saying. Hello, ma'am. You will have to unmute and then you can talk. Yes, ma'am, you can continue.
Ma'am, can you hear us?
Yes, yes. Now I am able to hear you.
You can continue with the same answer, ma'am, and we are done then.
Sorry? Lot of problem actually. I'm very much sorry.
It's okay.
It's okay, ma'am. Would it be fine if we send the questions to you via mail and then you could answer them? We'll send it to the participants since you're facing a lot of issues.
Okay.
Okay, so thank you so much, ma'am. I'd like to call upon Andrew sir again to thank ma'am and the tech team to present the certificate. Thank you so much, ma'am, for being with us here. Have a great day.
But actually, I am.
This is your certificate, ma'am. This will be mailed to you.
Thank you, Doctor, for your advice. There was a lot of what I can say takeaways from your message. We wish all the participants. Maybe we'll send like what they were saying. We'll send the questions through email. All right. Thank you so much, Doctor. Have a good rest of your day. Now
Okay.
it's over to MC Zainab, right?
Okay.
Thank you, ma'am.
Yes, sir.
Thank you, Doctor. Thank you.
Okay.
So
Zainab?
moving, yes, I can take over from here. Thank you, Meera ma'am, for such a lovely presentation and a speech, and joining us with the Bhagavad Gita. And now I will continue and move forward with the next session. And I'm so honored that I have been given such a great personality to be announced and to give an introduction for. So the next speaker is Dr. Chetanya Sridhar. She is not only a sports psychologist and sports and personal psychologist working in sports industry to help athletes achieve their top performance for more than a decade. By education, she has a doctorate that is PhD in sports psychology and from the University of Western Australia. During her stints in Australia, under the guidance of her mentor, she also worked with various cricketers at the domestic and the international levels. At the Sports Authority of India, she has also worked as a scientific officer in the Sports Development Psychology Department with several athletes from different disciplines like shooting, hockey, badminton, athletics, and many other sports. She have also worked with different types of authorities, and she have also worked with different sports academics that includes not only in India, outside also India, and that goes with including Sports Authority of India, JSW Sports, and Anglian medal hunt that supports India's medal perspective at the athlete level. She is the first woman sports psychologist at the Indian Premium League, that is IPL. Also, was the first team psychologist, part of the traveling contingent admits at the COVID bio bubble of the Royal Challengers Bangalore (RCB) franchise for the IPL 20. Now, I would like to request ma'am to come over and guide us with her empowering words. Over to you, ma'am.
Can you all hear me?
Yes, ma'am, we can hear you.
Thank you, Zainab. I had actually requested that I don't need so much of an introduction, but thank you. That was very nice. So before we start, what I'd want to do is, I always like to start with an image. So I'm going to show you all an image and I'll take you all forward from there, right? So just give me a second. So I want you all to, all of you all can see the image, right? And what I want is, just let's find our center. You all have probably been, listening, taking in, absorbing things from morning, from some renowned speakers. So just let's recenter. And I want you all to see what catches your attention. It could be a word, a thought, an image. Try to go more with the feeling and what's happening with your body. Don't get into the cognitive and head association with it, right? Don't try to start forming a story. And I just want you all to notice what's happening to you. And it's perfectly fine, whether it's a pleasant, unpleasant, anything, doesn't matter. And keep your thoughts for a second to yourself. I'll ask you all when you all can start sharing. We'll come back to this image in just a bit. Okay, so I want to start. I think one of the things that Zainab, right, probably two things which was missed out was I'm also involved with captive elephants, and I'm training to be a Jungian analyst. So we work a lot with images. And what I would recommend is keep a piece of paper and pen and just jot down what comes up for you as we're going through this session, which hopefully I'm planning to wind up in like 40 minutes, and then we have time for question and answers. Without judging it, right? And keep it to yourself. This is for you, because my aim for this session is, one is of course to give you all a preview of what is sport and performance psychology, and more so my own journey being a female in the industry, female sports professional in the industry. And most importantly, I want to give you all something to take away, whether you get into the field, whether you find it interesting. What's important for me is there's something that you take away, something which can come back to you later at a point of time in your own life. Just something that you'd go with. Okay, so I want to start with a little anecdote, because stories are so inspiring, right? We all like stories. We all like to know stories, and this has to do with my own journey of getting into psychology. And this happened when I was very young, and it's something which my maternal grandparents are involved in. I heard this from my grandmother, and it was a dialogue between my grandparents actually. So I would often hear my granny say, there's a surplus of this, for example, sugar. And she would tell my grandfather, can you make sure to actually bring it back today when you're coming back? And I would keep hearing this journey. So, I'm doing the literal translation. So please, it might not be so flowy. So my mother tongue is Kannada. So I'm doing the literal translation of what I heard. And, you happen to hear this. And then once I heard an urgency in her voice, she's like, like, for example, there's rice is in surplus. So can you actually make sure to bring it today? And then I said, why do you need more rice if you already have in surplus? And this is a young child, see it from that perspective. And what my grandmother told me has stayed with me till date, is that, she sat me down and she told me, which I think we Indians must have heard in different ways from our own parents or grandparents, or must have come across, that she said, the Astu Devatas, which is the gods which bless, right? They may say Tatastu at any point of time. So be mindful of what you are actually focusing upon, right? And that impacted me quite a bit. I think that was a very, very important seed that my grandmother laid. And I think that is why I consider her my first psychologist, probably even before I knew the word psychology, or even before I kind of thought I'm going to get into this field. So why am I telling you all this story? Because if we look at psychology, sport and performance is again one branch. I was listening to the ma'am just before me talking on Indian perspectives, which is another very favorite topic of mine. Of course, I joined in towards the end. And ultimately, it's the umbrella. We all come under the umbrella of psychology, and our own heritage is so rich. So the reason I'm telling you this is it kind of sums up what is sports psychology. What is it that we do? Till date, I have not heard a single athlete tell me that I don't want to win. Everyone says, I want to win, I want to do this, I want to make the country proud, I want to get a medal. But then what is the focus upon, right? What if I get beaten? What if this happens? What if I get injured? Oh, this one has trained more than me, right? So where is the focus going, right? And that is where the tatastu might happen. The gods may just say, okay, so be it. Right? In different religions, you'll be hearing different terminologies. but the concept remains the same. And that's our job. It's always called the story behind the story, right? So whichever field of psychology you're in, you're just not listening to what your client or your athlete is telling you. You're listening to the background of that. And it is our job, I'm going to come back in the second section, as to point out, where's the focus going and where do we want it to go, right? So I wanted to start with this. So that was one of my first influences. And the reason also why I want to start with this particular story is I get a lot of mails, a lot of queries, I think even on LinkedIn. I want to become a sports psychologist. What's the way forward? And I started seeing a trend. It's more during IPL. It's more during, like, let's say, the league phase, or during major tournaments where maybe mental health or a psychologist or an athlete talks about it. And the reason I very often hear is, I really like the sport, or I really like the athlete. So now, my question becomes that why, right? Remember the first image I showed you, find your why, right? So why do you want to get into a particular school of thought, be it sports psychology, be it any psychology, right? So, and I'm not looking for an answer immediately, right? In this age, we're so used to instant, right? I call it instant noodle age, instant age, where someone sends you, calls you, you're expected to respond immediately. So the question is, sit with the question for some time, even after you listen to me, even after you hear a few people. Sit with it and also see how does this connect to what's happening and what's coming about in my own space, in my own life. Because for me, when I think back, of course, that story stayed on. But when I became, like, I did not know why I chose psychology. And as I was sitting, with what to say and how to, bring across this message, what came across to me, which I think a lot of us would have heard, is Robert Frost, right? The road not taken. I think I can sum up my sports psychology journey that way. Because from where it came, I have no idea, but I just, said I want to take up psychology. Definitely not sports psychology. Sports psychology was not in my arena right in the beginning, because I did not have that much of information. And I was told, what will you get in psychology? Very well intentioned. So I still went ahead with it. The second influence is my father, who played a lot of sports. I was an athlete myself. And the love for the game, and especially sportsmanship, was inculcated from him. I would remember, because he played cricket and we used to watch a lot of cricket. I think we all watch a lot of cricket, in addition to, thankfully, a lot of other games now. I wouldn't want to watch when India was losing. And that's when he said, that's very bad sportsmanship. It doesn't matter win or lose, you need to support the team. And I think that's a very, very essential aspect of being part of this profession, because the amount of ups and downs you're going to witness, and you need to be in your center so that the athletes or the team can go through it all. You cannot keep fluctuating. Of course, you deal with your process in a different way, but not with the team. They're not your psychologist, you're their psychologist, right? So that's the second. And interestingly, when I finally went on to my master's, I was very keen on taking up clinical psychology as a career. And it was Dr. Sudha Bogle, I have to give her credit, who was instrumental in me even going for the interview at Sports Authority of India, because she actually literally had to say, do it for me, push me into it, because I said I have no idea about sports psychology. And she said it's basically applying the principles of sport and performance, of psychology to sport and performance. And I think that was an important trajectory which happened, because I really enjoyed the interview. I can without doubt say it was one of the best interviews I've attended in my life. It was challenging. Of course, they asked me questions, but it was also very open. It was something I realized that, that click which happens. I like this. My brain was really ticking. because I was in sport. I came from a family in sport. I could understand the nuances which were happening, and I thoroughly enjoyed, especially when I got in. The challenges, of course, there were a lot of challenges which I did not handle very well right in the beginning. I'll come to that in a bit. But I felt, oh, I really like this. So what I'm trying to tell you all guys is, and please don't mind me saying guys, because I used to teach. So this is how I used to talk to the master students at, I would always call them guys. So which include the girls and guys. Okay. So also listen in and see what's really, am I fitting in? Is this suiting me? Am I content? Not just am I happy, and not just, the glitz and glamour, because I think a lot of people may be thinking just because you're getting recognition because you're with XYZ does not mean that I was given a golden platter. No. So the first, I also want to highlight that you make some choices, right? So when I finally got on this path, and then I decided to do my PhD. And the second decision after I finished was whether to come back from Australia or not. A place where sports psychology is very much accepted. But, do I want to stay there, or do I want to come back to India where it's still very niche? Do I come back to a place where I can make a name, and most importantly, what Indian sport needs, right? So that was the second choice. And it was not easy, right? I'll tell you all why it was not easy, because no one was waiting for me to come back. It was a good 3.5 years, though, of course, I'd done some work and research with National Cricket Academy. What was important was me to realize that by then I'd also started paying attention to what works for me. So I am an introvert, and I do not like a 9 to 5 job. Like, when it's flowing through, I can work for, like, let's say 10 hours at a stretch. And then sometimes I need a break. Or sometimes, the download just comes and you're done with the work. So I do not like very rigid structures. And also what happens is with national academies, you cannot work outside, like, say, national teams. So I knew I wanted to work. I knew I wanted to be a consultant. So I have time for myself, for my interests. So what I did, and by then I'd also realized, was that I was very passionate about teaching. So I went to my professor and got in. Long story short, but also I was a visiting faculty at Jain University. So it really helped me rebuild, right? You rebuild your system, you work your way through. And also what teaching gave me was that allowance to deal with what was coming up, right? And just process things. Like, it was a lot more creative energy in teaching, because you're not handling so much of heavy material, right? At the end of the day, psychology, we are dealing with emotions, we are dealing with performance. And performance, sometimes, I tell my colleagues, it's like sitting in a pressure cooker, especially when major tournaments are coming. We're all sitting in that. So it really balanced things out for me. And so what I would suggest is, keeping your options open till you can finally settle down at a rhythm going, this works for me. How much do I want to travel? And, how much do I need to earn, let's say? And also, most importantly, the income comes in very slowly. So one of the toughest decision I had to take was to take a pause from teaching, because what started happening was, as much as I loved both sports psych and teaching, what eventually started happening was, just as the semester was peaking and finishing, the tournaments would be at its peak, especially the even semester with, the dissertations, because I was teaching masters. And just as the tournaments were ending, what would happen would be the teaching would start. So I just felt I did not have a break at all. So, that was the second call. And the reason I'm telling you all this is, you need, this is a new field, it's not a field where you come in and things just magically happen just because you come in the media once. It is one of the fields where, yes, probably, the psychologist, the whole team as such is given importance, and you are in the spotlight. But it is a gradual curve. You work your way through like anything else in life, right? I really wanted to bring this across very, very strongly for the main reason that my motto has always been excellence over performance, right? So when you work towards excellence, performance will come. But if you work only towards performance and you're not focusing on what we say the process, right? And only like, I want to be with XYZ, or you know what, I want to be with this team. This gives me attention, this gives me money, which is all great, which is important. I'm not saying no, but also, is that all? Does it really make you content? Like if we remember positive psychology, right, Seligman, are you really satisfied? Are you making a difference there? To me, whether it's a 10-year-old, whether it's an Indian player, I'm always looking at India potential, because you're sitting with that potential. And I think that is the key element. And also, most importantly, is there a need for me here, is also something you need to sit with. Can I bring my expertise, and does it match? So understanding who you are also becomes very, very important. To be very honest, I'm an introvert and I do not like media. I'm not interested. I find it very intrusive of my space. So, be it the IPL, be it anything, I'm always very clear that my interactions are very limited. But also, putting it out there and knowing what your boundaries are, and knowing, most importantly, guys, how do you take care of yourself? I will come to the amount of trolling I faced, or especially being part of a team, especially being in public eye. There are a lot of challenges which come in with this sport, with this industry, and I'll keep touching on this. And also, we look at the questions that you all have, right? So I'm trying to give you all the glimpse. 45 minutes, 1 hour is really a very short time to share your experience and to bring in the field. But what I'm trying to do is bring it across in a storyline so that you'll get the essence of it. Okay. So the next section, what I want to do is take you all into, just some of the main chunks of sports psychology. So I'm going to share another image with you all. And I want you all to take a look again. And just there, see, one, what comes up for you again. And second, what stands out? And also, what does this mean? What does this curtail? I think most of us here are psychology students, right? What message is coming across to you all here? So I'm going to let this image be. To me, sometimes I use this image. It's one of my favorite images to explain sports psychology in itself. Because what you see right at the top, right, is what people see. Oh my God, such a wonderful life of the athlete. So and so is so good. And also to them, what appears. Then if you see the reflection, the mirror reflection, it's what we call the iceberg profile, right? The things that the athlete themselves do not know. So if the top, represents your conscious, the bottom becomes your subconscious and unconscious, your beliefs, and doing that inner work to then find the gold. And here, that's why you're seeing these beautiful colored marbles, right? And I think that's the beauty of sports psychology, because or any field of psychology for that matter, because one of the concepts that I want to bring in today and introduce is the concept of individual zone of optimal functioning, which was given by Yuri Hanin, where each one's zone is different. And if you remember the story I was telling you all, um, you know, I have athletes saying, I want to achieve this, this, this. And I'll give you all the example of one of the very young swimmers. And he came from a family of awardees. And when I finally got down and I saw, you asked him, and he's like, I want to, win a medal at, I think he said national level. And then I said, okay, so what do you think is required? And he did not have an answer. And then I was trying to go to, of course, they all say hard work, everyone says hard work. And I also, a lot of times say, it's also smart work. And when you went deeper, right, this boy would bunk classes, very young boy as well. And he was also a referral. Someone else had come and, come to me and had won. So they thought that, okay, sports psychology is magic, which is a huge myth. And what came out, right, and this was just the first session, his profile was tipping really low, demotivated, and had no interest. So, when you dig deeper, you realize that this boy was more under pressure, right? As in, it was, I think, very well intentioned, but he really wasn't even enjoying. And I'm from Bangalore, and I know a lot of pools, at least at that point of time, did not have heating. I'm not sure how much of them have now. And these kids go at 4 o'clock, the pool is cold and you're swimming. And I'm thinking, why would, you put yourself or your child through it if this is really not the child's dream? So, sorry, I had to call the mother in and literally ask, whose dream is this? Whose goal is this? Because, I would really suggest you take your child for a holiday. He seems so burnt out, and then come back. And if he really isn't interested, don't really push him, let him live the life he wants to live. And I think that is paramount. So the reason I'm telling you all this is to identify what is the zone, what does this individual need. And I always, initially my sessions were a lot of individual, so I would always ask, how can I help? And then this is my philosophy, right? And I want to give this example of philosophy where which I think with time you learn that with trial and error as to what works. It's like cooking, because I remember burning rice when I first went to Perth, and my flatmate was making fun of me. And I kind of feel, you get into the field, you're testing the water, you're understanding the system, and then you kind of go, you're understanding yourself. Of course, understanding yourself is a lifelong process. And then you go, what is it I bring here? Right? And I want to explain this with a concept, what we call emergence, which I very recently got to know, and I found it very helpful. It's something I understood with my work with, with my involvement with the elephants. And I was asked at my union interview that, oh, you work with elephants. And I said, I honestly don't know who works with who. And that's when, I don't know if my interviewer actually said the word emergence, but I later on understood that there's something which happens in the field, right? It's you bring yourself, and even over here, there's something happening. Though I cannot see y'all, there is a field created here. So I can be talking and I can be saying, but if you haven't brought yourself, there is nothing that I can do. But in that combined field, there is something else. That's where the magic happens. And especially, when I take group sessions, and this is what, I say, I'm like, this is what I'm bringing in. And in sport, we always say, dil se khela. I started hearing this, especially with boxing, that, so he or she did not play with heart or played with heart. That means bringing yourself fully. And that's where something happens, and that is the role of the psychologist, to kind of aid them. The magic is not done by you. Very clearly, that's something we need to be aware of. can play a tiny bit in getting them aware to what's needed and aiding in that process, and I want to share this story, this incident, case study of a very young golfer, and she came from a very difficult childhood. So one of the very interesting things that the coach told me was that, she loses from a winning position and she does not like attention. She does not like to be in the lead. And he also told me that, she has come from a tough place. So very young girl, hardly 15, 16. So, I had to very, very gently go in. And what came out was, when she stood out was to get beaten, was physically when she was abused. So standing out for her had a very negative association. And this is where sports psychology involves a lot of neuropsychology. That's where the cutting edge research is happening, is creating this new neural pathway that, standing out can also be recognition, approval, support. And it's not just verbal talk, right? Verbally, we all know that. But helping her, one is deal with this negative, make peace, hold space for that, and then slowly start building on this positive association. And then that girl went on to win, right? Winning was one, but after that she would tell me. So I had to do some inner child work with her as well. And she would come back and say, ma'am, I sat with what you said. I sat with that little girl. And these are touching moments where you have really touched someone's life. So why I'm telling you all is, I want you all to understand that it's not just about motivation. It's not just about goal setting. It's so much beyond. It is about taking the whole individual. And I think one of my first challenges, first learnings, and I think my first appreciation came when I was working with one of these medal prospects way back when I started. I did not even know she was a medal prospect. And then the camp shifted to Patiala from Bangalore, and she refused to work with any other sports psychologist there. So a letter came that, can you all send Chaitanya? And I still did not have a PhD at that point of time. So, and I very clearly remember the ED teams, which is the executive director, saying, this is the first time it's happened. So, though there are a lot of camps, we'll have to relieve you and send you to Patiala. And I started working with her. And what happened was, eventually I started working with the whole team, because there were quite a few of them there who were prospects. It turned out that the entire team wanted me to travel. And that was, I think, one of the times, or few of the very few times, where a psychologist was traveling with the contingent. But I was way junior, right? And there was this very senior coach who very recently passed away. And amazing gentleman, what an empowering coach would be. His way of appreciating you was, he'd say, come with me for a walk in the ground, when there's training. So when he said, when he called me, I was quite surprised. And then he said, the entire team, including me, wants you, but according to seniority, you can't go. And and I said, that's perfectly fine, sir. I was, I know my work is back end. I was not doing the work that I'm going to travel with the team. In fact, I did not even know that was going to happen. He touched my head and said, "Bahut acha kiya, beta." And I feel that was huge. That appreciation, that acknowledgement. Of course, that athlete went on to break the games record, and she called me. And there was a letter from the sports ministry, right? Now, this was not something which came out in the media, but if you ask me, I think that was very, very touching for me, right? The fact that it came from a coach who is so well known, who appreciates you, and knowing that you did your part, whether you go, and of course, everyone who's in sport, whether it's an athlete or a support staff, to don the Indian cap, Indian colors is always the dream. I have worked with Indian teams. I have traveled with leagues. I haven't yet traveled with a contingent, because it is difficult. So it's also been a conscious decision. But yes, that's a dream which will hopefully come true one day. Why I'm telling you all this is, guys, it's 360-degree approach, what we call, in psychology, because you don't work in tandem just by yourself. So I never say I did this and a magic happened, or going and putting up that this is my team. I think especially as a psychologist, when your team doesn't perform, when they're low, it could be that the team has won, but like there could be a player who's really down. You're still part of it. How do you support him or her or the team? And I'll give you an example of one of these young cricketers who was trolled very badly because he dropped a catch. And I remember him telling me, he said, "Ma'am, dar lagta hai abhi. I get scared, I don't want the ball to come to me." And that is heartbreaking. So now this is where, again, it's not just cognitive talk. Even he knows that don't pay attention. Now, even if I tell you all don't go on social media, we all know that, there's only so much of social media, which is good. But then can you really tell the younger generation to cut it off, right? So what do? That's where you explain it with, let's say, 11th field theory. I'm being mindful of the time, right? And going, whose opinion are you listening to? Who comes in your inner circle? And then also knowing how much of what can you share with the coach, or let's say, the core team that you work with, knowing that this particular person, without giving out any details, would really do with some appreciation and approval. So understanding the personality of each individual, even within the team, that's where your eyes off comes in. That's where that concept. And then when you're holding the whole team, you're also trying to go, how do we come together as a team? So it's very important to form that connect, not just with the players, but also with the support staff. With time, I've developed some really good friends, with the colleagues in the industry. And we always say, we're sitting in pressure cooker. It's like having a pressure, you're sitting in a cooker. It could be even when an athlete is injured, in 6 months, you need to get him or her back. So, you can only imagine the amount of pressure on the physio, on the SNC coach, on the entire, not just the athlete. So everyone, right? So there's a lot of pressure. In fact, Abhinav Bindra had made this very interesting statement just as India went into lockdown last year, where he said how athletes learn to cope with Tokyo, uncertainty, COVID uncertainty prior to Tokyo will determine how they're going to perform, because uncertainty, and we're all sitting with it, right? Especially this second wave has hit our country in particular so badly. Uncertainty is a part of sport as well. So, how you manage, and also, how do you take care of that? Like, you have to learn how to de-stress. You have to learn how to process. You have to, I remember again, one of my mentors had said, every psych needs a psych. And, most fields in psychology now has supervision. So it's very important to have a supervisor. It's important to have a peer group, of people in the same field, with who you can debrief, with who you can process your emotions, what comes up. That's very, very important. This is what I wanted to say. And the other thing which is most important is knowing how to handle failure. My all-time favorite is Rahul Dravid. And he always says, and our own ex-president, Dr. Abdul Kalam, had said, failure is the stepping stone to success. So failure is very much a part and parcel of sport. So knowing how to work with it. And I think very recently, Virat Kohli himself said that a very young fan asked him, so what have you learned? What's your message? And he said, you learn a lot from failure. Success doesn't really teach you much. And I think there was this very beautiful story. I don't remember the name of the businessman. He said, we have to listen to stories of failure, because what we see is people saying everything's fine. Of course, now we see a lot of athletes, we see a lot of people coming out with vulnerability, saying what they've gone through, how they overcame their challenges. And I think that's what I'm trying to put across to you all as well, that it comes with its ups and downs. So, that's what I wanted to bring together in this section. And I'm going to go into the third section, which I think is what a lot of you might actually have a question about, is how do I get into the field? So my message is this. I can't answer that question. But I think if you can start understanding, I will tell you all the way I went through, and then if you decide and you feel, and don't take the decision in a haste, but let life also guide you, and see, is this really what I want? Is this where I'm called upon? Is this the place I'm really contributing? Because I remember what Sakshi Malik actually, I think I heard once, was she said, of course, Sakshi Malik is India's bronze medalist who broke the jinx at Rio, right? She said, yes, the medal was what every athlete dreams of. And also, when I go to a village, a remote village, and, a young girls especially come and tell me that, Didi, aapke wajah se, because of you, we can practice. You have made an impact. You have influenced, right? And that's where you become from successful to inspiring. So, whether it's sport, whether it's performance, whether it's any psychology, any place, actually what I always tell is, don't just dream about working with XYZ, right? I never said I want to work with this, I want to be with RCB, I want to be with Indian team. Let it come to you. Let your work speak for yourself. And then even before I joined RCB last year, I actually chewed upon it, because I know how much of limelight you're going to be in. And what I want to actually share is, wherever you are, start from there. Because people ask me, what's the job criteria? Will I get a job? I don't know, guys. How can I really answer that? Like, if I had asked that question to any of my teachers, can they really answer it, right? Because one is life, the other is not just hard work, but like, where are you maneuvering and where are you channeling your energy? So start where you are, because sometimes, I know they take in people who just finished, freshers, and then some coaches question me as to how can someone like this work with the national team. I've been asked this, and I always say, I don't know, sir, I didn't take that decision. So I always say, start where you are. If you're in school, and if you're an athlete yourself, any kind of discipline, okay, what's happening around me? What's where am I being impactful? Is it positive or is it negative? If you're in a college, what can I do with any of the teams over there? Then, can I intern in a place? Can I gather? Can I read? You guys have so much of information, right? That's something I had heard a sports psychology lecture once, very honestly. So that's why I was so shocked when I was told to go for the interview. So, what I'm trying to tell you all is, don't take a decision in a haste. Don't take it just because there's constant information, but look at it as, is this where I can really bring in something? And that's the question I sit with, right? Like, you always have to go, there are always going to be, when you choose one thing, there's something else which you've left behind. So what's the choice you're making? And if, like, when I got involved with the elephants, and it's very recent, but honestly, I can tell you, it's one of the most fulfilling aspects of my life. And they enrich me as a person, and that learning even to what I bring into my field. So, look at where can I impact? And also, guys, yes, I know there's a lot of questions, and I'm guessing it might even be there. This is something I get asked. So that's how I planned my talk, is what should be the course. So I did not take up sport and performance psychology as well directly, because, of course, like I told you, it was not my immediate intention. So my base was actually a master's in clinical psychology, and I find it very helpful because, the whole history taking, the going to the root of the problem is something which has really come in handy even here. And also, when I know an athlete is tipping beyond normal sport and performance anxiety, beyond, or let's say, a body image which is tipping towards an eating disorder, I know where I need to pass them on and we need to get more support, right? So, and my own PhD was also from the industrial sector, from management. So again, I had a little bit of little, I won't say I know the whole of industrial psychology, but some base. So it's okay, start where you can, and then if you find a place where even if you can do an online course, and guys, at the end of the day, right, it's what you do on the field. This is something I have tried doing when I was teaching, that what's going to be your philosophy, what are you going to talk, how are you going to open, what are you going to do this person stuff. And trust me, these are the things which comes. I'll give you one example. Again, it was, I think, during that same camp, 400-meter runner. We've all seen Milka Singh movie, right? They don't, I've not seen anyone throw out blood. Maybe that was a movie thing, but they vomit. And it was almost a fag end. I think there was one last 400-meter round which was left, and one of the athletes came and said, "Nahi hota, ma'am, 100% nahi hota. I can't do 100%." So I said, "It doesn't matter. Just go finish this round and come." When he came back, that was 100%. And then he said, "Sahi bola," because at that point of time, what was important for him was to complete that round, right? It was not about, I need to cut it in so much time, because had he stopped, what would have stayed in his head is, I didn't finish, right? And that was practically the end. The team was going to travel. So it was very important for him to be in that frame where, okay, I completed this. So your theories become very secondary. And I think even when I was approached by 3G, I said, I'm not going to talk on theories. I'll bring you what the field is about, understanding the field per se. That's a different kind of thing. But what happens here is, when you're trying to introduce, I think you want to know the nuances of what happens in the industry, right? And your own experience. So get down, and it's no matter how much you read, trust me, it's finally when you go there, okay? It's finally, you have to get down there. And I, want to mention one of these incidents. It was my favorite sports psychologist, Dr. Kenneth Raveza, when I was attending one of the workshops, conferences in Sydney, and he said, "You're going to see people like this, right?" He said, "Don't ever think you're going to get a red carpet welcome." And he was talking. This was one of the top psychs at that point of time, and he was talking or working with some top basketball team league. So that's a message which has stayed with me. So don't think I'm going to go cut it off, clean bowl them, make an impression. Don't. Just go with, I'm bringing myself. There's something I have here, and I'm going to bring that. And there's a reason this particular team association has come to me. And then they need to bring themselves, and that's where the magic happens. So it's okay. Start where you are. Let the ripple effect happen. Let whatever you choose, whether it is sport and performance, whether it is Indian psychology, I'm impressed with the number of branches we have in our field and what 3G has brought together. You're making an impact, and who knows, who doesn't know is very secondary, right? Sometimes some people get attention, but again, like how our own athletes get, they're also pulled down. It's like the river flowing. Today is one person's time, tomorrow it's another person. So don't just run behind fame, glory. There's a lot to this industry beyond that. And I want to finally bring my talk to a conclusion with what Dr. Mihaly Csikszentmihalyi, he's a Russian who talks on the flow state, right? I'm going to read that out for you all because it's something I really, really like. So he says, that what you need to do is possible to do, even though difficult, and sense of time disappears. You forget yourself, you feel part of something larger. And once the conditions are present, what you are doing becomes worth doing for its own sake. And he's a flow researcher, what we call the flow state. And in sports psychology, in sport, we call the zone, right? So he's been looking this across discipline for over 30 years. And find the sport very inspiring, and I would say the learning and my journey still continues. So with that, I thank you for your attention, and I hope this was helpful, and I'm happy to take any questions.
Thank you so much, ma'am. It was very, very fruitful for anyone who is not even just interested in sports psychology, but basically psychology. But because you put in the attitude that is needed when you think of doing something like psychology. So I'll directly move to the questions that we have for today. So the first question is: do you need to have a background in sports psychology in sports to pursue sports psychology, or does it even count if you have a sports background?
Question is sports background?
Yes,
Do
like
you
if
need
you're
a
a sports person, does it help if you pursue sports psychology?
So I think it would help if you do have a sports background, very honestly, because I've been told by quite a few journalists that, can you hear me clearly? That, Chaitanya, you make sense, or Doc, you make sense. We don't understand a lot of what others say. So, but having said that, it doesn't mean that someone who doesn't or hasn't been in sport cannot. You really need to understand. And when, like, I don't know all the disciplines, but I'm honest enough, when someone, I remember a triple jumper was talking some lingo, and I said, can you actually explain what it is? And we looked up a video, and I'm like, okay, now I get it, because when I'm trying to guide him or her, I need to understand. So it would help if you have. If not, you really need to at least be passionate. If you're not, then this is like, definitely it's like saying, you keep pizza in front of me and I absolutely don't like pizza. It's doesn't make sense, right? So yes, I would say it would be good you've been involved in some level of sport.
That's correct, ma'am. So the next question is there any scope in sports psychology in India? And if yes, how to pursue it? What is the process?
So this is the exact, I think, Angela, right? This was the exact discussion I had with Angela when I spoke, and I'm really thankful to you guys, because I think I'm going to keep this recording and send it to everyone who asks me questions on sports psychology, because my whole talk focused on this, right? It pretty much focused. I really don't have an answer to this, guys, because if you had asked me, like, it's been 15 plus years in this field, there was zero scope. So if you're going to go behind scope, right, I don't know, like, it's a budding, sports is a really booming industry, but how many sports psychs can the industry also have? I don't know. So it really, that's where I said, find your why. I think that's very important. Because see, even when I came back, I stopped taking money from my parents by the time I was 23. So I funded my own PhD. I actually paid my own master's as well. So for me, there was no way that I could lean back. So I was in teaching, and teaching gave me some stability, right? Because I think when you go outside India is when you realize that we Indians are so over cocooned. So, what's the reason you're getting into something? Like, if you ask me, is there scope in, like, the elephant work I do? I don't know, in wildlife work, but I don't care, because for me, that's my passion. So if you're passionate and you have support and you know how you can get some stability in, then it's the road not taken. That's exactly why I said my journey is that. So you need to see, are you ready to take that road not taken? I feel it's unfair for me to say yes or no, guys. That's why I said it's your story. It's you guys have to, because if I say yes, it is there and go ahead, I will probably sound like I'm standing for elections, which I'm not, with all due respect. So that's a call you need to weigh the pros and cons, weigh the pros and cons. And if you're really passionate, and also please don't target, I want to go just because I want to meet a Virat Kohli, or I want to meet a Sachin Tendulkar or XYZ, that you can meet even outside, or, a Sunil Chetri. You don't need to become a sports psychologist because you're not functioning as a fan over there, because then, no one's going to respect you. So,
That's
yeah,
right.
sorry, I'm probably not the way, I don't give polite answers. I give very clear-cut answers, and because I think I work in this field where you also know that sometimes you do shake up people, and I don't want to just be all nice. I want to give a clear picture so that it's students can really, or like budding professionals can go ahead and decide what is it that they really want to do.
Yes, ma'am. A reality check is always better than having something coated with something. So in that way, I have someone has asked a very personal question related to them. So their question is that I am a gold medalist, a karate gold medalist, but when I win a bronze, it's not acceptable to me. I think I was capable of winning a gold. I feel depressed after that competition. I wanted to ask you, do you suggest something to overcome this behavior?
Okay, that's practically something that you would deal in a session. But I think I will again come back to what Dravid said. You're not going to go and win every match, right? Every time the team goes in, I remember even every time Sachin went in, people would expect 100, and that's practically not possible. So, if you are capable, and that's always good that, okay, you know where you stand. What is it that's needed? I know I'm giving a very cognitive answer. What is it that went missing there? And what is it that I need to do for the future? So I also want to just bring out, we use these words, depression, anxiousness, very lightly, right? And especially as psychologists ourselves, what we need to be clear is mood swings is something even I have, right? A low mood is even something I have, but that does not mean I am depressed, right? So feeling low, yes, you were capable of a gold. If you got a bronze, feel bad, a loss, yes, we feel bad, and then we move on, right? Because I think the beauty with sport is there's another tournament coming, there's another match, unless you know what, it's the fag end of your career. So I think stay with it, feel it all, and then go, okay, actually, I think also it's a good question, because there's an activity which I do. Do we have time? Or is there something?
You can actually continue, ma'am. We are anyways hoping for a break. So you have about 5 to 10 minutes if you want.
So, basically, let's say a recouping athlete who's coming back, I always tell them, or let's say someone's gone through a lean phase, this is one chapter, right? You hold space, you work around, and then you go, what's the next chapter going to be? So, I think that's what's important. And that's where, remember, the golfer I was talking about as well, we create next, what we're trying is a new neural pathway. So here you've already achieved. What you need to do is refocus back your attention to this, but also deal with what you're feeling. I think that's important.
That's correct. So another question that we have is, can the quality of leadership and team building be developed by training?
What, psychology training?
Yeah.
There's this Dr. Mehali, I would really suggest you guys look him up. And also, I remember one of my colleagues, I was the moderator. She was talking of excellence. I don't know if this madam before me spoke. Indian psychology talks a lot about excellence. So, first that leadership needs to start with you. Also, your leadership team, right? Like when I work with teams, especially CEO, your your operations director, your head coach, then the captain. That group is then going to trickle down. What's the influence? So is it relational? It's not like, we do some team building. I'm really not a big fan of just doing team building with teams. I think it's important. I'm not saying no, but I think also what's very important is really understanding each individual, understanding the dynamics and what's the trickle down, because then you know what is going to come from then it becomes bottom up. It has to be top down as well.
That's great. So I think we are done for the questions today. And thank you so much, ma'am. It was a very insightful session for anyone, as I said, not only for anyone who is hoping to pursue a career in sports psychology, but for anyone who is having that hope of becoming a psychologist. So I'll pass it over to Zainab to thank you, and the tech team will present your certificate. Thank you so much.
Thank you.
Thank you, Ria. So firstly, ma'am, thank you so much for giving us your precious time. And along with that, I will like you to thank to give us real life lessons. You have taught us something beyond the books and beyond the theories. So I seriously like you, and you were amazing full on the sessions. And I'm definitely taking some points from here and will be using it. So, as we have to move forward and conclude the session, so I really thank you, and I will like the technical team to present the e-certificate for the ma'am. Ma'am, this e-certificate will be shortly mailed to you. Thank you, technical team. Now, moving forward, I would like to call upon the next MC, Jessica. Over to you, Jessica.
Thank you so much, Zainab.
Thank you, ma'am.
Thank you. Hi, what's up, people? What is happening with y'all? Why are y'all so stressed? I know, first of all, thank you for being an amazing audience. Y'all have been here since morning. It has been great with y'all. Moving ahead, we have a little surprise for you guys. I hope y'all are very tired and bored and be like, "Arey, kya chal raha hai, bhai?" So we'll get you in the mood. We're calling upon a special guest, that is Joshua. Joshua is a singer for more than when she started at the age of 5, at a very young age. I know, right? We were like playing with mud and whatnot. I don't know what we were playing with. So Joshua started her singing career when she was 5. She is in Wilson College, currently majoring in literature. She's also been a part of albums, concert, and orchestras. So let me introduce Joshua to all of you. We've got Joshua just for you all, guys. Have fun. Enjoy. Over to you, Joshua.
Thank you so much, Jessica. First of all, I just want to thank the authority for giving me this opportunity. I'm so honored to be here. So just a small introduction. I'm Joshua. I'm 18 years old and I love singing. I have a huge passion for singing. I mostly cover songs. I'm trying to release my originals, and let's see what happens about that. So today I'm going to perform some songs for you. If you want to listen to more songs, you can check out my Instagram page, which is _JoshaMaggieSelson_. Okay, so now I'm going to start with the first song. It is Heal the World by Michael Jackson. This song is a very special song to me. It is about how we all can love each other and make this world a better place. So, please let me know if I'm audible. The guitar. Yes. Thank you. There's a place in your heart, and I know that it is love. And this place could be much brighter than tomorrow. And if you really try, you'll find there's no need to cry. In this place, you'll feel there's no hurt or sorrow. There are ways to get there if you care enough for the living. Make a little space to make a better place for them. Heal the world, make it a better place for you and for me and the entire human race. There are people dying. If you care enough for the living, make a better place for you and for me.
There's a love that cannot lie. Love is strong. It only cares for joyful giving. If we try, we shall see. In this bliss we cannot feel. Fear or dread, stop existing and start living. And then it feels like always. Love's in a forest growing. Make a better world. To make a better world for us. Heal the world. Make it a better place for you and for me and the entire human race. There are people dying. If you care enough for the living, make a better place for you and for me. Make a better place for you and for me. Make a better place for you and for me. I hope you guys liked it. Okay, so the next song that I'm going to be singing is not very old, but it's kind of old. A Hindi song. It is by my favorite artist, A.R. Rahman sir. It's called Roja Jane Man, and there's a small twist in between, so I just hope you guys like it. रोजा जाने मन तू ही मेरा दिल तुझ बिन तरसे नैना दिल से न जाती है यादें तुम्हारी कैसे तुम बिन जीना आँखों में तू है आंसू में तू है आँखें बंद कर लूं तो मन में भी तू है ख्वाबों में तू सांसों में तू रोजा जाने मन तू ही मेरा दिल तुझ बिन तरसे ये हंसी वादे आए खुला समा आ गए हम कहाँ मेरे साजना इन बहारों में दिल के कली खिल गए मुझको तुमको मिले खुशी मिल गई तेरे होठों पे है हुस्न की बिजलियाँ तेरे गालों पे है जुल्फ की बदलियाँ तेरे दामन की खुशबू से महके चमन संगे मरमर के जैसा है तेरा बदन ये हंसी वादियाँ खुला आसमां आ गए हम कहाँ मेरे सजना. Okay, now I'm gonna sing a French song, and you guys might not understand. If there's anyone who can speak French, please, I'm sorry if I make any mistakes. So this song is a very popular song. It's called Dernier Danse, also known as the Joker song. ce sinister, comment c'est? Je suis colère, sorti pour ton sei. Sans lui, je suis un héros. Je t'endorse dans ma trou. Pour venir danser. Oublier mon sei. Je vais me faire éclater comme on sait. Oh, ma douce français. Je remercie les jours de la nuit. Je danse avec la ola. Oui, un peu d'amour, pas de musique. Danse, 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 danse. Et dans les pluies, du coup, j'ai peur. Et c'est mon tour, verra. Tant tu péris, je m'abandonne, je me vole, 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 que l'espérance c'est ce chemin tu absence. Je me suis tombée sur ma vie des quais pour procourir de sens. Je remets au ciel et je roule la nuit. Je danse avec la pluie. Un peu d'amour, pardon, mais j'y danse, 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 danse. Et dans les pluies, j'ai couché, ouais, et c'est mon tour, yeah. Tant tu péris, je m'abandonne, je me vole, 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 vole. I hope you guys like that. And now I'm gonna conclude. And do we have time?
Yes, Joshua, we do have time.
So I sang English, I sang French, I sang Hindi. Now I'm gonna sing a song in my mother tongue. It is Tamil, and I think you guys know this song, so I hope you guys like it. Just a second. Okay, so I'm going to be singing Zara Zara in Tamil. அடைமழை வரும் அதில் நனைவோமே குளிர் காய்ச்சலோடு ஸ்நேகம் ஒரு போர்வைக்குள் இரு தூக்கம் குழு குழு பொய்கள் சொல்லி என்னை வெல்வாய் அதை தெரிந்தும் கூட அன்பு மனம் அதேதான் எதிர்பார்க்கும் எங்கேயும் போகாமல் தினம் வீட்டிலே நீர் வேண்டும் சில சமயம் விளையாட்டால் உன் வாடிக்குள்ளே நான் வேண்டும் जरा जरा महकता है आज तो मेरा तन बदन मैं प्यासी हूँ मुझे भर ले अपनी बाहों में तेरी कसम तुझको सनम दूर कहीं ना जा ये दूरी कहती है पास मेरे This is a small mashup of the Hindi Zara Zara and the Tamil version of it. Now, okay, so this is a really cool mashup that I heard
one day on Instagram, and I just had to try it. So this is Me and My Broken Heart, and there's a fusion of, I'll just keep it a surprise for you guys. Give me a second. All I need's a little love in my life. All I need's a little love in the dark. A little, but I'm hoping I might kickstart me and my broken heart. I need a little loving tonight. Hold me sure I'm not falling apart. A little, but I'm hoping I might kickstart me and my broken heart. दिल को तुमसे प्यार हुआ, पहली बार हुआ तुमसे प्यार हुआ, मैं भी आशिक यार हुआ, पहली बार हुआ तुमसे प्यार हुआ, छाई है बेताबी मेरी जान, कहूँ मैं क्या करूँ क्या करूँ क्या करूँ, दिल को तुमसे प्यार हुआ, पहली बार हुआ तुमसे प्यार हुआ, मैं भी आशिक यार हुआ, पहली बार हुआ तुमसे प्यार हुआ. If we have some more time, then I can sing another song, or
Sure. It's all yours.
Okay, so I'll with one last song. So I can sing all kinds of songs, but the kind of songs that I really love is romantic songs. So I listen to Ed Sheeran, I listen to Taylor Swift a lot. So yeah, I'm gonna perform one Taylor Swift song for you guys, and it's all known. So if you guys wanna, hum along, you can do that. Okay, this is Love Story by Taylor Swift. We were both young when I first saw you. I close my eyes and the flashback starts. I'm standing there on a balcony in summer air. See the lights, see the party, the ball counts. See you make your way through the crowd and say hello. Little did I know that you were Romeo, you were throwing pebbles, and my daddy said, stay away from Juliet. And I was crying on the staircase, begging you, please don't go. And I said, Romeo, take me somewhere we can be alone. I'll be waiting. All there's left to do is run. You be the
Keep this down for a little while. Oh, 'cause you were Romeo, I was a Scarlet Letter. My daddy said, stay away from Juliet, but you were everything to me. I was begging you, please don't go. And I said, Romeo, take me somewhere we can be alone. I'll be waiting. All that's left to do is run. You'll be the prince and I'll be the princess. It's a love story, baby, just say yes. Thank you. Thank you.
Joshua, just one small personal request. If you could sing some Ed Sheeran, Thinking Out Loud.
Dude, I was gonna sing that. Okay, sure. Definitely.
Yes.
Definitely. Okay. I need to get the chords. Just a second. Are you a big fan of Ed Sheeran too? Okay, so yeah, I've got the chords. Okay. When the last one, wait, I forgot the lyrics. Okay, yeah. When your legs don't work like they used to before, and I can't take you off of your feet. Will you mind to remember the taste of my love? Will your eyes still smile from your cheek? Darling, I will be loving you till we're 17. Baby, my heart can still fall us hard at 23. I'm thinking about how people fall in love in mysterious ways. Maybe just the touch of a hand. Well, me, I fall in love with you every single day. And I just wanna tell you I am. So honey, now take me into your loving arms. Kiss me under the light of 1,000 stars. Place your head on my beating heart. I'm thinking out loud. Maybe we found love right where we are. Thank you.
Thank you. That was such an amazing voice. Like I couldn't stop resisting myself, from not listening to you. I was like, oh my God, this girl has my heart already. Like
Thank you.
genuinely. And I'm like, wow. Oh, I would really want to meet you in person. I'm not a musicality or singing person, but I am a dancer, yes. Hardcore dancer.
Ooh, that's nice. I want to learn dancing too.
It's fun. Just be there and do whatever you feel like. Like there's no one watching you. That's the motto what I follow when I'm dancing.
We couldn't stop vibing to your songs, seriously. Like
Yeah.
break and we were supposed to get other things done, but I really sat here and did not leave my chair. Seriously, it was amazing.
Thank you so much. It really means a lot. Thank you for
Also, the YouTube comment section is going wild for you. So they're loving you as well.
The chats also are going, a lot of comments I'm getting like, whoa, amazing session and everything. They're loving it. They're loving you.
Just
So, yeah,
promote
you did
yourself.
a great job.
Add your Instagram and stuff and just tell them how they can catch you.
Guys, I need to go follow this person now.
I already did.
I'll just say one more time. It's underscore Josha JOSHA _MAGGIESELSON _. Thank you so much.
Thank you.
Bye.
Yes, Joshua, we have an e-certificate for you. We'll just give you now, right? Can you please stay back there?
I said I'm right here.
Here it is.
Thank you. Thank you so much.
Hey Joshua, this e-certificate will be sent to you shortly.
Thank you. Thank you.
Okay, with that, we will now be breaking into a lunch break. Guys, please tune back in at around 1:55. We'll be starting our session with the next guest speaker then. For all the people who are going to be tuned in throughout this break time, we will be playing some exciting games with you, and we do have prizes to give away. So please stay back, please play the games with us, and then we can continue with the session after the lunch. Okay, with that, let's get started.
In India, the rate of mental health practitioners is 0.3 for every 1 lakh people as per the World Health Organization. There is a great gap that exists between the providers of health and people in need.
With this global pandemic, things have gotten worse, and it is predicted that after this, we will be having a mental health pandemic.
We are a growing population with complex issues but not enough resources for help.
Psychology is seen as an interesting blend of science and art. It is becoming a popular choice for many students.
However, there exists a taboo regarding mental health and the field of psychology. This prevents a large section of society in urban India from seeking help, while rural India suffers from lack of resources.
The mental health scenario in our nation is highly disorganized to pockets which are inaccessible to the most. The regulatory bodies are not structured either.
All these reasons have added a lot of instability and lack of guidance for students who want to come in the field as well as have a rewarding career.
There's a huge scope and imbalance psychology despite what people might be telling you. So come join with us and explore the field of psychology as well as latest trends which you might have never heard before.
I'm super excited to talk about Encyclopedia Even. It's one of its kind in the world. It is designed by the student for the student. There are eminent speakers coming from the various fields of psychology to discuss to answer all your kind of a question, whether you are a PhD student, you are a UG student or PG student or school students.
In India, the rate of mental health practitioners is 0.3 for every 1 lakh people as per the World Health Organization.
There is a great gap that exists between the providers of health and people in need.
With this global pandemic, things have gotten worse, and it is predicted that after this, we will be having a mental health pandemic.
We are a growing population with complex issues but not enough resources for help.
Psychology is seen as an interesting blend of science and art. It is becoming a popular choice for many students.
However, there exists a taboo regarding mental health and the field of psychology. This prevents a large section of society in urban India from seeking help, while rural India suffers from lack of resources.
The mental health scenario in our nation is highly disorganized to pockets which are inaccessible to the most. The regulatory bodies are not structured either.
All these reasons have added a lot of instability and lack of guidance for students who want to come in the field as well as have a rewarding career.
There's a huge scope and demand in psychology despite what people might be telling you. So come join with us and explore the field of psychology as well as latest trends which you might have never heard before.
I'm super excited to talk about Encyclopedia even. It's one of its kind in the world. It is designed by the student for the student. There are eminent speakers coming from the various field of psychology to discuss, to answer all your kind of a question, whether you are a PhD student, you are a UG student or PG student or school student.
Hey you guys, good afternoon. I see that a lot of you are back and the numbers will keep flooding in as we go. So for the game that I promised you guys, right? So we have two spot games for you. Um, we expect participation in a large quantity because we will be giving out prizes. So this has to be competitive. Um, with regards to the game, it's fairly simple. The first is it will test your memory, it will test your interest in psychology, as well as your typing speed, be it on your laptop or on your phone, whatever it is that you're using to join us in this session. These are the few things that we'll be testing. So what I request from you guys is to get onto the chat box, irrespective of whether you are on Zoom or on YouTube. What you have to do is name as many psychologists as you can in the next 2 minutes. 3 people with the highest number of psychologists, we will have prizes to give away. So without further ado, I hope people are ready. Can you please comment on the chat box and let me know if you're ready? I will then start the timer and then we can begin accordingly.
Try not to Google because we will check that too.
We will check that too.
Do not copy paste as well, please.
Okay. Do we have any people ready? Can I have some responses, please? Nobody's interested. Ready. Okay. Yay. Okay, we have more people joining in. Okay. So let me start. Okay, you want me to repeat the game? Okay. In the next 2 minutes, so I'll have a timer that goes for 2 minutes. In that 2 minutes, you have to name, type down as many psychologists' names that you know. Also, one thing to bear in mind, I know you have a list of psychologists' names as virtue of being part of the summit. We have called on quite a few. So you can't use the speakers on the summit. They have to be outside of the summit. So I will be starting the timer now. And with that, ready, steady, go. Okay, we have Drashti leading the game right now. We have a lot of new unknown names as well, which is very, very interesting to see. Lovely. From the looks of it, Drashti is leading the game. And you have 20 seconds, 20 more seconds to go. And time is up. Okay, you can stop texting now. So one of the members on the tech team, please just count the number of psychologist names mentioned, and the people who have the highest number of names, we will be contacting you from 3G School of Psychology, and we will be giving you a prize. So don't worry. We actually have another round if anybody is wishing to redeem themselves. This again will measure your interest, your understanding of psychology, and your speed in texting. This round will be, can you name psychotherapies? The maximum number of psychotherapies. We have a few standard ones, but then there are a lot more than that. So we want to see how many unknown and unique names you all come up with. Okay. So again, the rules will remain the same. You have 2 minutes. The person with the maximum number of named psychotherapies, relevant ones, we will be checking for that as well. So don't make up names. You will be getting a prize from 3G School of Psychology. And with that said, I hope you guys are ready. Yes, okay. So your time starts now.
Is chess therapy really a thing? I've never heard of it.
Yeah, I just saw that. Even attack therapy, I wasn't aware if that is something not made up.
Mandala is quite popular these days.
Guys, you have 30 seconds. 30 seconds.
For this, there's a bit of a competition.
Mm-hmm.
Next should be phobias or something.
Yeah, I know. Time is up. Guys, your time.
You're on mute, Angela.
Sorry. So what I was saying is, I'd like somebody from the tech team to get in touch and do the calculations. And again, we will be getting in touch with you today and giving you your prize. The last round that we will play, like Ria mentioned, will be listing phobias. The rules will again remain the same. You guys have 2 minutes, and the person to name the maximum number of phobias wins. Okay. So with that said, your time starts now.
Google is working just fine.
We have a competition happening on YouTube as well. So please, tech team, please take note of that. Lovely. Guys, 30 seconds. 30 seconds.
I'm learning quite a bit of new phobias over here. I'll have to Google all of this now.
Check them out. Yeah, exactly.
Lovely. Tapsi has also mentioned what that fear is of. That's nice.
Thank you.
Lavanya, amazing. And your time is up.
This was fun.
Okay, with that, we have completed 3 rounds, one of psychologists, one of psychotherapies, and one of phobias. The winners of all 3 rounds will be given gifts from our end, from 3G School of Psychology. And I hope to see you soon now. In the next 5 minutes, we will have our next speaker joining in. Till then, please enjoy. Tech team, over to you to play the videos.
जी आ गई है
हाँ जी हाँ जी
बस अपने आप ही आ गया
अदिति कौन है please? In India, the rate of mental health practitioners is 0.3 for every 1 lakh people as per the World Health Organization.
There is a great gap that exists between the providers of health and people in need.
With this global pandemic, things have gotten worse, and it is predicted that after this, we will be having a mental health pandemic.
We are a growing population with complex issues but not enough resources for help.
Psychology is seen as an interesting blend of science and art. It is becoming a popular choice for many students.
However, there exists a taboo regarding mental health and the field of psychology. This prevents a large section of society in urban India from seeking help, while rural India suffers from lack of resources.
The mental health scenario in our nation is highly disorganized to pockets which are inaccessible to the most. The regulatory bodies are not structured either.
All these reasons have added a lot of instability and lack of guidance for students who want to come in the field as well as have a rewarding career.
There's a huge scope and imbalance psychology despite what people might be telling you. So come join with us and explore the field of psychology as well as latest trends which you might have never heard before.
I'm super excited to talk about Encyclopedia even. It's one of its kind in the world. It is designed by the student for the student. There are eminent speakers coming from the various field of psychology to discuss, to answer all your kind of a question, whether you are a PhD student, you are a UG student or PG student or school student.
over to you to invite our next speaker.
Thank you, Anjana. Very good afternoon to ladies and gentlemen present in the dais. It's my privilege to invite our next speaker, Aruba Kabir Pathak. Aruba, as a distinguished expert in the field of mental wellness, has been contributing to society in innumerable ways. Based out of Gorgon, she has been proactively using the lockdown period for creating awareness about mental health, its importance and significance. 1 Minute Mental Health was one such initiative run in the holy month of Ramzan in association with RJ Nazir for FM Tadka, and the aim of the initiative was to send across a message regarding mental health every day during the designated period. The one an overwhelming response. He recently concluded series called Stand Up to Sigma, featured renowned artists, celebrities, humanitarians from various walks of life spread across the globe with the simple aim of normalizing mental health derailments. The series stirred an amiable response with more and more people coming forward and seeking professional consultation. Now, I would like to welcome with all our heart Aruba ma'am to enlighten us through her words of wisdom and knowledge. Welcome you to the dais.
Thank you so much. Hi. Thank you so much for having me. It's such a wonderful thing you guys are doing. So I'm really honored to be part of it.
Thank you so much, ma'am.
I cannot hear you. I'm sorry.
Thank you so much, ma'am.
Okay.
Ma'am, you can start with the session. Thank you so much for being here.
Thank you. Thank you. So we are going to talk about the possible careers for, mental health professionals in India. Now, I really want to begin with, there's a study from WHO which shows that 1 in every 5 or 6 human beings will have a mental health challenge, looking at the pandemic and the unprecedented times. And there is a lack of 300% of psychologists around, mental health professionals, which includes counselors, clinical psychologists, psychiatrists, and other mental health social workers. So we have to understand that we shouldn't be thinking that I study psychology, what is going to happen? This is the only career in last 10 years, in 1 decade, which has had 22% of growth. There's no other such career, not in mathematics, not in medicine, not in English literature, but it is in psychology. And to be honest with you all, when I studied psychology, when I did my graduation in psychology, it was not something I wanted to become a psychologist, but I just did it. It was one of the subjects I was asked to choose, and I chose, psychology, journalism, and women's studies I'll study. But it was only in the second year, I got so fascinated. I was like, wow, this tells me a lot about myself. Forget about the people around me. So that's how it changes your life. So I want to tell you that if you're somebody who's trying to pursue a career in psychology and you think there is no career, not at all. Child psychology is becoming really important. Every school has to hire a child psychologist. A lot of psychologists reach out to me and they say that we don't have a job. And if there is a job, it doesn't pay much. But I really want to tell you all, no, it is not the truth. Psychology jobs, because there's a lack. There's not many professionals are out there. And it is becoming compulsory. It is becoming compulsory that people have to have a psychologist in organizations, industries, corporates, colleges, schools. You just have to choose your option wisely. Now, does this, the psychology, does it mean that you will just be dealing with mental health disorders? Right? A lot of people have this, they don't know the challenge and disorder. They feel schizophrenia is also a disorder, and Anxiety is also a disorder, and having difficulty in your marriage is also a disorder. No, having difficulty in your marriage or basic anxiety, what we all have, that is just a challenge. And disorder is a clinical diagnosed disorder. So yeah, so if you think that, okay, I don't want to get into clinical psychology, then what else can I do? Well, there are lots of options out there. You can be one among the HR personalities in corporates. You can be one among the industries. You can be a rehabilitation officer. You can be anything. Psychology has various branches. It is just that you have to ask yourself that, what do I want to do? It's very important to know that and see what your interest is. Okay, then there's a question is, what is the scope of neuropsychology in India? Huge, huge. You can become a researcher, researching about new illnesses, new therapies, new ways of looking at it. You can also work with a psychiatrist. You can also work with a neurologist. That is the beauty of it. You don't just have to stick with a psychiatrist. You can also work with a neurologist, because in India or all over, neurologists do see a lot of cases, right? So you can work with them. You can become a professor. You can teach. You can go, if you don't want to become active in, as a counselor, as a therapist, as a professor, you can start like assisting people, managing rehabilitation places. So there's a huge scope for neuropsychology. You just have to figure it out, that which college do you want to go, what options do they have. But yes, it is there. Okay, then another, what is your opinion doing masters for psychology abroad? Okay, so I have a master's from India, and last year I was applying for masters from abroad. I'll be very, very honest with you. I will not say that it does not mean anything. It does. The exposure is completely different. I have done few internships from Glasgow, from Scotland. I've assisted few psychiatrists and psychologists there. It's totally on another level. The way they look at it is absolutely okay. But because of the pandemic, I wasn't able to go for a master's, which would have been a double master's. They offered me online, and I didn't want to do online, because it will not just do the justice I would want to do in the field, looking at people, studying their behavior, helping them resolve their issues. So I did not go. So yes, it is. But at the same time, I really want to tell you this, that our culture really makes a difference in your therapy. For example, I being the North Indian, I have a lot of idea about how North Indian people live, work, talk, slangs, right? But I really have to pay a lot of attention and do more researches when I see clients from other countries, or when I see clients from my own country, from other parts of India. So it does make a lot of difference. So yes, doesn't matter if you do masters from abroad, you should still take a lot of internships and assist a lot of psychiatrists and psychologists in India, so that you have that grip on it when you're talking to people. The most important thing about therapy is that the client has to connect with you. If they don't connect with you and you cannot connect with them, the therapy goes for a toss. There was a time when I did my studies, it was a rule that your client should not know anything about you. They should not know, are you married? Are you single? Where do you live? What do you do? Nothing should be out there. But now the approach is changing. I changed my approach long back because I found that useful. But now, in fact, in the colleges, they say, okay, fine, give the information which can help them. So it is changing. So I guess it's very important, even if you're thinking about doing it from abroad, you will have to do a lot of internships and assist a lot of people in India as well to get do the groundwork, legwork. It's very important. But I won't lie to you. In India, still, we are given a lot of theory, but abroad is totally different, because I have studied in parts and bits from abroad. It's totally different over there. Yeah. Okay, so if you have any more questions, you can definitely ask me here. Until then, I can really talk about, okay, I have a question. Do you think it is equally important to learn about the practical side of psychology as much as the theoretical part? Oh, totally. I am so with you on this because it is, you cannot talk to a client in a theoretical language which you have studied in your college. No, you just have to keep it very plain. And my clients find it like, as a practitioner, my clients find it very easy to connect with me because I talk their language. I make them understand in their language what I want to. I don't label people. I don't put them in boxes that, oh, you have narcissistic characteristics. No, I might know. I would just, put it in a very plain language for them. So it's very important to have that first-hand practical knowledge. And this was among the very good things when I offered internships in my studio in physical premises. Students used to find it very different from other places. They were like, ma'am, in other places, it's more about theory. What have you studied? That's what we are applying. But here it is completely a different thing. So I guess, yes, it's practical is totally different and you need to pay attention. If I'm a counselor, just imagine I'm a therapist and you're my client and I'm talking to you and I'm doing like this again and again. Now, what am I doing? What I'm doing is that I'm distracting the client. I might also trigger some memory. That is the reason that you have to be very calm, composed, not with a very big smile, not with a sad face. And all that happens in practicals. Until and unless you don't do that, until and unless you don't see your seniors working. I have learned from so many people. And I don't feel ashamed of it. I still take internships because I still want to go out there and see what is new in the market. How are the students taught? I learned from them. So yes. Okay.
So ma'am, there's another question
Yeah.
on the group. What is the scope of positive psychology in India?
Okay. I find this very fascinating. So maybe before pandemic, people wouldn't listen to you about it, and they wouldn't agree with you if you have studied positive psychology. You say, you are not a psychologist. What is this? You're asking people to do a walking meditation and doing colors or changing their way how they talk. Just give me a second. Just a second.
Sure, ma'am. Till then, guys, if you have any more questions, please put it on the chat box and we'll get them answered.
Oh, sorry. Yeah. So, but now it is totally changed. Through positive psychology, you can work with people who have chronic illnesses. You don't have to diagnose, you don't have to change their emotional behavior, but at the same time, because of the positive psychology, you're changing their outlook about life. Automatically, the emotions change. Through positive psychology, you can work with kids. Through positive psychology, I had a huge clientele in my studio who were autistic spectrum. And we used to do a lot of positive psychology things with them. So I guess, it is not about any field of psychology is going to be very, very crucial. This pandemic might get over, but it is going to leave a big scar. And not everybody, people think if you visit a psychiatrist, you are given medicines. Not every psychiatrist gives you medicine. Not everybody needs medication. So then what are you going to do? Positive psychology comes in play. And it is for people who do not want to, also like for people who do not want to deal with chronic mental health disorders, serious mental health disorders. Okay, fine. Mm-hmm. So it is very simple and it is easy and it keeps you up and about more than anybody else. Like, okay, fine, your client might know, but you'll be like, oh, wow. So yeah, it is like that. So positive psychology is going to be, and anybody can study it. It's not that you need any background, so and so. Anybody can study it. Anybody can go ahead with it. Yes.
Okay. So the next question is, Shreya is asking, which types of psychologists in India is lacking? And which are the psychologists that we need in future at the moment in India?
Which type of psychologists are we lacking? We are lacking all kind of psychologists. We're lacking all kinds of psychologists. Recently I was very, I won't say disappointed, because that's what I expect here. A psychologist sent me a message, and it did not sound that she was asking me to do it. It sounded like she was ordering me to do it. Now, coming it from a psychologist, I would not expect that. And she's doing her MPhil. And I was really like, how would she be talking to clients? She knows I'm from her profession. I might analyze it more than anybody else. And then I edited it for her. I said, no offenses. I have edited this. How about you share this message with others? So, you really have to. And she said, I'm so sorry, ma'am. I'm not good in communication like this. Now, okay, that's what you have to train for. So we lack every kind of psychologist here. It's not that, this and this clinical nahi hai, counseling nahi hai, mental health professional nahi. No, we are in like, there's a dearth. We need to have more and more people trained, experienced, working with people. But guys, please, one thing I really want to tell you all is, do not get into practice unless and until you don't work on yourself. It is a very fragile field. Your one word can make or break someone's life. So be very careful what you talk to the client, what you put in their head. So please be very careful about it. I remember I was assisting in a psychiatry hospital, and there was a case of schizophrenia. So I told the younger sister, I was also very young, so I didn't know better. So I told the little sister, I said, listen, in her head, everything is really very real. So she can make you do things which you will not even be able to imagine. She can convince you, and she has an influence on you. And the next thing goes that the little sister goes and tells her sister, the therapist told me this. And it became a very big thing in the hospital. And then I realized that I was not supposed to do that. That's how you learn. You make mistakes, you learn. But the good thing about it, I was assisting somebody. There was somebody superior than me to handle the situation. And the person went, handled the situation, and I learned from it. So don't just dive there. Okay, now my degree is complete. I have MSc, I have MA, I have MPhil. Now I'm going to go there. Don't do that. It's very important. Yes.
Right. So Zosha is asking, why do you think people take mental health problems as stigma or something which is not real? Though it's changing in recent times, but there's the stigma still there.
Well, I'm talking about mental health, dude. We are still not accepted as females here completely. So it's a huge journey. It's a long journey. I guess we have come to a really good place. And I guess movies, media has really exaggerated it. For example, if I remember Tere Naam movie, Salman Khan has PTSD, and how they have shown the mental asylum. It is not a place anybody would want to go. And schizophrenia, bipolar disorder, these all things were considered demonic until just 5-7 years back. It was very superstitious thing. So I guess, because of the kind of image we have given to it, stigmatized, that you are not in your control and you can do anything. But it is changing. Then there are movies like Bhool Bhulaiya. Akshay Kumar really changed the image of it. So I guess we have come a long way. At the age of 21, I'm 33 now. Oh yes, I turned 34 yesterday. So yeah, 34. So 21 to 34, I have seen a change, a graceful change. I will not give credit only to pandemic, but when I started, I was looking for a counselor for myself because I was going through depression. I used to travel from Faridabad to Gurgaon. I don't know how many of you are aware of the distance. And that time that, there's a one smooth road now, it hardly takes 40 minutes. Those days it used to take 1.5 hours. I used to come all the way to see the therapist. We shifted to Gurgaon because of the medical reasons. But now look at it. You throw a stone, you find a therapist. So it is not difficult. I guess, the stigma is there. And if you really want to help to end the stigma, You talk about it, forget about others. You say that, yeah, I was upset and it's okay to be upset. Yeah, I went to therapy. How many of you are talking about your own therapy? No, we take the therapy, then we don't talk about it. We don't tell anyone that you should also go for therapy. Kisi ko pata na chale. So I guess forget about the world. You talk about it and let's see how it goes.
So along those lines, again, there's a question related to it. What factors or practices can keep us mentally healthy?
Okay. First of all, I guess very, very important, 3 things which I always ask people to do is your physical workout. Your physical workout is very, very important. It makes you release feel-good hormones. You might feel this endorphins, these things are not so important. But guys, to get good sleep, to get good appetite, to have a fresh mind, it's very important, the release of these hormones. Then serotonin, again, is a very important hormone which gets released like this. And dopamine is something which is caused because of empathy, helping people, feeling useful. So you need to be kind to yourself and others. Having social connections. Second would be having social connections. Very important. We think that, now we have technology. Why is it so important? But you have to understand that, listen, 2 things very important. One, I always feel that it is my own responsibility to take care of myself. Nobody else should. And if I need it, I will ask help, but I should not be expecting someone else to take care of me. Number. But the most important thing is, I was born from a human being, from a womb. So much of physical touch. Then, if I am breastfed, I have healthier emotional and physical health. If I'm not, if I'm hugged, cuddled, I have more warmth in me. Just imagine from that how much important it is for us to be around other human beings. So have social connections. Third, I will say drink water. We always focus on our physical body by eating right, by doing this and that. But you should know how physical food is food for our physical body. Water is food for our brain. So the brain fog, memory issues, yaad nahi rehta hai, I feel like day went by, pata nahi chala kaise gaya. All that is because we are not hydrating our brain enough. So drink enough water, which is good for. And the plus point is you will get good acne-free skin and all that stuff.
All right. Yeah, that was really insightful. These are the things that we could, apply in our life all the time, but we are just not doing it. And these are simple things.
You don't need
Yeah.
anybody else to do anything for you. Water you can drink, exercise you can do, people you can connect with. You're not dependent on anyone. But we don't do it. Apart from that, if you have been having a difficult, if you had a difficult childhood, troubled child, and irrespective of that, irrespective of anything else, I always tell people, like we clean our houses every day on everyday basis, but we still on Diwali and Eid, we do the deep cleaning. We open the almiras, we under the bed. The same way, there's nothing wrong in seeing a therapist, even if you are not facing a bigger issue. Go have a chat. We get the annual medical checkups done every year. But do you get the mental checkups done? What is wrong in that? Do it. So yeah.
Okay, so we are slightly, taking a different route now from mental health. Anonymous attendee is asking, what are the courses we can do to study law and psychology together? And are they helpful?
What together? Psychology and?
Law and psychology.
Law and psychology, there are branches in psychology, criminal psychology, we can go in criminal psychology, and we can forensic psychology, and all these things are there. So I guess if you study law, then you can definitely do your psychology also. I don't know much about the kind of combination courses there would be, but you can definitely have psychology along with it, or you can do masters in it. So there definitely are courses. I have a friend, she's right now working with forensic department. So then I have a friend who is working with a criminal lawyer. So there definitely are like combinations, and you can definitely get into find out MIT. MIT do have good courses. So,
All right. So there are a few questions. I'm going to sum it up. After doing your master's, how do you pursue psychology? Like, are there any internships that we could take up? If yes, where should we look for? And if you want to do it abroad, internship, but in India, so are there any online internships available? Because especially during such times, during pandemic, the world has opened up. So yeah.
Underneath everything is online, for example, I also take interns, but I only take 3 interns at a time. I don't have a very big team right now because of the offline system. But before we used to take 17 interns at the same time. But yeah, now it is reduced to 3. But there are people like me who, if you want, you can check with Dr. Anjuman. Dr. Anjuman is a psychologist who is very renowned in the field. You can check with Fortis Hospital. They also provide a lot of internships online. Only the sad thing what I find with other people is they charge you for internships, which I don't find, like, because I don't charge people. So I don't find it like a good thing. But I know if they are giving you a lot of time, they also need to make some money out of it. So it's a bit of investment, but there are lots and lots of mental health internships. As a psychologist, like if you're a budding psychologist, if you're a mental health advocate, a lot of people are starting these mental health advocate pages and are trying to help society. But I really want to tell them also, have you any, experience in it? Have you assisted somebody? Do you know actually what to talk? I'm not saying because you would be giving wrong information out there, but I'm saying it is going to impact your emotional health. I have been trained for now, like I've been working as a practitioner for last 8 years, but I got myself trained for 6 years first before I dived in. Otherwise, the client would tell me, "Meri health kharab, meri bhi health kharab." The client would start crying. I would start crying before her. Or if I'm not crying there, the client is gone and I'll be like, I know, मेरे भी partner ने ऐसा ही बोला था. So it's very important that it is not I'm asking you to stop your things, what you are doing because you're doing anything wrong. No, we need it. But have you gotten yourself trained? Have you gotten yourself clean? Are you working with a therapist on your own? Are you working on yourself? Then only doing it. But yeah, there are lots and lots of internships out there online. And I guess Fortis is the big name right now. Dr. Samir Parekh is there. I really appreciate him. And he provides lots and lots of internships.
All right. So Ashi is asking, what is the difference in neurology and clinical psychology?
Okay. Neurology and clinical psychology, I would say, you do masters in both, clinical and neuro if you want to go to. Now, neurology, as I said, it also gives you an upper hand to work with a neurologist because you are more about, nervous system and all. And clinical psychology, you can do the psychometric test, psychotherapy, and you can work with any kind of psychiatrist. You don't have to have like proper, I just have to work with a neuropsychiatrist. But if there is a neuropsychiatrist, it's a branch. So if you work with them, you have a better hold on it. For example, I don't take cases from neuropsychiatrists because I don't feel comfortable. I have not studied a lot about it. I don't take clinical cases also. I take very light clinical cases because I'm not a clinical psychology person. I studied it, but not really good in it. So you need to understand that are you good in it? Have you trained yourself in it? And the career options are amazing. Somewhere people are thinking there aren't options, but there are options. There are lots and lots of options. And Abhi, I am so surprised. I was just going through this one article and they said that now, child psychology, the kind of things are going there, family psychology, and then couple psychology. Lots and lots of people are taking those courses and universities are introducing those courses. So yeah, you just need to understand that if you want to work with a neuropsychiatrist, neurologist, then you can go into the neuro field.
Right. Okay, so the next question is slightly personal. So anonymous attendee says, I personally have social anxiety and communication skills are a weak point for him or her. But psychology really fascinates me. And the idea of helping people in this area really fascinates me. Do you think that can be worked on, and would it be a good idea to try being a therapist? Or are there other fields in psychology that would be better suited?
Okay, you have an example here who has had suicide ideations. I have tried to kill myself 3 times in my life. Fortunately, I did not die. I have had clinical depression. I have been on medication for 8 months for my depression. I have gone through therapy for years and years. I still have a therapist, but does it impact me anyway in my career, in my life? Not a single client can tell me that I make any wrong I provide any kind of wrong therapy to them because I worked on myself. So if you think social anxiety is there and you know you lack communication skills, it would be such a beautiful thing. You can tell tomorrow that, this is what I was, and now this is what I am, and I'm there to help people. But at the same time, if you're not comfortable talking to people, you don't want to go out there, we all have personalities. You can choose research. You can still do PhD, you can do MPhil, you can be a researcher, you can help with researches, finding new therapies, finding new cases. There are not every therapist is the face of the therapy. There are certain therapists, for example, in my team, I have 2 people who do only analysis. They don't want to interact with clients. And they tell me, ma'am, we make so many mistakes. If we talk to the client, we're not comfortable. Okay, I can't force them. So there are lots of things you can. But first, try to work on yourself. I'm sure you will be able to overcome it.
Right. Okay. Another question is, what all is the need to become a child psychologist? And what is the best approach if you want to become a child psychologist? What is the process?
Masters is you do masters in counseling psychology, choose a branch of child psychology, and study about it, and definitely then assist couple of child psychologists. Dr. Riddhi Joshi is a very good child psychologist in India. You can talk to her. Dr. Meeta Shah is there. She's not doctor, but Meeta Shah is there. So yeah, there are a number of child psychologists who are working right now in the field, have a graduation, do masters in counseling psychology, choose a field, do MPhil. Yes.
So what are the traits that a psychologist should have to pursue this career or develop?
When you start BA or BSc or whatever you are doing, when you start with that, you might not have those traits. But the important thing is you can always develop them. That is first having clarity with yourself, because if you don't have clarity with yourself, you'll have very poor boundaries. You will have a lot of emotional baggage and you would not know where to navigate it, how to navigate it. So it's very important that you work on yourself. Number one would be that your emotional side should be stable, clarity should be there. Second, your physical health. It's very important to work on your physical health. For example, I live with a medical condition. I have a chronic illness called cystic fibrosis, which makes me cough quite often. So, but I make sure that at least, it shouldn't be so much that there is a session happening and coughing and it's disturbing my client. So I make sure that, okay, fine, either it's a light session when that time period is there, but I work through it. I work around it. I don't take sessions in the early morning because that time I am coughing. So you will just have to figure out how your physical health is, because if your posture is poor, if you're continuously shaking your leg, if you're, if you are nervous, then it is not like something a client would be comfortable with. Third thing, most important, is the communication. How are you talking? And you don't understand anything, ask it. Be the stupid person in the room. Ask questions. Sometimes people use, like English is not my mother tongue. My mother tongue is like, Kashmiri, but never lived in Kashmir. So we started speaking Hindi, Urdu, Pashto, Kashmiri all together. And by the age I was 20, I was good in nothing. I didn't have super command on any language. I'll mix things. I'll speak Hindi, English, Urdu, Pashto all together. So it would be a mess. But my clients might not be comfortable with that. So I need to have a command on a language. And if you don't understand anything, ask it. You do not understand a fancy word, it's okay. And just tell them, I'm so sorry, I didn't get it. Can you explain it to me? What does it mean to you? For example, now we have this thing that, okay, psychologists, we understand people, we can read their behavior, we can, just look at their face and tell what are they going through. No, it is a wrong thing. It's a wrong ideation. You cannot, until and unless a person does not talk to you, you cannot understand what they are going through, number one. Number two, I was talking to this client and I asked her, and again, in my early days, and I have made so many mistakes in my life, in my career. So I asked her, she was like, it was green color and I wasn't comfortable. I was like, oh my God, green is nature, green is forest. Why were you not comfortable? She looked at me and she said, green means hospitals for me. Because she spent her childhood in hospitals, green curtains, green bed sheet. You see the difference? So don't assume. You don't know. You're the stupid person in the room. Ask questions. Green? Okay, what does green signify for you? Anger? Okay, and what does this mean? Like, how do you get angry? What do you do? Don't think, okay, angry and this is, no, some people are quiet. So be the stupid room. Have the patience to listen and very active listening. Just listen to them. Do nothing else. Don't try to assume, oh, yes, ho sakta. Yes, no, nothing ho sakta. Only wo ho sakta hai what the client is telling you. So active listening ke liye bhi physical health is very important, because if you are not physically active, physically healthy, you're like falling, you are doing this, you're like, oh, changing your postures. It's very important. Your physical, your mental, your communication skills. These are three things I always tell people, work on these three areas.
All right. So Zoya is asking, would you suggest that if they are pursuing a general BA in psychology or BA honors in psychology to become a clinical psychologist, which one is preferable, a regular BA or BA in honors?
I don't think so that makes any difference as long as you have psychology as a subject.
Okay. So another question is, along with the degree, should we also do short courses related to psychology? Would that be of any help to us?
Any
should
help?
we do
I guess great. Any help? I guess great help. Along with my degrees, to be honest with you, my degrees might. I'm not saying that degrees are not helpful. Degrees are definitely helpful because you need these certificates and all. But when I studied psychology, it was not really very practical for me. But the other courses like positive psychology, taking separate CBT, working as a hypnosis, getting trained myself in yoga, meditations, and all that really helped me understand. And Indians, we are more of like holistic people. That one thing, just do this thing. No, we have to understand that our culture. We're very spiritual people here. So combination of things really helps you. And if you understand different therapies, it gets very easy.
Right. So Aarti is asking, for neuropsychologist, is a science background necessary?
Yes, absolutely. So BSc has to be there.
All right. Another question Geeta is asking, how to build a career as a mental health psychologist and psychotherapist?
I guess, the psychotherapist and psychologist is not much of, there's not much of a difference. But psychotherapist is right now a better word for it. And initially we were saying, and psychologists earlier, we were not called as psychologists when you just did MA. You had to do minimum MPhil. But now it is changed. If you have done MA in psychology and you are called counseling psychologist. And that is one of the reasons I don't use psychologist next to my thing, because I'm still old school. I feel I haven't done MPhil, I haven't done PhD. So I'm not a psychologist, I'm just a mental health therapist. And I provide more of therapy than counseling advices. So that is something, I believe in. So psychotherapist is like somebody who has studied psychology and is working right now as a therapist, not as a counselor. Counseling involves a lot of advising, telling you, navigating you, finding things from you, and then asking you, okay, fine, how about you do this and that? Therapy is more of you give a lot of homework. How about you work through this? You do the art therapy, you do positive psychology, all of it, and CBT and all.
All right. Just a second. Is it natural to feel nervous every time you see your therapist?
Well, I guess if it is every time, then there is something your therapist is not making it go away. But there are times, like I just had a session before this, and that client is working with me for the last 3 months. And today he had a session, according he's in another country. So for him, it was 11:30, and for me, it was like 12:30. And he said that he has been awake since 6. He has been anxious about today's session. But I totally understand, because last time when we left the session, I told him, next session, we are going to talk about your childhood with your mother. So he was anxious about it, what's going to happen, what is going to come out. So I totally understand that. But if you are nervous every time, then maybe you should talk to a therapist and say that, I don't feel very comfortable. there might be something. There are days when you are nervous and you are anxious because big revelations are happening. Not every
Right. Right. Spreha is asking, I have done my bachelor's in philosophy, but want to pursue psychology ahead. So should I do master's in psychology or applied psychology or clinical psychology?
It's quite confusing for me also. So I wouldn't know much about it, but I guess you can go for any psychology, and you just have to understand that what are you interested. Check the subjects, check the topics. Before you apply for any kind of a psychology course, there's always a syllabus they share with you. There's a PDF they share with you that these are going to be your topics and subjects. So just see if it interests you. Do a little bit of research about it. That is it something I really would want to do. For example, I was very clear I didn't want to go in clinical area. I didn't want to work in a psychiatry setup. So I didn't want to, those days, people reaching out directly was very difficult. And either a psychiatrist would have recommended clients to me, or I would have to do a job. And I was not comfortable with both. So I went into counseling. I was like, okay, fine, this is something I want to do. So maybe just go through that syllabus and the subjects and make your own choice.
All right. So Khushi Jha is also asking a similar question. Since there are so many upcoming subfields in psychology, how can we decide which field suits us the best?
Because that's what I just said, that do a research and see what suits you better. And at the same time, I would still say the same thing. Before getting into this kind of a profession, work on yourself and see what is your ability and what is not. That's where there are career counselors. That's where there are other counselors who help you understand what your capability is. There are tests. Yeah.
Right. Okay.
But at the same time, just don't think that I have gone through so much of mental health issues, so I want to help people. Please don't do that. That does not work sometimes. It keeps you triggering all the time what you have gone through. So don't do that just because you are an empath. Because, if you are making it a career, it's then about your bread and butter also. So it shouldn't be that 2 days you're able to do therapy and 6 days you're falling sick, because your mental health definitely takes a toll on your physical health. It's very important. So do it because you want to do it and you can do it. Your profession should always be your passion, and that should give you money and afford the kind of lifestyle you want. Don't compromise in that.
All right. Raja Lakshmi is asking, ma'am, I'm a BSc psychology student and I really want to do my master's abroad. But most of the universities that I saw offer MA instead of MSc. So is there any problems in taking MA instead of MSc?
I guess the number one thing, you will have to understand what you want to do, number one. And number two, I wouldn't say that there are universities who are only offering MA, because as I did mention that I was wanting to do my second master's from abroad, and I was looking for MA and I was getting a lot of MSc. So maybe it's like what we are looking, we are not getting that, we're getting something else. But there are lots of amazing consultants who will help you with getting what you want. And since you have a background in science, it would be amazing to go with MSc.
All right. Ma'am, do you have any book suggestions or any sites that the attendees could go to get more information? No?
I'm so sorry. I will have something with my team because I have interns and other psychologists working for me. I can ask them, but I would lie if I just say something here. I only know about Fisher's book. Other than that, I don't open anything else. It's been a long year.
All right. So if we want to do research in our bachelor's itself, what should we do? What is there a process that we should follow?
I guess talk to your university, talk to your college you're studying from, and there definitely are research departments. And if they do take bachelor students, yes, there is a way. Apart from that, sometimes PhD students also take assistants. And if you do have a background in psychology, they would love your help. That could be something you can do along. But first, go to your college, go to your university, ask them if they have an option. Otherwise, you can always get in touch with PhD researchers and they will give you options.
All right. What is needed in order to work as a psychologist or any other type of psychologist to work outside of India for someone who has done his bachelor's or master's in India?
Okay, I guess there's an exam. There's an exam. Different countries have different format. There is an exam. You will have to do that. You will have to clear that. But as I said, maybe in India, we don't take it in account that I do my master's from abroad and I come and I start working with Indian clients, whereas the culture and everything is very different. Abroad, they take that into account. For example, I am authorized to work as a hypnotherapist in UK, but still, when I go there with my academy, I will still have to attend their courses, understand their regional thing, and then only work with people.
Right.
Yeah, so there is always an exam, but in India we don't have.
Okay. Zosha Khan is asking, does having more different credentials in psychology help in getting a more accurate and stable job as a psychologist?
See, if we do have that, that is a plus point. More credentials means more a plus point for us. But I think, as I said, because of pandemic, people are going to have more and more openings in companies, in schools, in colleges, in organizations. So I guess if you're good at your work, which is practical work, they don't need your theory. They don't need you to define what disease is. They just want you to understand, okay, these are the symptoms, you are going through this. I don't remember in recently have a labeled somebody or told somebody that you have bipolar disorder. If they came with a diagnosis, okay, they have already gone to psychiatrist or clinical psychologist, got a diagnosis. I tell them, okay, but even in my counseling, I ask them, drop it. Let's work on the symptoms. Let's work on the root cause. Drop the label. Let's not call you a bipolar. That is like, then you will be rest of the life will be bipolar. It is a reversible thing in most of the cases. So I guess it is more about your practical knowledge. Have you written? So do a lot of internships before you go for the job. So those recommendations will help.
Okay. So another question by Mannat is, what is the scope of industrial and organizational psychology in India? When can we expect IO psychologists to be a vital part of industries in India?
I don't know much about that. When can we do that? But definitely, I guess it is growing and it is going to come very soon. As I said, I'm the stupidest person in the room. I behave like that. So the questions I don't know answer. I'm so sorry. I'm not giving answers. I don't want to say anything wrong and guide you wrong.
All right. So there's another question. Which type of psychologist will get more scope in future?
It is counseling. It is counseling psychologist. Clinical people are still doing, and clinical cases still psychiatrists take them under them. Right? When a clinical case comes, most of the psychiatrists do the counseling on their own. They are good at that. But counseling, not everybody would want to go to the doctor. It is what I have realized. Not everybody would want to go to the doctor and get on meds and get diagnosed, but everybody is going to have an emotional scar. So I guess in counseling, family counseling is amazing. I have been seeing a lot of couples. So marriage counseling is going to be very hit. And the best thing about marriage counseling, there are going to be pre-marriage counselors now. So which we are really, really advocating for, creating an awareness, asking couples, take counseling before you get married. Because couples are coming to us after 2 years, 3 years, that I don't want to be with the person. So yeah, so I guess it's more for counseling.
All right. Another question by Feza is, do we need a PhD degree for clinical psychology?
If you want to get called as a doctor, you will have to. And if you want to get into deeper researches and all, you will have to. But otherwise, MSc or MPhil is absolutely all right.
Okay. If we pursue our education in a field apart from psychology, say life science, but want to do field work in psychology, even if it's part-time or through internship, is that a possibility? If yes, how can we do that?
Well, then that is called social worker, mental health social worker. You are trained, the NGO organization you connect with. There are lots of NGOs who do hire people who have a little bit of background of science and all, and or maybe arts also. It's not only limited to science, arts, commerce, all these things, and they train them in particular areas, and then they work as a social worker in mental health. Yes, we definitely can just get in touch with some NGO who's doing this work, and we can get it.
Right. Another question that I basically understand is, if you do a master's, a regular master's, which has a specialization in the second year, how is that different from only doing a master in a specialized field?
I don't understand. Sorry.
Okay. So the question is, what is the difference if we do MA psychology or MA in specialization degree like counseling or clinical? Is there any benefit of doing specialization?
Yes, definitely. Then you know you have a clarity. And you definitely have a clarity, what do I want to get into rather than a general. Like for example, long back there was only BA. There was no BA honors in so-and-so. But now when you have this honors in so-and-so, very clear that this is what I want. I want to go for literature, I want to go for science, I want to go for this. So you're very clear what you want. So that's how the MA in psychology gives you a clarity. But I am not very much sure in India. We do have a lot of colleges who give this differentiation. They teach you like in 1 year, they will teach you counseling, and in 1 year clinical. But yeah, you can definitely do it.
All right. Okay, so Shreya says she is a school student and she wants to start studying psychology as early as possible. So how can she prepare for psychology along with school studies?
Okay, Shreya, all I want to tell you is that enjoy your time now. You will have lots to study in future, but all I want you to do is enjoy, just be yourself, learn how to express yourself, learn some art, learn some form of expression. It can be dance, it can be anything. Just enjoy right now. And if you still are like, no, I really want to do it, you can start reading like books, watch series, and you just get that hold. And when you are there, you will definitely get it.
All right. So Khushi asks, which foreign countries accept 3 years graduates from India?
We are going to career counseling now, I know as such. But masters ke liye mujhe pata hai, like I was trying in UK, they did have 1 year masters, but at the same time the psychotherapy thing I was wanting, it was for 3 years, but it was not full time. It was like, on weekends and all that thing. So it was not full time. In US, it is 2 years. Yeah, something like that, but that will come under career counseling. I'm so sorry. If you had told me I have to prepare all this, I would have done some research. But I had no idea this will be something which will be asked.
All right. So another question is, can we do psychology after graduating criminology or forensic degree?
Oh, why not?
So do they have to do a diploma, master's? How do they?
Whatever they want to. They can go for diploma, they can go for master's.
So is there a difference between doing a diploma and specializing in something and rather than doing a master's?
That is, it is detailed. Master's is detailed. You get a lot of it's a degree, it's like time investment. You learn more. Diploma is a short form of a thing. For example, I have a diploma in physiotherapy, which was for 6 months. So I just know the basic anatomy, how it works, these exercises, that exercises. But if a physiotherapist has studied for 4 years, obviously he's going to be better than me.
All right. Shanann is asking, in case I don't do full majors in psychology, that is, take up 3 papers instead of 6, will it affect her master's or career in future?
Let's repeat it.
Okay. In case I don't do a full major in psychology, which usually consists of 6 papers, and instead she takes up 3 papers in psychology, will it affect her master's or career in psychology?
I guess masters to affect nahi karega, masters still, because a lot of people do not have psychology in their background and they are still able to do masters. So it would not affect that way, but it is always a detailed knowledge you have gained. And when you are studying psychology, it is not only you are studying, when I did my graduation, that time I did not realize there were such amazing experiments we used to do in psychology in the lab. And I just used to be very dishonest with them, to be honest with you all, because I had amazing people pleasing qualities. I was like, oh my god, people are going to get to know this about me then and that. So I would lie about it a lot. But I guess if you are doing it for 3 years, 6 papers, as you grow, as you are in second year and third year, the experiments are great. You have better interaction with your professors. You get into detailed this thing. Depending on your college, I was in South, I was in Bangalore, so the exposure was a little different. So yeah, I guess that would be up to you. It would not impact as such, but yeah, you're going to miss something.
Okay, so last question for this session. Is there a way we can do clinical child psychology along with being a special educator? Because Zoya would love to help children who are mentally as well as physically disabled.
I guess definitely you can definitely do that. That's what I said, the extra courses, that's what comes handy. For example, my counseling psychology and my counseling, when I see that people are not able to change their behavior, I use my hypnotherapy, and hypnotherapy is completely different thing. So that is how it is going to be. You can definitely get a course in special education. There are ways to get that. I do know few people. If you want to get in touch with me, I can definitely help you. And you can definitely learn it and
All right. So with that, we come and we close the Q&A session. Thank you so much, ma'am. I'm sure that the attendees have, their questions are answered, and this has been a very informative session. Thank you for taking up all the questions, even if some of the answers you were not quite sure of. Thank you for that. And I would like to ask, MC to take over from here.
Thank you so much, ma'am, for this informative and interactive session. So, as a token of love, we would like to provide you with an e-certificate. I would like to request our technical team to please display the e-certificate.
wow, I had no idea about this.
This certificate will be emailed to you shortly, ma'am.
Thank you so much. Thank you so much, guys. And I love what you're doing, and really, really proud of you all. And it's amazing thing what you're doing. And I'm so sorry, I had no idea I have to give career counseling here. So I would have prepared better. But yeah, any kind of thing for the audience also, you can definitely reach out to me. By God's grace, by now I'm well connected with other people. I can connect you with the right resource if I'm not the one. So I can definitely do that. And I wish you all the best. Thank you so much for having me.
Thank you so much, ma'am.
Thank you. Bye.
I would like the next MC to please continue.
Okay, so hey guys, it's my privilege to invite our next speaker, Namrata Jain, mental health professional, counseling psychologist, mind, body, spirit expert, hypnotherapist, and art-based facilitator. She is the founder of Out Aloud, an idea conceived to bring out the inner self in each individual. Namrata caters to a wide range of population from children, teenagers, adults, schools, corporates, institutions, etc. She has been featured numerous times in Mumbai Mirror, Times Group, sharing her inputs on mental and psychological wellness, and hosted numerous TV and radio shows on Sony TV, Radio Mirchi 93.8, Radio City 91.1 FM, etc., where her talks have been appreciated by numerous professionals and individuals across the country. Namrata Jain has also been featured on a cover of Brand India magazine, Healthcare Edition, and her expertise lie in understanding the human mind, body, and spirit through which she guides her client to live a more balanced and spiritual life. Welcome, Namrata, ma'am.
Thank you. Thank you so much. I'm not sure if I got your name correct. Nidhi Krishna, is that your name? Hello? Can you guys
Nidhi,
hear
you are
me?
in mute, Nidhi.
Sorry. Yes.
Yes, I can hear you now. Yes. Thank you so much, Nidhi Krishna, for the introduction and a warm welcome. Good afternoon, everyone. I hope you guys are doing well. I know the pandemic has been slightly tough for us, but I hope you guys are keeping safe and happy as well. I'm very, very happy to be here, especially amongst my future colleagues. And it gives me a pleasure to talk to you guys because someday we are again going to maybe come across each other and touch lives together as well. So I'm very, very happy to be here. I'm just going to tell you one thing. I'm not going to keep this session serious. I'm going to actually share with you a little bit about my journey and how I got here, how I came across, especially talking about workplace options. Because that is one space where I feel psychologists have a lot of scope. However, not much has been explored so far. I'll also tell you a little bit or share with you, not even tell you, but share with you a little bit of the challenges that I went through and how I still got out of that and made sure that I could try and make a little mark while I'm sure I'm waiting for you guys to come along and for us to do bigger things together. Okay. A little bit about myself from how I got to this journey of getting into psychology and mental health. Okay. This was back in about, I think, 2003, where 2003 and 4, somewhere around that. Okay. I came across a textbook, and that's where my journey to get into psychology started. I was just 13 years old back then. So I'm not really old, I'm quite young. I was just 13 years old back then. Okay. And I was very intrigued by the textbook. And where did I even come, in touch with it is I used to study with my neighbor back then. Kids generally like to study in groups, right? So I used to go to my neighbor's place in a joint family back then, so many people in the house. How does one even study? And my neighbor was a nuclear family. So I used to chupke se go in her house and I used to study over there. And while I was studying over there, one day, and she's 2 years older to me, 3 years older to me, sorry. And I was just reading, I was in my 8th grade and I was doing my normal studies for my exams. And then I come across her 11th grade psychology textbook. Psychology, never heard of the word in school, right? You don't really come across it. I mean, you guys are fortunate nowadays, at least you know what is counseling, what is psychology. But I think back then, not so much awareness about it, not so much that, oh, there is something like this that exists. And all I did was just read the first 10 pages. And I was like, whoa, this is something really interesting. I really want to know more about human behavior. Imagine living in a joint family with 20 people in the house and everybody behaving in a different way. You're like, oh, that's going to be smart because I'm now going to understand a lot of more people so much more better. And that's exactly where I got so interested. And all of us have a story behind why we got into psychology. Okay, whether you say it or no, all of us have something behind it. So I want you to quickly go to the chat box and tell me what intrigued you to get into psychology first. Let's start from there. What is it that got you into starting your journey in the space of psychology? Gloria, I hope everyone's from the psychology field here, right? Pata chalega, not everybody's from the psychology field.
Most of them are, but there are people who are not from the psychology background as well, but are psychology enthusiasts.
Okay, perfect. Will do. All right. So I have to serve people scientifically. Okay. So what is it that made you think that you want to serve people scientifically? Did you come across people who were doing maybe some sort of unscientific work? Was that happening because of which you got into the space that, no, I want to do more scientific work than what's happening? I like to read human behavior. Guys, you like to do something. I want to understand what made, like for me, I wanted to understand my family better, because so many people in the family, and how do you actually adjust with everybody? One person adjusting with 19 people. How do you do that? So for me, that is what intrigued me into it. What intrigued you to actually start understanding human behavior also? Okay, you having social anxiety. Okay, that's a good one. I loved Freud. Where did you come across Freud first? Tell me that. Want to understand people's behavior. Okay, when my friends used to judge others negatively, I like to know about why they behaved in a certain way. Very good, Khushi. Good. You wanted to understand the why behind it. Rahul, I didn't understand doctor. Didn't, do you mean that you wanted to come into a doctor space or work with people from a medical, not even medical, but a clinical perspective? I want to know myself better. Okay, coming from a joint family, I relate. Okay, I like to understand human emotions and behavior. My mother has been struggling with anxiety, and I've seen my cousin who was hyperactive and still takes therapy. And I've had a lot of family members who struggled with mental health. So watching them since childhood and trying to I think amazing. This is what I'm looking for. What actually intrigued you to study psychology? Somebody at home was going through a lot is why you wanted to study psychology. The human mind intrigued me. I really enjoy listening to my friends' problems and try to get to the root of their feelings. Great. I just hope it's not affecting you too much. Do your self-care, please, because um, if you are not completely trained, I'll really focus on this. Do a lot of self-care, guys. I thought interacting with every person, then I came to know about psychology and their skills. I love talking to people. It's not just about talking, seriously. I naturally used to observe people, wanted to know more about, okay, there are a lot of responses. There are many schemes of the government which don't get succeeded. So I want to research, is there anything related to human behavior? Okay, childhood trauma, yes. I heard the term anxiety from my friend and then explored the world. I wanted to understand why. Okay, so basically all of us have something in the background because of which we've come into the field. Now, what's very important is when you have, did I share my screen? Oh no, I didn't share. Hold on. Sorry guys, 1 minute. This Saturday is a little hectic. I had been taking a session since morning, 9 o'clock. I finished that at 1:30. I took a break and I'm back here with you guys. Kindly ignore some things. Okay. All right. So yeah, I started my journey when I was 13 years old. And then what's important is that I was telling you that I come from a Marwadi family. Trust me, life wasn't easy. Okay. Now it's very easy, but earlier it wasn't. This was like almost, so I'm completed 30, but so 17 years back I'm talking about. Okay. And if you go to see 15 years, chalo, let's take it 15 years back when I just completed my 10th, getting decent above average grades. You tell your family, I want to do arts. Imagine what the first question comes, right? I am sure you guys know what is coming. Arts क्यों करना है? You're decently good in your subjects ना, अच्छे खासे marks आए ना, 80 marks आया तो you can easily do something else. And हमारे time पे 85, 87 was the highest. आपके time पे maybe 95 and 98 आता है, हमारे time पे 85 के ऊपर जाता नहीं था. So for me, the whole response came across as, why do you want to do this subject? I said, this is what I like and this is what I feel close to and I really want to do it. Regardless, I mean, that time I didn't have so much awareness that it was because I used to live in a joint family and that's why I wanted to do it. It's much later in life that you introspect and you realize that, or when somebody really makes you think, is when you realize why you're doing whatever you're doing. From that time till date, I think I have been probably that one person who's broken so many barriers in my family. And I'll tell you why that happened. And the reason why I'm sharing that with you, because what's important for you to understand that everything starts in the mind first. We often feel that it's our external circumstances that are creating everything. But trust me, it's your mind that creates everything. Okay. To begin with, the resistances that you face. So coming from a Marwadi family with 19 people having to approve that I'm doing something like this, and 19 people having to approve that she's the first girl going into a co-ed college. Now imagine again, that's not easy, okay? Because for them, the first question is, why do you need to go to a co-ed college? You can just go to a normal women's college and do it. And I said, no, I want to go to that college which is really good for this. And I don't care if it is a co-ed college. I think somebody has unmuted. I'd request you to please mute. Yeah. So the point was to make sure that I get to do what I really want to do because I was extremely passionate. So now understanding a little bit of what I had read, okay? Thank you. I think a little bit of us as psychologists, we need to realize, or the people who are upcoming psychologists or somebody who's there, first thing is you need to work here of what you want. The moment you are sure of what you want, trust me, all other resistances on the outside will automatically break. Because then your mind is focused in one place. And as I moved forward slowly and gradually, today there's a point when my own family members keep recommending clients to me. And I don't have to do anything. I don't really go about marketing. I've till date never paid a penny for marketing. I share everything on social media, like you guys must have seen. I share everything, but I've never paid a rupee for marketing. The point is, what I'm bringing here is, when you are passionate about something, then you make sure that you give your best to it. And this field is a field where you need to have compassion, passion, focus to be in this field. Okay, if you're doing it just because everybody is doing it, let me please bring this to your notice, then this field is not meant for you. We have a lot of people who are, wanting to become counselors and psychologists. I'm very happy if they really want to become psychologists and counselors, but what's important is the kind of dedication and compassion you need to have to be in this field. You must want to help people and not need to help people because you are now a professional, right? Because we have n number of people who are doing just small certifications, and I'm bringing this to your notice because I don't want you to come forward that way. You are now entering this space. Be well equipped. If you're not equipped, what happens is eventually you will face a lot of troubles. Like I said, self-care is very, very essential. And only when a person is well equipped can they help themselves, and then they can help others as well. Trust me, even if I've been in the practice for 9 years today, there are times when I go for a 1 month complete off if I really need it. If I feel like, I need that break and I've had too much of it, I will take that break very happily and tell my clients, I'm sorry, I'm on a 1 month break for now. And if you give your clients 100% all other times, they're absolutely okay with you taking a break, as long as it's not an SOS situation, okay? Other than that, you will see that you're the one who drives the whole scenario. And I want to bring this also up. I was having a conversation with a senior psychologist, and one of the psychologists who was amongst your panelists. We both were just having a chat, and we were talking about how it is so important for psychologists to realize their own value. Most often, we don't value ourselves. And because we don't value ourselves, everybody else is also becoming a counselor today. So the first thing that I want you to take back today, okay, whether you take back the rest of the things or no, I want you to take back one thing today for all the ones who are getting qualified to become psychologists. Have some sort of trust, respect, and self-worth first before you enter the field. You're going to be working with people who are going to be much older than you. My first client was a 44-year-old, and I was a 23-year-old, like a child sitting in front of him and wondering, okay, that jittery feeling, what am I supposed to do now? And all I did was I just actively listened. I said, I can at least be a good listener, na? If I don't know what I'm supposed to do in terms of therapy, I can at least be a good listener. At least that's the first skill I've been taught as a therapist. Let me use that one skill to begin with. And that client of mine could sense, okay, that I'm just new into the field. And he asked me just one simple question at the end. He loved the fact that I listened to him. So after he finished speaking everything, he asks me, do you think you'll be able to handle the case? I know that you're qualified and everything, but you're not even married. And it was an extramarital affair concern that the client was coming with. And he's a very well-known corporate person, okay, working with one of the largest MNCs. And he asked me, do you think you will be able to handle it? I said, sir, 2 sessions more, you allow me to help you out. If I am not able to assist you with the concern that you're going through, I will happily refer you to somebody who's senior to me. I didn't feel rejected. I said, you give me a chance to do it. If I am able to cater to it, I will go ahead with it. If not, I will be the one who will refer you. You see, I am the professional, so I took the lead. I said, either I do it. If I'm not able to do it, I will refer you to somebody else. I didn't say you go find somebody else. That somewhere shows that, you know what, you are taking responsibility of the client that's coming to you. A very important skill for a counselor or the therapist is to take responsibility of the seat that you are in. The chair that you're sitting on is a respected place because that person is coming to you for help, knowing that you understand some things better than him or her. And if you don't have that kind of respect and responsibility within you, it's going to be very, very tough for your client to feel the same for you. Right? So first thing that I learned was over there was I had this little thing. I'm not saying that for me it was the easiest way to go. No, it wasn't. It was something that I also learned when I sat in front of him. On the spot, I had this thought that, you know what, wait, what do I do in this situation now? And then I just said this. I didn't realize at that time that it was me taking responsibility, okay? It was clearly me just saying something that came to my mind. But eventually I thought of it and I said, okay, me saying this really had an impact on that person because that person is an intellectual person, so much more, almost 20 years older to you, is going to know so much more about life, engaging people, right? They may not know a lot about the intricacies and the biology and the psychology behind a lot of things, but general experience they do have. And when you work in a workspace, especially when you're working with corporates, you will see this often, okay? And you will face challenges every time that you're working with a group, but the challenges will differ. And every time that you go in that space, you will see that you learn something new because we have not been trained as such as people to work in a corporate organization. Of course, industrial psychologists have been trained to work that way, but again, they are not trained to completely counsel and do therapy for people. Right? So at the same time, you have to understand that if you as a counselor are working with people in the corporate organization, you have to be able to understand in between the lines what is happening, what is really going on within the dynamics of the group. And as you keep understanding that, you will also understand a lot of those dynamics play within our own circles around us also. They're just the nature that differs everywhere. So here you'll understand a lot of skills that you need to build as a person. Okay. Now, what's important is like I said earlier, your focus and passion. They're the 2 drivers of becoming a good professional. And why I'm bringing this in here is when I started my journey in my 11th and 12th, and I really, really thank my professor in my 12th grade. If any of you, no, most of you are from this college, but if any of you have ever known June Mendes, I think she's one of my first mentors in the space of psychology. And I really give her gratitude every now and then, saying that, you know, it was only because of you that I actually moved forward into this subject so much. While I knew I wanted to do it, but if I didn't have a really good mentor to begin with in my 11th and 12th, probably I would have not really enjoyed it so much. How many of you feel that you have really good mentors? Where is my chat box? June ma'am is my mentor and she's amazing. Yes, she is. I will answer this question for you. Someone has asked, at times the therapist can be experienced in their field yet not be the right fit for you. How to give such a feedback to a professional? Can you just copy it and put it in the questions section so I don't miss, because through the session we may have some chats going up. I don't. My dad is my mentor. Okay, great. In my 12th, I had the best support from my teacher. Absolutely. I think somewhere our teachers play a very, very big role, like for us. They are somewhere the stepping stone for us to move further. And I know so much, and it's so sweet, that I have my own teacher now who sends me referrals in terms of clients. Okay, she knows that this youngster or somebody who she knows very close, and she's like, Namrata, can you take up sessions for this person? And it really gives me so much pride to say that I'm her student, and I tell her that if it wasn't for you, I probably wouldn't be doing so good in life. Of course, all my other teachers in degree and masters as well, but I think she was somewhere the foundation person for me. So yeah, that's where, and what's important is for you to develop your own focus as well. Now, this is where I'm going to bring in, because you all are students who are studying right now. Tell me quickly, some of you who are studying here, what are the courses that you are doing, which are additional courses, to make sure that you enter the space with certain tools with you? For those who are non-psychology students, I would suggest you guys listen. There's somebody who's doing Reiki healing, okay. NLP, positive psychology, psychology first aid, workshops to various therapies, REBT, clinical psychology, CBT, NLP, okay. CBT, all right. CBT, REBT, NLP, definitely really good. Some basics of neuroscience to understand the basics of the mind better, yeah. Internships in psychology, mental first aid, attending webinars, okay. Great. I think you guys are a great audience who's constantly doing something. So I'm really happy about that. So yes, gain some professional experience while you guys are studying. It's very important for you guys to keep doing something. Why? I'll tell you. When you move out, remember that there are another 100 people who are graduating with you. We are in need of thousands, but we still have certain hundreds who come out and who really, really practice. But when you come out, I want you to be equipped enough to be able to cater to what you are really wanting to do. Whether you're working with children, whether you like to work with youth, whether you like to work with adults, whether you like to work with corporates, whether you like to work with NGOs, whatever your liking is, experiment that from now. Don't wait that I'll finish my master's and then I'll do it. You have your all other fun side of life, but along with that, try and gain some experience to understand what exactly can you do. Okay. And what is the kind of population you like to work with? Because, people work with all areas, and I can tell you, I work with only a certain kind of population. My company, of course, we work with all populations, but I would work majorly with adults and sometimes with youth, which also youth I ventured into recently in the last 2 years, because I realized that youth also connects with me a lot and I can make a difference to their lives. And that's where I said, I think the youth needs some sort of training as well. But majorly I worked with our adults, and I experimented this right in the beginning, where I did an 8 months school part-time work, and I realized that children is not my cup of tea. I said, I have immense amount of patience, but still I think for children, there's a different kind of creativity. There's a different kind of patience that's required. And I think me being out of that space would make more sense. I'd rather give it to somebody who's extremely passionate towards children. Right? So you have to know what are you really, really liking and must go ahead with that area. Challenges are going to come your way. You just got to make sure that you are ready to understand. And like I said, you have to work through these challenges first in your mind and then be able to focus. So tell me some of your challenges currently that you're facing. So all you guys who are here, what is that one challenge that you're facing and you're not being able to understand, how do I get through this? Anybody here, any challenges? Not finding good internships, okay, lack of opportunities, communication, okay, studying online, not knowing reliable internships, yes. Yeah, I know the space of internships is very challenging in our space because most often it's about being confidential. So I also have this where, just for a month, I allow a counselor to sit with me, and then I do not allow them to sit with me as well. They have to do their rest of the training otherwise, because confidentiality is something that we need to maintain. Not able to find good college, too much theory in studies, no practical exposure. I can understand these challenges. I so relate to this. We know what we do like, but do we get into this whole experience? But how do we get into this whole experience? What is the experience you're talking about, Abhishta? What is it that you want to experience? To know what I want, okay. I am not able to decide a good college for BA, and I don't know if I should move to another city or a state. Okay. Finding suitable field in psychology. So I think these are a lot of questions actually. I will come back to this. I'll keep this slot for me to answer. I'll actually put most of my time to answer your questions. Okay. So let me quickly complete what I wanted to put forward. Now, coming to corporates. Okay. I'm going to talk more about workplace scenarios. When it comes to you working, now there are different places that you can work. I'll talk about corporates majorly, but I'm going to talk also beyond that. If you're working with children, you have schools, you have NGOs, you have a lot of centers that are working in there. So you can work with any of these when it comes to children. Okay. And now I am working with another colleague of mine where we are building a mental health curriculum for children. So from the age of 7 years old, so 6 years old, I think from grade 1 till grade 10, we are building a mental health curriculum for children. Very soon it's going to be coming to schools. So definitely one more space that's opening up for psychologists in future, where they might be required to execute a lot of these programs, because we all know that in India, mental health has now come up as a field. I think the pandemic has highlighted it a lot more. And thus we are able to provide a certain amount of service now. Initially, of course, it was just about schools, and it was maximum about a few centers which some of our seniors had. But now it is also coming in with a lot of more opportunities. When it comes to the youth, of course, we have colleges. We also have a lot to do with youth programs. I have a lot of professionals who I know from Delhi, from Mumbai, who are conducting internship programs. In the space of psychology, unfortunately, internship programs are very different. Like what I'm seeing in the market, I don't know whether they're right and wrong, and I'm not going to comment on them. But there are these programs which are being run as internship programs where you pay for it, and then there is a facilitator who's a psychologist or maybe a psychiatrist and some. No, most often it's a psychologist actually, who kind of trains you on how would it happen, so make you do more of a role play. I think that is also helpful if you get a chance to do, because it's only through role plays that you can really understand how do you practically do this. Because most often the therapist will not allow you to sit in person to do therapy, and I personally also don't allow. So it's very few cases where once in a while I allow somebody to sit, because I stay in Bandra and most of my clientele is, I need to keep them really confidential. They don't like to do it. And I'm sure in any other cities also people don't generally like to bring it out open, because it is a stigmatized area for us in India especially. So it's something that you will have to explore. How can you get hold of certain internships? So in the youth space, there are internships. When you go to work, there are colleges, there are open programs that you can conduct, like how you guys are here, and there's so much interest. There are a lot of people out there who want to learn more and more. So there are programs of that sort that you can start with. When it comes to adults now, with adults, you can work one in the open space where you're doing one-on-one counseling, so you can have your own practice. When it comes to you doing work in the corporate sector is quite vast, and I think now is becoming more and more open. To begin with, the EAP programs. What is EAP? EAP is Employee Assistance Programs. All possible MNCs, okay, multinational companies, and all possible corporate organizations, which are small or medium enterprises, they all have something called a EAP. Most of them have EAPs. If they don't also, they have a service for mental health, and mental health now has separate budgets as well in a lot of organizations, where they provide various services, where they will be providing one-on-one counseling, they will be providing workshops for their employees, they will have a lot of telephonic counseling, they will have a lot of email counseling. So there are various different things. So there's a lot of scope in the corporate sector for you to work. Another thing that is there is, and I see psychology as a much broader term and not just mental health, okay? Say, for example, I worked in an organization. I'm still a part of the organization, sorry. I worked with this person who connected with me from Israel, and he wanted to build a game which was made on the basis of theories of personality. Okay, it was based on personality theories, where we built a game. When the person plays the game, we are actually assessing the personality of the individual through the game. And it's about a 3 minutes game, but the 3 minute game actually ends up giving us a score. That person is high on what sort of traits. And this same game is being used in the lending and borrowing space. So banks, where not just banks, but any lenders, when they lend money and a borrower goes to take a loan, then they have to play this game. The borrower has to play this game. The lender is going to assess the personality of the person and be able to then know whether this person is going to repay the loan or no. So imagine a psychology assessment turned into a game is now being used to understand repayment capacity of an individual. Isn't that unique? Have you ever heard of psychology being used in such a space? And it's not just that, but I built this game. So for the last 1 year, I started in March 2020, and now we are at June 2021. By August, I'm completing the whole project, and now I'm not only one of the founding members of the company because it was a startup, but that particular concept is also patented in one as one of the members of those 5 people where we together built this. I'm one of the patent members of that product. Now what I'm trying to tell you guys is that you got to think a little beyond your capacity. Don't think of psychology just as something which is to do with mental health only. Psychology is far more broader than that. If it interests you to be in the mental health space, please be. But look at psychology from a broader perspective. Psychology is about human mind and behavior, and human mind and behavior is useful in almost all areas of life. Wherever you go, whatever you do, you are engaging with people. Wherever you're engaging with people, psychology comes as a part of it. Somebody has recently started working on this. They've started working on, I know this has been a concept from before, but the psychology of marketing, the psychology of especially social media marketing. Okay. And I know that there are a lot of people using it out there, but the unfortunate thing is that it's not psychologists who are thinking out there. It's actually marketing professionals who are thinking. Why can't you, as a psychologist, take up the area of understanding consumer behavior? If you want to do something different, then think beyond it. I was working in the mental health space for so long. It was very random that I got this project, and it came to me through LinkedIn. And I'll tell you the power of social media also over here. I got this project, and the first thing I was like, okay, I'm not a psychometrician. I'm not going to be able to make a complete assessment and do a complete research on this to be able to prove of what I'm doing. I said, okay, if I can't do it, but I can obviously get somebody else who is an expert into psychometrics and collaborate with that person and do it. What's important is, as a psychologist, please be a collaborator. Don't get into this space that all other psychologists are my competitors. No, they are not. They are your collaborators. We need a lot of oneness in our community. And being psychologists, I think that should come as the first thing for us. It should be like, okay, you know what, I like doing this, you like doing this, how about doing something together? You share the profits, no problem. If money is a concern, share it. All of you together can do so much more rather than one person trying to do everything. I got a psychometrician on the board today. She is also one of the patent members. She is also one of the leadership team member, and we both work together on the whole product. Isn't that great to do? And I think that's something that I personally feel very blessed that God's given me, that skill to be able to collaborate with people rather than compete with people. I have a lot of people in the psychology, and though I'm a little choosy over there because I really need the similar kind of mindset person to be able to collaborate with. If the person is also a collaborator, I'm also a collaborator, then it works perfectly, you know. But if the other person takes me as a competitor and tries to work with me, then somewhere it's a one step backward for me. But what's important to understand is that if you bring forward a collaborative perspective, after some time, even somebody who is trying to see you as a competitor will become a collaborator. Because like I said, everything starts here. The moment you start becoming a collaborator here, you will see that others also become collaborators with time. Okay, so be a little more creative. Think of how psychology as a subject can be used. There are a lot of fields that have come up in space of forensic psychology, criminal psychology, cyber psychology. I know you guys had a session around that as well. All of these areas are upcoming now. Why don't you explore some of the new areas as well? Mental health part of it will always remain because it comes as a part of stress, comes everywhere. Okay, stress is, where is there a place where there is no stress? Till it's a certain amount of stress and healthy stress, there's no problem. But sometime or the other, and the way the world is moving right now, somewhere or the other, it is going to come a situation where you'll meet people who are feeling extremely stressed, and you will help them cope with it, right? But think of psychology as a much bigger umbrella term. Now, I was also talking to you guys about the power of social media. I know that as a youngster, you guys use social media. Tell me how many of you, and tell me the truth, okay? How many of you use social media just before going to bed? How many of you scroll Instagram, Facebook 30 minutes before going to bed? Or how many of you sleep with your Instagram and phone is on the side and you go to sleep? Somebody's replying guilty. I have a lot of yes coming in. Some few people saying no. I'm happy you're saying no. My dear students or my dear colleagues, you're going to be a psychologist. First, you need to understand what are the people who built social media and why have they built it. Now, as a psychology student, okay, put your psychology hat on and tell me, why did they start social media? Just knowing is not enough, Namira. You also need to not use it. My father only snatches the phone away. I don't have Instagram. Okay. To grab attention. Okay. To connect. Okay. To be social. Okay. Put your psychologist hat. I don't want the normal person hat. Money, I'll put to entertain, to use us as a product. Now you're using your psychologist hat. I like it. Go ahead. Go ahead. Because to engage with social issues, okay, just time pass. कोई चीज कोई भी time pass के लिए नहीं करता है, okay? Everything has a reason why they build it. You think they built it for time pass and that's why they have a crores turnover happening there? Marketing purposes, kind of marketing to manipulate us into buying stuff. Now the psychologists had to start it. Very good. I like you guys. Understand one thing. The person who built it has built a business. And unfortunately, all of us, okay, and including me, not now, but before, okay, until I realized what I was doing. It's okay. You're also a human being and you can make mistakes. Until I actually realized that, oh God, I've become a consumer of this product. It's a product. Any social media is a product. Okay, whether it's Instagram, whether it's Facebook, whether it's LinkedIn, they are all products that have been built for you to buy the product. And whether you're directly spending money or in it or no, remember, time is money. You are putting in your time into something where somebody is earning money from it. Okay? Remember, you don't make social media use you as a consumer. Okay? How about flipping the side? Now, what will you do if I ask you to flip the side and I tell you, you got to be using this product for your benefit? What will you do now? Make my business blow up. Okay, spread my knowledge. I use it to promote my small business. Amazing. Use it for professional purposes, spread awareness. I'll tell you a very simple thing. I don't know how did the team actually find me, okay? But I'm very sure they looked at my social media. Didn't you guys look at my social media some way or the other? Didn't you look for my LinkedIn? Y'all did, right? And why do you think you thought that this person is somebody that we should bring in? Did you see anywhere where I have put across anything which is to do with my personal life? You will not see a single picture of me and my personal life on social media. It's going to be just my professional space, because I use this social media as a way to promote my work. Because you know what? I don't want them to use me as a consumer. I want myself to use that as a product which helps me get work in return. And that's what you as a psychologist must do, because remember that you are somewhere going to be a role model for the clients that are going to come to you. And if you only become a consumer who's not even been hired but got hired automatically, okay, then what are your counselees when they come to you really going to take back from you? We all know social media causes a lot of damage, but we all know that social media also can be used in a good way. Everything has its pro and con, right? You got to look at how can you use it for your benefit. You feel like connecting to people once in a while, go in person and meet them. Na? How far are your friends? All the friends that you are connected to on social media, most of them are on your WhatsApp as well. Most of them are staying close by to you because they might be your college friends and people. How far is it for you to be in person touch with them? Not during the pandemic, but I'm talking about otherwise, right? But we are losing that in person touch with people, and we are in turn, what we are doing is we are just making virtual friendship with people. Even if you want to make new friends and you're using it for the purpose of making new friends, I'd be like, okay, you make one or two friends, but then meet them in person. Virtual friends are very temporary. They're not going to survive long unless and until you've met them in person and you've really created a kind of connection with that person. Then you will have that person ahead in your life, right? So don't become a target of using of social media using you. I want you to start using social media. Okay, when it comes to your workplace, I told you there are array of opportunities out there. Create your opportunities as well. You are a psychologist, and we know that this field of psychology is far bigger than what you think. Okay, when you're studying, be mindful of what are the things that you can propose in future. Okay, uh, as simple as, you know, what I'm doing right now is, and I work a lot with relationships. So right now I'm writing my book on relationships, and generally what people understand by relationships is couple relationships, right? I'm actually writing my book on how it's important for us to build a relationship with not only our loved ones and people, but how it's important for us to build a relationship with our body, how it's important for us to build a relationship with our self, is how it's important for us to build a relationship with the money that you earn, how it's important for us to build a relationship with nature, because these are all healing, right? Nature is a healer. How do you build if you don't have a good relationship with money, money is not going to flow in your life at all. If you are absolutely negative towards money, say for example, a lot of people have this belief system. When I've done counseling, I've realized a lot of people have this belief system that, you know, everybody who's rich is extremely arrogant. or they are extremely people who are heartless people. So some people have these kind of belief systems, and we all know that it's the belief systems and it's the negative thinking patterns that brings us down, right? So us even working on small things like these. So I thought of, what everybody thinks of relationships, matlab couple relationships. There's nothing beyond that people think. And I said, I want to think beyond this. I want to create a difference in people's mind by making them think of relationships as such much more larger than just couple relationships. It's not just always about a boy and a girl. It can be so much more larger than that. Why can't we look at it in a much more bigger way? That's why I say think bigger, okay? Don't go to a small space. Go much bigger and think beyond that. Think of yours, and don't just go learning everything, okay? Once in a while, yes, learn. But sometimes just sit and think on your own also. What is your perspective in that? Originality is very, very important. Don't always go with somebody else's thought. Okay? If your basics are clear, go within and understand. Like, how I came up with this book idea. This whole pandemic I started in March, and you can see I have a window out here behind me, and there are a couple of trees here in the lane where on this side I can see. And it's only looking at the trees regularly in the morning for half an hour, because the first thing when I wake up in the morning, I'm somebody who comes and sits at my window. That's my regular thing. So when I sit at my window and I'm just sitting and thinking, and I had been thinking of writing this book for the last 2 years, but somewhere it wasn't just clicking. And as a psychologist, how jab tak dil se nahi aata hum kar nahi pate. So that's also a problem. So I was just thinking, and then while I'm just looking at the tree, one day I had this eureka moment. I said, oh my God, there is such a big thing that I can be writing on, and I'm actually still wondering what I should write on. And from that day I started, and today I'm on my 4th chapter now. And I think in the next 2 months or 3 months, we'll be done with all the chapters. The point that I'm saying is that you got to think on your own. Sometimes be with yourself. That's extremely important, because otherwise you're just picking up information from different places and you're not letting yourself bloom as an individual. Okay, you learn, your foundation should be extremely strong, but after that, as you grow in the field, try and see how you can create your own niche, how you can come up with your own space while you're ethical, you're maintaining your confidentiality in places, but still being able to create some kind of awareness at a much larger perspective. Okay, so that's about it from my side. Thank you so much, guys. I'm going to quickly go to the chat box now. Your questions is what I'd love to answer. Scope of clinical psychology in India. Was that a question for me? Is there any team member here? Or was that an earlier question?
That was an earlier question, ma'am.
Okay.
I'll read up the questions for you.
Sure.
So, Ishita says, at times therapists can be experienced in their field, yet not be right fit for you.
Yeah.
How to give such a feedback to a professional?
Okay, perfect. Remember that it's important, and definitely it's something that you choose. You choose your therapist, okay? Your therapist doesn't choose you. You choose your therapist. Now, what's important is if you go to a therapist and you feel that, you don't feel aligned with your therapist. I think if that person is a genuine therapist, if you just directly tell them that, ma'am, you're amazing with what you do. Now, always remember first to give them decent, positive feedback. Okay. You give them a feedback saying, ma'am, I really appreciate what you're doing and what's going on. However, I feel a little disconnected with some areas, and I would really like to maybe explore something more and come back to you. If it's a genuine therapist, trust me, they will not mind at all. Okay, because you're being honest, because you're saying that, what us doing this is somewhere, not helping me, not helping you as a therapist, and thus I would really prefer if I can explore somebody else and come back. So I think that really, really works.
All right.
Remember, sorry, I'm coming back to this. Remember that if you can't be direct to a therapist, then who can you be direct with? Yeah, at least therapist is one person who's supposed to understand easily and who's not supposed to mind that. So you can be very honest, but just make sure that you appreciate whatever the person is doing first, and then tell them whatever you're feeling. Yeah.
Right. Okay. So Devashish Sharma asks, if anyone wants to have an internship with foreign people, how can we apply for that? Is that a possibility?
With foreign people. I am not sure, actually never explored that area, but the thing is that they have different licensing, and I'm not very sure if they allow interns either. I think the best place where you can explore this is go on LinkedIn. I think LinkedIn is, and I forgot to mention this, sorry. LinkedIn is a fabulous place. I think I have so far been so fortunate with the way I've gotten work from LinkedIn, the kind of people who approach me from LinkedIn a lot of times. I think it's really, really good. So maybe you could try asking one or two people. You definitely cannot practice anywhere outside India. Because licensing is different in every country, not anywhere, but a lot of places outside India you can't practice because of licensing concerns. I think a few places in Asia you can, but however, you will have to really check on the legalities.
All right. Sarasi asks, do you think IO psychology has scope in India? Is it more here or abroad? What is the future of this field of psychology?
Yeah. I think a very interesting question. IO is coming up quite a lot. And I think it's only going to get better. Okay. So definitely at this moment, it may not be the best, but we are opening up. And I think even corporates are really opening up to this much, much more than before. So scope, if you're asking me, there's definitely a lot of scope. You know, if I can tell you, when I started corporates, in corporates, I don't think mental health even existed. But all I knew is that scope of mental health is always going to be more and more. And I didn't even think I would get into corporates and do a lot of work there, but it just came as an opportunity to me. And I have been one person, and I'll tell you this, and I'm very proud of myself in this space. I don't know, I thank my mother or my stars. I don't know what to thank, but I really thank them that whenever an opportunity comes in, I grab it. I don't wait. I don't think, no, I will do it later. There's an opportunity, I grab it. I'm very quick in terms of action. Okay. And that is probably what has allowed me to take so much more in so many years rather than going in a slow pace. So you have to really, when an opportunity comes in, don't wait, just grab it. If you have a mentor with you, great, ask them and grab it quickly. But if you don't have a mentor also, sometimes use your own logical sense. There's not going to be any loss because you're in a learning stage right now, right? But you not grabbing any opportunity is definitely going to be a loss for you. Yeah.
All right. So Isha and Muskan have a similar question.
Okay.
They have interest in IO psychology as well as counseling. So which is better, and how do you, sort of realize which suits you better?
Listen, ये ऐसे challenging questions मन तो कौन सा better है और कौन सा नहीं है, because that is something that is very challenging. It really depends on you as a person. But I'll tell you what. When you do IO psychology, you're working with a lot of the corporate without working on their mental health issues directly. Okay, you're working on a lot of the corporate dynamics. You're working on a lot of team plays and how team members are working with each other. You're also organizing a lot of stuff for them in terms of mental health. So you'll be more in a space where you'll be doing a lot of stuff, not yourself, but getting a lot of people to do it. And stuff like that. But when it comes to you doing counseling in the corporate space, like I'm a counseling psychologist, I'm not an industrial psychologist, but I do counseling in the corporate space. So it's different, when you're doing counseling in a corporate space, you're actually working as a counselor for them. You're basically working like a therapist for them. Okay, so you're working on their individual concerns that they have in life, and that's what you're working with. So it's for you to choose. Sometimes see, the challenge is when you are a counseling psychologist or a clinical psychologist, you can do a lot of counseling in corporate organizations, but as an IO psychologist, I think corporate counseling or therapy directly is something that you don't get as well equipped with. So it's for you to choose, if you are a very sensitive person and you find it very, very difficult to work with people when they are breaking down, then I suggest you go for IO psychology. You'll be in the space of psychology, but you won't be dealing with people's issues directly. you will be indirectly dealing with them. But if you feel you're strong enough, your roots are very strong within, and you are able to cater to it, then you can definitely get into the counseling space. See, it all depends on how much are you ready to work on yourself, because before you become a psychologist, working on yourself is very, very essential. Okay, it's like you going through n number of therapeutic practices on your own self to be able to sustain in this field. A lot of people enter the field, but a lot of people leave the field. In 4-5 years there are so many dropouts. I can see it in my own batchmates, that so many people stopped practicing because they couldn't take it, because it's not as easy as it looks. Become a counselor, everybody out there is talking about becoming a counselor, but it's not that easy. Okay, it sounds very interesting, it sounds very fun, but when you sit in front of them, and I think some of my uh, uh, interns will really say that
I think there's some network issue from Namrata ma'am's side. Till then, you guys just make sure you're putting up your questions. And for the people who are in Zoom, try to put it on the Q&A part and not on the chat box, so it's easier to access it.
so sorry. Hello?
Are you here, ma'am?
Hello?
Hello, can you hear us, ma'am?
Yeah. I'm so sorry. I think I got disconnected.
No issues, ma'am.
Can you all see me?
Yes.
Yeah. Okay. All right. Sorry. I think that technology, right? Yeah. So, what was I saying? Yeah, I was saying that it took me about 5 years to come back and, understand as to what is really happening and what I need to change in myself, or do a certain amount of self-help for me to then feel better.
Mm-hmm.
Gloria, is the network okay, or is it fluctuating?
It is fluctuating.
Okay,
Your
just give me
screen
a
is getting frozen. Yeah.
Let me try and change my network.
So since we are running short of time, there's just one more question that I'll ask. Is Akansha Bajpai asks, can an introvert become a good mental health influencer? And another question similar to it was, how can you brush up on your communication skills? Ma'am, are you there?
Yeah, I'm there. See, if you want to become an influencer, okay, I can tell you that I am partially an introvert and partially an extrovert. But did you feel throughout the session whether I'm an introvert or an extrovert? What did you think?
Definitely on the extroverted side.
I most often seem like an extrovert. But if you ask my family, they would say she doesn't even talk to anyone. She's in the house and we wouldn't even realize she's in the house. Okay. So there, you can be an ambivert. It is something which you need to understand, that mental health is not about you being an extrovert or an introvert. It's about you being able to understand whether you will be able to cater to those strong emotions that come in front of you. Okay, when it comes to you wanting to become a social media kind of influencer, you need to be an extrovert. Like you see, I never put any of my personal stuff on social media. That clearly shows I'm an introvert about my certain part of my life. Okay, it's my profession, so I'm an extrovert, but otherwise I am also an introvert person. And you could have those two sides. There's nothing wrong in that. When a person meets you in person, they will realize this person is slightly different. But when you're out there, you're sharing stuff because that's your work, right? So I don't think it has anything to do with an introvert and extrovert, unless you want to become like a social media influencer and go out there. Like, I'll tell you, one of my biggest challenges is that my team has been telling me, ma'am, please shoot videos, ma'am, please do a lot of YouTube stuff, ma'am, please start podcasts. And I'm like, yeah, where you're asking me to do all this? Like, this introvert kind of person, like part of me, which is introvert, is like, why do you need to do all this? You have enough work, people get to reach to you, you're sharing a certain amount of things. Why do you want to go out there and do that? But there are some people who are really extrovert and who love doing that. You draw your lines, right? You know how much you want to put yourself out there. Don't go according to what people are doing. Decide how you want to put yourself out there. It doesn't have to be accepted by everybody in the society. That's not essential. Like, people who follow me keep telling me, post more things, do more this, do more that. I'm like, jitna mere capacity mein hai, I will do na. Let me, whatever I'm doing, as long as I'm doing it 100% and I'm happy with it, let me do that much. I don't want to do what everybody's doing. Okay. So if you can have that trust and faith in yourself that whatever you're doing it authentically and you're happy with what you're doing, I think it will solve your purpose of being a psychologist. Okay, I think there are a lot of questions, Gloria. I know we might not be able to take questions. If you all have questions, I think the best place to connect with me is on Instagram or on LinkedIn. Any other spaces, I won't be so active. So either of these two spaces, if you all want to message me whenever I am free, I'll definitely answer all your questions. Thank you so much.
Thank you so much, Namrata ma'am, for joining with us and answering all the questions that we had and giving us an insight on what is more needed rather than just theory, apart from theory. So thank you for that. I call upon MC Nidhi to thank Namrata ma'am.
Thank you, ma'am, for sharing your wonderful presence with us. As a token of appreciation, we would like to give you an e-certificate, for which I request the tech team to display the same.
How sweet. I'm going to take a screenshot of that, okay? Thank you.
This certificate will be sent to you via email very shortly.
All right. Sure. Thank you so much, Nidhi Krishna. That's really sweet of you guys. And I think you all are doing fabulous work. It's amazing. I mean, I wasn't even aware of 3G International School, International Psychology Career Summit, or even 3G School of Applied Psychology, and I'm so happy that there's something called as a School of Applied Psychology. It makes me feel very proud that our country is actually doing a lot of more things in this space. So thank you so much for connecting with me and bringing me in here. I definitely didn't want to give a lecture on anything theoretical, but talk more about the practical part of what happens when you come out here. It's a game that you need to master once you come out. It is, trust me, and when I say a game, the reason why I call it a game is because it's fun. Because every time that you take one step forward, you're going to find something new around you. It's going to be a unique journey. So enjoy the journey. Don't get startled that, oh my God, what, this field doesn't have anything proper. There's nothing. Everyone tries to come and shift that section of it. But while all of that will keep happening, and trust me, not you and me always have the control to do that. There are a lot of much more senior people who probably are trying their best to get some things more organized, but don't be disheartened by that. You do your bit and your contribution and keep focusing on that. I think as you focus on that, eventually things will fall in place. Okay, so good luck to you guys. Do really, really well. And I'm sure we'll meet on the way once again sometime in future. Once y'all are out and y'all are doing a lot, connect with me. I'll be more than happy to collaborate.
Thank
you so much, ma'am.
Thank you. Bye-bye.
Over to the next MC Hosanna.
Thank you. It is my privilege to invite the next speaker, Princey Sani. Ms. Sani is an economist by education, a product manager by profession, and a mental health care ninja by passion. She suffered from episodes of chronic anxiety since she was in 6th grade, and so growing up realized how important it was to talk about mental health. Self-awareness, self-care, and self-love are 3 things she has learned. These are also the things she wants everyone else to know about. She has already touched the lives of thousands of people and wants to touch thousands more, so that we can become a world where we can welcome us in.
Hi guys, Is this my internet or is this Asana's internet?
It's hers, ma'am.
Oh, okay. I'm so glad. It's my worst nightmare for my internet to get erratic while I'm in the middle of something. I am
You're
so
all good,
glad
ma'am.
to be here today. I really appreciate this initiative, guys, for bringing together people where we can talk about important issues such as mental health and psychology, and especially in the areas where we need to start a word around. And I wanted to talk about routines today because most of my life and most of the people that I've met, the thinking around routines is so warped because we think that having a routine is like living the same life every day or doing the same things on the same time every day or keeping account of every hour of your life. But routines are just a bunch of activities that you repeat regularly, not necessarily every day, but regularly. And in my experience, I think having a routine is a game changer. It is an absolute game changer when it comes to your mental health. Uh, be it students, be it professionals, be it your parents, be it at any age or stage in your life, a routine would just help you to do everything that is important to you, everything that you want to do, and be able to do all of those things and still leave space for the things that you want to add to your life. And they're just awesome. So this is a conversation I wanted to start in the mental health space because it's a basic thing that you can do and talk about, and it will take care of a lot of things. It will help you reduce stress, and these are things that I wanted to talk about today. So, uh, having a routine. So, first of all, are we doing? Can we do an interactive thing? Can I know how many people have ever tried to fit in a routine? Can I know? Can people raise hands or something? Damn. Let me see the responses. Just write yes if you've ever tried to fit. If you've ever tried a routine. Okay, I see a lot of responses, guys. This is amazing. Yeah, we fail very badly most of the times. And how many of us think that putting in having a routine is the same as having discipline? Right, discipline if you think that that's true, or right, yes, yeah, yeah, right. We feel that having a routine means having a disciplined life. But guys, I would like to tell you that that is just not true. You do not need a lot of willpower to have a routine, to be able to achieve whatever you want to achieve in a day, and be able to, continue doing all of that for a long time. Uh, and it does feel like you have to put in a lot of effort to stick to a routine or a timetable every day. And timetable is such a bad word because we used it in school. But a routine is not like having a timetable. It is not like, putting in a lot of effort to stick to uh, a time every day. It in fact reduces your effort to take decisions every day and planning a good, satisfying day every day. You don't have to wake up in the morning and decide that and motivate yourself to exercise today, or read a book today, or food for yourself today. It's just comes automatically and it's on autopilot. And it's understandable, even if we don't want a routine. Sometimes we think that we do not want to, that they are daunting and overwhelming. We want to be free and we want to do whatever we want to. We want to be free to do however we want to spend this day, and I don't disagree with that. But there are two things that are very important there. One thing is that life gets really tough when there are a lot of things that we want to do, and there are a lot of things that take a lot of effort to be done. For example, brushing your teeth in the morning will not take a lot of effort, but motivating yourself to exercise every day will take a lot of effort. For someone who wants to read but is not a reader, it will take certain effort to read, right? And when it comes to motivating ourselves, to do these things every day. Exercise is something that you want to do every day, or meditation is something that you want to do every day, or reading is something that you want to do every day. But having to wake up every morning and to motivate yourself to do this every day is a daunting task. And most of the days, most of the weeks and months, we end up doing none of these things. And that is heartbreaking. I feel like for most of my life, my list looked like, I want to read, I want to exercise, I want to eat healthy, I want to cook my own food, I want to meditate, do yoga, plan my day, write a to-do list, I want to paint a little, I want to spend time with my family, I want to write something too, I want to chill with my friends. But no one with a 24-hour day can achieve these things every day, right? Right? Like, write a correct if you think that's right. I mean, we can't achieve all of these things in a day. If I want to do all of these things every day, it's impossible to do it. There was this one time that I used to think 2 years ago. I read that it takes 21 days to inculcate a habit. So I thought, let me try one thing. I'll write everything that I want to do, and which includes all of these things that I just said, these 10, 20, 12 things. And I thought that what I'll do is I will do all of these things. I will make a timetable and I will do all of these things for 21 days, so that after 21 days, I am in the habit of spending my day like that. So I named that concept my best day for 21 days. And I failed because I could not live my best day for 2 days. It's an epic failure to try to do everything that you want to do every day starting today. It it does not it does it it's a recipe for disaster, and no one will be able to achieve whatever they want to achieve if they try to do everything that they want to do in a day. If you make a timetable and say, I'll wake up at 6 in the morning, I will read at 7 a.m. in the morning, I will exercise at 9, I will work from this to this time, and then I will write and read, etc., it will never work like that. And so I try to look what my life looked like at that time. uh, at that time, my life, this is 2 years ago, I was working at a bank. It's called Wells Fargo, and I was living in Bangalore. And I used to wake up, I used to have to decide, what do I want to do today. And most of the time I used to think, today I'm going to wake up and I'm going to work out. So I used to wake up by 11 a.m. because I used to sleep at 3 because I was Netflixing. 11 a.m. I used to wake up because my work used to start at 1 p.m. So I used to wake up at 11 a.m. And I used to think I'll work out for 1 hour, and then I'll take a bath and I'll go to office. But I used to keep scrolling on my phone for half an hour. At 11:30, 11:45, I realized I'm so hungry that I can't work out on an empty stomach. So by 12, I used to decide, so I'm not working out because I'm really hungry. And so I would go to the kitchen, and because I'm so hungry, I used to fix something up for myself pretty quickly, which was most of the time not healthy because you can't make anything healthy quickly. And I used to eat a sandwich or something, and take a bath and rush to office. I used to come back by 8 p.m. and I was mentally exhausted. So, of course, I did not exercise most of the days. I could not get myself to exercise most of the days. I changed and I put on some Netflix. After watching some Netflix, I used to think I'll read before I go to sleep, but then I would get so engaged in watching Netflix and then, get so tired. My eyes were so tired that I wanted to watch Netflix, but I did not want to read. So ended up watching Netflix 3 a.m. or talking to someone till 3 a.m. and then just, went to sleep. And this was a cycle. There were days that I could push myself really hard in the morning or in the evening and got myself to work out. But that was never more than 7 days a month, say. And a similar thing was happening with my reading and meditation and yoga, etc. And I think this is a story for a lot of us, including regardless of the age. I think students, professionals, people in their old age, I think everybody probably goes for the same thing when They wake up in the morning and they try to do a free flow of things, and they think that I will decide what I want to do today. I think that does not work out in the long run for us to do everything that we want to do. It is draining. It mentally and physically, emotionally, it drains you, because you're eventually you're not able to trust yourself to be able to do whatever you want to. You tell yourself every morning that you're going to make yourself breakfast and that you're going to work out, but you don't. So you're breaking your promises to yourself. And eventually that leads to bad self-esteem, right? Because you're not keeping promises to yourself. How do you know that if you promise yourself right now that I will study in the evening, that you will study in the evening, because you've been breaking the promises with yourself for so long that you can't trust yourself anymore. And so that eventually leads to a lot of exhaustion. Uh, and because, of course, you're eventually not taking any decisions, you're not doing anything for your health, mental or physical, your mental health and physical health are declining slowly. So how do routines actually help? So take my routine now, for example. Okay. And I'll tell you what the process of making that routine, how it sets you free. It's beautiful because it's an experiment on yourself, and you can at yourself, come at it by yourself. And if this is something that you've done for yourself, by yourself, and you feel beautiful doing it every day. So this is what my routine looks like now. I sleep at 12 at night. I wake up at 7. I I grab a glass of water, I make my coffee, and then I grab my journal and the book that I'm reading right now, and I walk to a place outside my house, as in not outside, just outside the gate where there's some sunlight. So I sit in some sunlight and I write my 3 pages of my journal today, the things that are just flowing through my mind. I bring them down on my journal, just 3 pages. It takes 15 minutes, and then 15 minutes I meditate. After that, for 1.5 hours, I read, because I like to start my day really slowly. I'm a lazy person in the morning. I like to think. I like to ponder over stuff. I like to sit. I'm not the kind of person who would just wake up and exercise, or just do eat the frog in the morning. People say eat the frog in the morning, right? Do the toughest task in the morning. I realize I'm not that kind of person. I tried really hard to be, and I failed miserably, like most of us do when we're trying to make a routine. But I realized I can't do that. So I made something that I like to do, which was writing my journal, meditating, and reading my book for 1.5 hours. By that time, I've gathered some pace. My mind is working, it's thinking of new stuff. I am motivated and a little I'm more active. I want to do stuff now because there is coffee in my body and thoughts in my brain from the book that I've read, and I've meditated, and I'm in a good state of mind. So then I exercise for 30 to 45 minutes. By this time, it is 9:45, 10 a.m. So what I do is I go for a bath. Oh, yes. And I exercise not every day. I exercise 4 days a week, and I do yoga 2 days a week. And these days earlier were not fixed. The 4 days that I work out were not fixed earlier, because those days I was just seeing, what my body feels like today. Does my body want to work out today? If not, I used to do yoga. If I felt like, there's some energy in me, if I push myself a little bit, I'll be able to work out. I used to work out, but I decided I'll work out 4 days a week and do yoga 2 days a week, but I had not decided which days were those. After some time of doing this, I I realized that I understood which were those days that I was active on. So now I fixed those days. So Tuesdays, Wednesdays, Friday, and Saturday, I feel active and I want to work out. I realized after noticing myself for a long time. And on Mondays and Thursdays, I do yoga. And after that, when it's 10 a.m., I make my breakfast and I take a bath and I sit to work till 10:30. And after that time, when I'm done working, I work till 6:30, and then I make my dinner till 7. And then after 7, I'm free to chill with my family. I talk to my friends, I catch up with them, I talk to my boyfriend a little bit. And some days I write. If I'm feeling like writing, I write. Some days I paint. Some days, if I want to do a new course, I learn some new course. So there's a lot of time between 7 and 12 at night where, I can give myself a lot of time. And imagine this, from not being able to achieve anything any day, now because I've understood how my body reacts and when I want to do what, I am able to have a good sleep regime where I wake up at the same time and sleep at the same time every day. I'm able to read a book. I with my frequency, I read almost 24 books a year, and this is the minimum. And I meditate every day. I keep my body healthy because I am making my breakfast, making my own food, and I'm exercising, and I'm keeping my brain healthy. And and because I'm able to put all these things in a routine, I'm able to free some time for the more creative things that I want to do, where I can put everything that I want to do on that day in that time. So if I want to feel like writing, I can do that. And if I want to chill with my friends or go out for a drink, I can do that. So the fact that the idea that a routine will bind you to a timetable is absolutely false, because a routine is actually setting you free. A routine tells you what to do without you thinking about what you have to do. And it sets a lot of your time free because you're not spending time planning, you're not exerting your willpower, motivating yourself. And because you've achieved everything you want to in certain time of the day without thinking about those things a lot, you are setting some time free for yourself completely to like just do nothing also. And that is so liberating. It is just a count it confused me in the beginning, when people used to say that a routine will not bind you, it will set you free. It actually does. And taking my example, I wanna tell you how it actually helps. That one, of course, we've realized that you feel so satisfied having done whatever you wanted to do without having to make a decision every day of now waking up and not thinking that do I want to exercise right now or do I want to read right now. I don't have to make that decision. I know when I wake up, I have to make my coffee, I have to grab my book, and I have to read. This is a decision that I don't have to make anymore. This is a decision that's made for me by me already. And that eliminates my need to plan. It reduces my need to make decisions. And of course, it does not require a lot of willpower from me. Two, it gives me a whole lot of sense of control. I feel like I'm in control of my life because I am being able to achieve whatever I wanted to achieve in a day. And so whenever things go wrong, uh, I know what to do next. And I know that I am in control of my body, of my health, of my mental health. I feel in absolute control, not in absolute control, but the things that I can control. There are a lot of things that are uncertain. So my brother got COVID in the initial time when people used to get really scared when people got COVID. Of course, even now, if it's severe, people get really scared, and it's uh, understandable to do feel like that. Uh, he got COVID and we got unnecessarily really scared because his symptoms were not very, very scary, but he was getting a lot of fever and everything. I got really existential because I am very close to my brother. Very close is an understatement. It's a person that I cannot exist without. So because I got really existential, I was not being able to function. My mind was all over the place. But because I had a routine, it dictated what I wanted to do in the day. So I went to sleep and I woke up and I told myself, bro, you don't have to think what's going on, just do what you do. And so this structure, this framework where I could wake up and I could read and I could exercise, it distracted me from all the thoughts that I was unnecessarily having, all the overthinking. And also, it was keeping me in control of my own life. And that was very, very liberating. Three, it boosts your self esteem like anything. because now that you can keep the promises to yourself, now that you've achieved for a month or two things that you wanted to, wanted to work out 3 days a week, you wanted to read a book 3 days a week, and you've been able to do that for 2 weeks. Now you know that you keep your promises to yourself, and that boosts your self-esteem. You're able to take new projects, you're able to do new courses, you're able to give yourself higher aims in life, aim and goal in life, because you know that if I'm able to achieve this goal, if I'm able to do this in life every day, if I'm able to achieve important things in my life every day, I will be able to do this. And so it's a huge boost in self-esteem. It constantly reinforces your belief in yourself. And of course, there's a very important and very basic concept of stress, where if you don't exercise enough, if you don't sleep enough, and you don't eat well enough, that this less movement, less sleep, and undernourishment act as stressors in themselves. So these things will act as stressors to your body, and your body will have lesser energy, and your body will allocate some energy to deal with these stressors, and it will have lesser energy to deal with other stresses that are coming into your life. For example, other negative thoughts that are coming into your life, difficult situations that are coming into your life. So you will not be able to deal with them in an optimum amount because these things are already stressing you out. So a routine will help you have good sleeping habits, eating habits, and good exercise habits, and now these things will not act as stressors to you anymore. And so all of your energy will be intact to deal with the situations that you can't control. Now, if a new situation is arising, you will have more energy to deal with that. If there's a negative thought in your mind, you will be able to deal with this thought without feeling irritated or drained or exhausted. And so that's beautiful. And not to I do not want to ignore this fact, because a lot of people think that routines kill creativity. Beethoven, Freud, Haruki Murakami, these are the people who have go on and on about how a routine will help boost creativity so much. They say that we are what we repeatedly do, because excellence then is not an act, but a habit. And that's the most beautiful thing that I've heard from a creative person for a long time. I think Murakami wakes up in the morning and he writes for 5 to 6 hours, and then he goes on for a run. And he has been doing this for years in his life, and that has been able to keep up his creativity and new thoughts, and he's been able to write brilliant books by that. So when you are also done with the essentials of the day, it leaves you more energy to be creative and productive. And of course, it leaves you more time for self-care and self-awareness, where you can give more time to music, your family, your passion, and your skincare. So, of course, now we know that, what is a good routine. We know what a good routine does, but we can ask ourselves what is a good routine and how to build one. And if anyone tells you that this is the best routine and you can follow it, and you will be able to live a good life, do not believe that person, because a good routine for you will be completely different than another person. A CEO has his own routine, a therapist has his own routine, a teacher has her own routine, a student will have their own routine, and you as a person, the time that your body feels the best in doing something is completely different from you than another person. So it's really important that you come to your own routine by experimenting with yourself and understanding what you feel, how you feel, and how you understand. But of course, you have to you can research, and I can also tell you there are a few things that are really good uh, elements of a good mental health routine are, sleeping on the same time and waking up on the same time, having water, because dehydration will cause irritability. Then sunlight is really important for good mental health. And of course, like we discussed, exercising and having good food. So sleep, exercise, and good food are extremely important for good mental health, because you don't need extra stressors to be stressing you out, because you need to preserve your energy. So how to build a good routine? We'll talk about it in steps. There are 3 main steps. Okay. One is, are you ready, guys? If you're ready for this, if you're ready to understand how to make your routine, just write ready. I can't see any messages. Awesome. I'm so ready. I'm so ready to tell you how to make a good routine. Okay, great. So the first step is talking to yourself. What do you have to talk to yourself about? Talk to yourself about what are the most important things that you want to do. Make a list of everything that's important for you to do every day or regularly. It's not necessary that you have to do yoga every day, but it's something that you want to do once in a week or once in a month. And so write it down, okay? List everything that's important to you. For example, it could be sleeping, reading, exercising, meditating. It could be any of the things that I mentioned earlier. Now that you've written everything down, pick 3 things, pick 2 things from the list. And in my example and my suggestion, I will pick exercise and reading apart from sleeping on time, because sleeping on time is something that you cannot take out from a routine. Why is that? Why is sleeping on time and waking up on time is important, or it's something really essential? Is because a routine is like a puzzle board, okay? And now what do you do when you come to a puzzle board? The easiest way to start a puzzle is you find 2 to 3 pieces around each other, right? In the center or anywhere, just you find 2 to 3 pieces. The best way to begin a puzzle is to find one piece and then 2 to 3 pieces that attach them to the first piece. Now that you have a center anywhere, you can keep making the puzzle around it, right? So we want a center around which we can build. So in our routine, sleeping at the same time and waking up at the same time, and is that center of the puzzle, because we can keep attaching stuff to this block to make a routine, right? And so what this block will look like now, you exercise, you have to exercise, you have to read, and you have to sleep, okay? So talk to yourself and look at your behavior in the past and try to make a guess about your body. Okay, try to make a guess. Are you an active person in the morning, or are you a slow person in the morning? If you're an active person in the morning, exercise in the morning, after you wake up, and read before you sleep. Okay, this is the easiest example that I could begin with. So now you have a block. What is that block? Read at night before sleeping, sleep, and exercise after you wake up. You've attached your reading and exercising to sleeping. And now you have a block of 3 puzzles and you can start building your routine around it. Does that make sense till here? Say yes, write in the comments yes, if that makes sense. I will tell you how to build, how to be able to sleep and exercise and read. Okay, it does make sense. So now we have a block. And sleep was important because sleep is the easiest puzzle that you can fix. It's the easiest thing to fix because and it also takes the least effort to fix the time of sleeping, and it gives you the highest satisfaction to fix the time of sleeping, because once you fix the time of your sleep, your body will start resting itself in that fixed time period, and you will feel more energy when you fix the time of your sleeping your sleep schedule. So now you understood the most important things to you. As an example, we took reading and exercising. You made a block of 3 things that you did together, which was reading, sleeping, and exercising. And now we do this. Okay, we start doing this. Does not matter what time you decide to sleep initially. Just decide any time that comes to you. That is the most easiest to you right now. If you're a student and you sleep at 3 a.m. in the morning, just decide that you will sleep at 3 a.m. and do 7 hours of sleep and wake up at what is 7 hours from 3 a.m. 10 a.m. right? So 3 to 10 you sleep, but you read from 2:30 to 3 a.m. and when you wake up at 10 a.m. you exercise for half an hour after you have your water and do your stuff. Half an hour later you exercise, right? So this is the order that you have to maintain, and you have to try to do this. You have to try to do this every day for 2 to 3 weeks. Try for 3 weeks. And now when you are doing this, two things are important. The important things are maintaining the order and tracking. Tracking is extremely essential. You have to make a calendar somewhere where you write the days and you write the dates and you write what time you slept, what time you woke up, and did you read and did you exercise. If you were able to do all of these three things, cross that date, right? And you try to understand which days were you able to behave how, right? So after 2 to 3 weeks, say a month, 3 weeks have passed when you try to do this thing, you've maintained the order and you've tracked. 1 month will have passed, okay, and now two things will have happened. One, you will not you will not be able to do this. And remember, when you try to exercise or read, try to keep a simple goal. Don't say don't try to tell. If you want to do it every day, definitely try to do it every day, but try to tell yourself that I will try to do it 5 days a week, not 7 days a week. And so see 1 month later, which were the days that you were able to do this? What was the time that you were able to sleep at? What was the time that you were able to wake up at? And if you were not able to achieve, say reading, okay, you were not able to read at 2 from 2:30 to 3, and you were not able to exercise from 10 to 11 in the morning, you were too tired to do it, you have to try to change the timing of this whole block. Maybe you're too tired to read at night and you're too exhausted in the morning, or too hungry in the morning to be able to exercise. So now change the time of this entire block. Okay, now don't sleep at 3. Try to make yourself sleep at 2 or 1:30. Now this will be easier for you to do, definitely easier for you to do, because you've been trying to maintain this order, at least trying to maintain this order for the past 4 weeks. And your mind will now have become accustomed to this order in your mind, that I have to read when I sleep and I have to exercise when I wake up. Even when you were able to do it just 2 days a week, your mind will have changed certain neural connections in your mind to understand that I have to read before I sleep and exercise when I wake up. And so it will start making those changes inside your head, right? So after a month, you have tracked what is that time that you were what were the days that you were able to exercise, what were the days that you were able to read, and what was the time that you were able to sleep at. Continue this tracking. Continue this tracking. You will come at a conclusion that I am mostly lazy on Mondays, so I cannot exercise on Mondays. If I push myself too hard, I can work out on Tuesdays and Wednesdays, but Thursdays I just want to take a break. And this your calendar will tell you. It will become a pattern 1 month or 2 months later, when you've decided that you're doing this. Just these, and the important thing is just these 3 activities, because adding 5 things in your routine will not work, but adding 3 things in routine is not that effort taking. And because you're doing it in a block, it will be exciting for you to do. And tracking will also be exciting for you to do, because you're finding something out, something new about yourself, and you're learning something new about yourself. You're being aware of your body and what it's telling you, and you will be able to talk to yourself really nicely. So it will be a good experiment. So after 6 weeks or so, or 2 months, you will be able to see on your calendar which days were you able to exercise, which days were you able to read, and which time were you able to sleep. Now that you've actually come at a place where you decided what you had to do, you talked to yourself and you tried to do it. Now you've come to a point where you know about yourself. And because now you know about yourself, fix this routine and make the goal sustainable. So now don't tell yourself, I have to work out every day. Tell yourself, I have to work out 4 days a week. I have to read 4 days a week. And I have to sleep between 1 to 2, right? And you know that you will be able to do these things because you were able to do this for the past 2 months, because you were able to work out 3 to 4 days every week for the past 1 week. And so you will have come to a routine which you had made for yourself, by yourself. You had learned about yourself, and this will help extremely because now you've successfully created a block of reading, sleeping, and exercising, and you can keep adding more things to this routine whenever you want to. So you can tell yourself that I wake up and I exercise, but I don't want to exercise first thing in the morning, but I have a fixed block. So what I can do is I can meditate 15 minutes before I exercise, or I can meditate 15 minutes after I exercise. Or you can tell yourself that I am reading before I sleep. So what I'll do is, I have not been able to connect with my family for a long time. So I will connect with my family half an hour before I read. So if you read at 1 a.m. At night, you can connect with your family at 12:30, or connect with your brother at 12:30 or sister at 12:30 till 1 a.m. So this is a block that you can keep building around and make a good routine for yourself. And so these are the basics. I just want to remind you of the 3 things that you had to do. One was talking to yourself, coming at everything that was important to you. 2 was starting, maintaining that order, and tracking. So talk to yourself, maintain an order and track, and a month later, fix the routine and learn what you've tracked and fix the routine. So talk to yourself, order, track, and then fix. And this will help you build a beautiful routine and something that will help you for a long time. Always help you reinvent yourself, learn something new about yourself, and leave time for you for things that are more important to you, or things that you want to learn or do something with. And I think that's where I will conclude today's session. It was great talking to you all. Just let me know if you have any questions for me.
Yeah, thank you so much, ma'am. That was very insightful. We will take up a few questions since we are running short of time.
Sure.
Okay. So one of the question is, what techniques or routines do you suggest so that we can maintain a healthy boundaries with our family and friends without hurting them?
So the routines that I just said are the ones that are the easiest to do. If you are a lazy person in the morning like me, you can wake up in the morning, and because you're a lazy person and you do not want to work a lot, you can talk to your families in the morning, right? Talking to your family will not take a lot of effort. It's not like working or exercising, and you can use the time in the afternoons or the evenings that you are more active to finish your work or stuff like that. So if you're a little exhausted physically, when you're physically not very active, use that time to talk to people, to do meetings, to reply to texts. And so if the question is about families, if you're lazy in the mornings, talk to your family in the mornings. If you are lazy at night or exhausted in the night, use that time to just lie down in your bed and talk to your families.
All right. The last question is, what is the importance of psychology related techniques and hacks like these in our personal life?
Psychology related techniques
or routines like the ones you mentioned that we could possibly do, what importance can they have in our personal life?
Just like I mentioned, the things that they help with are building trust with yourself, reinforcing belief in yourself, increasing self-esteem, reducing the amount of stressors that you give to your mind so that you have more energy to deal with the negative thoughts and the negative situations that are coming your way. So these are the things that it will help with.
All right. With that, we end the Q&A session. I pass it on to Angela. Thank you so much, ma'am, for joining us and giving us your routine hack. I'm sure the attendees will, benefit from this.
Thank you so
Thank
much,
you.
Gloria. Thank you for having me.
Over to you, Angela.
Thank you so much, ma'am. I think your approach to talking about routines is very insightful because it's not something that, you go on Google and you try to find out, how to sort of best get into a routine, and they will tell you the, usual ways of, doing it, put two things, three things, five things together, try the 21-day method. But I find that most of these methods don't work. But when you slowly incorporate yourself, these things into your life, especially when you listen to your body and what it is trying to tell you, and your own body will tell you what it needs. I think that is something that is such a key takeaway for all of us in terms of self-care that we need to do for ourselves. That is something that I'm personally going to take away from this session, and thank you so much for that. As a token of our love and appreciation for your work and for spending time with us, especially since you have a busy schedule yourself, I would like the tech team to present to you an e-certificate on our behalf.
Thank you so much, Angela. Thank you so much for your kind words. I really appreciate them.
Thank you so much, ma'am. So this e-certificate will be emailed to you shortly.
Thank you so much, guys. It was great being here.
Thank you so much, ma'am.
Bye-bye.
Bye-bye. With that, I'll pass it on to Tarini, who will introduce to us our next speaker.
So, good afternoon, one and all present here. It's my privilege to invite our next speaker, Dr. Rashi Agrawal. She is a life member at IMA, Indian Medical Association, and IAPP, Indian Association of Private Psychiatry. Dr. Rashi is not a regular doctor, but a psychiatrist working on busting mental health myths in a fun and interesting way. So, ladies and gentlemen, now I call an amazing personality, Dr. Rashi Agrawal.
Hello. Hi. Thank you so much for having me. You guys are doing amazing work.
Ma'am, we will be having a short buzzer prior to 5 minutes of the session, and a long buzzer ending of the session. Thank you.
Sorry, I'm not able to hear you. Can you be louder?
Okay. So, ma'am, we will having a short buzzer 5 minutes of the session and long buzzer ending of the session.
Still couldn't get you.
Am I audible?
So 5 minutes when your session is remaining. So at 5:25, there will be a short buzzer indicating the time will be running out. And at 5:30, we'll be ending the session. So there'll be a long buzzer.
Okay.
So indicating.
Okay, thank you. So we'll start at 5.
We can start now. We'll end at 5:30.
Okay, yeah, we can start now. Let the session start. Should I start?
Yes.
Hello everybody, I'm Dr. Rashi Agarwal. I am MD in psychiatry. I am a very ardent believer that mental health needs to be taken forward, and we can talk more and more about it in a very open and like a non-formal and a casual way, so that it becomes a normality for around us and people around us, especially our elder generation, parents, grandparents, and they are also involved in talks around here, so that we can have a good conversation, and this overall reduces the prevalence of mental illnesses all around. Now, a very common question that been asked all over is that if not now, then when? Like you guys asked me that question. If not now, when are we going to talk about mental health? So let me just give you a very small example when we talk about this, that these days a lot of people very openly, they can talk about things related to menstrual health, because the talks around menstrual health started somewhere 5-7 years down the line. Hence, today we are in a position to talk about a lot of things related to menstruation, hygiene, and how it's affecting our day-to-day lives. So similarly, I hope that when these start the talk around mental health these days. So we'll take it forward, and especially with the younger generation joining in and becoming a part of this movement, it is reaching bounds more and more. Like whenever I meet these young girls from college and schools also, and they talk about some things, and I always feel like, oh, I never had that kind of opportunity, or maybe I was not that much aware at that time because things were not talked around. So that is obvious that we have come a lot of way forward, but we need to go more. Like there's no end to how much more forward we can go actually. But at least in a lifetime, working to somewhere spread this and like make a mark that, okay, you did something that was valuable not only for yourself, but to at society at large. Now when we'll talk about some serious things regarding mental health, like what? First of all, do you know that WHO in 2030 said, like in 2030, depression is going to be one of the most common causes of death. Imagine how like problematic, scary, and threatening that is for us, that we know something is going to happen and somehow we can't do anything about it. Like what to do actually. So, and this is what they projected way before the pandemic, and we all have seen that COVID has affected each and every point in our life, be it our menstrual health, be it our mental health, be it our physical health. Obviously, everything is affected. I don't think there's anybody who's been left out or does not has faced the brunt. I say this line a lot, that the people, like there were only numbers last year, but unfortunately that numbers have converted to faces this year. Nobody amongst us is a person who hasn't known anybody who has not had COVID, or unfortunately not heard of a death of a close family member. So that is very disheartening. Hence, this is the data that was projected way before COVID happened, somewhere I think in 2018. So we are expecting that studies are yet to come to this happen earlier. And especially with COVID, a lot of things that changed or that happened are that people started talking about mental health. They were alone, they were at home, so they became more aware that what is happening. Do we really need to pay attention for this? And is it this something that is really going to help us out in the future, or is it something that might affect me in long run? So obviously we have to start the conversation now, because the earlier the better. We have seen this with COVID. Prevention is obviously better than cure. That stay at home, wear your mask. Similarly, if you're more aware, if you have more talks around it, so what is one thing that you can do is that you can identify a lot of problems in the very budding stages. What happens in that is you diagnose early, you treat early, and the duration of treatment, the whole course, it is shorter. Once if the problem starts increasing and spreading a lot, then it becomes difficult both with therapy and medication to contain it, constrain it, and like it gets difficult for both the person. Even the patients get tired. I don't want to take medicines. I don't want to do this much therapy. Hence, it becomes problematic at a certain level. That we all will agree that yes, this is somewhere really problematic. Now, I would like to ask, there are so many people who joined the summit. How many of you frequently take leaves for your physical health? I'm sure a lot of people are like going to agree, okay, I have a stomach ache, I have a headache today, somebody in my family is not well, I'll go to, okay, I am going to see the doctor today, I have a dentist appointment. It is not that rare. It is common for you to seek seek sick days for yourself. A lot of people have done that in offices, colleges, you do that. But again, my second question, how many of you have taken leave for your mental health? It's really hard to, I will really love to see people commenting here in the chat that how many of you really went to your boss, went to your employer and said that, I'm not feeling good mentally. Can I take a day off? Like, I have good anxiety issues today. I will not be able to make it to work. It takes, first of all, courage on your part to come up with this and say this to your employer. And secondly, your company and the place you work in is friendly enough to be like, okay, yeah, we allow. It's not even about allowing, but yeah, they are that kind of positive behavior, that they encourage such kind of things, that okay, this is a behavior we encourage, and we think people should take mental health days off, that when they feel like, okay, I'll not be able to do work productively, I should stay at home today and concentrate on myself. So we need to take these talks forward so that myself, like my physical and my mental, stays in a balance, and I am the best version of myself every day. I'm sure a lot of you who are watching and listening can comment and say that yes, this is something that we are trying to strive or achieve for the future, so that it is relatively easier for us. We are doing all this so that we can change the norm future, so that whenever we go forward from here, our future generations, they are like, okay, people before us did something, that we have this kind of privilege today, that we can go ahead and tell this to our employer that I'm not feeling good. I just take some days off for my mental health. Now, can you tell me in the comment section, what are the reasons that stop you from seeking such sick days? Anybody, like, why don't you want to say this? What are the frequent problems that you feel that happen with you? I see some chats. Yeah, I'll just read out what everybody, all the guys have to say. Very good answers, yes. Stigma, most common complaint that people have. Lack of acceptance, I agree. Lack of knowledge, true. A lot of people are seeing productive anxiety also. Ignorance and misinformation, completely. Amazing answers, yes. People think you are weak, I agree. So yes, these are the basic reasons why you don't feel, or you somewhere are taken aback that, okay, if I say I'm having a bad mental health day, will it affect my employment status? Will my employer think that, oh, they are not strong? Are they weak people that we have employed and who are not able to work productively? Very, very common answer. Yes, we are not ready to accept. I completely agree with people who are commenting here. Lack of knowledge, very big thing. That's why I'm saying we need to change the narrative this way forward, so that when we become those employers, those bosses, 10, 15 years down the line, we have that open mindset. Yes, we are trying to change the mindset of people who are already there. But at least, see, change does not happen like this. Change happens slowly, gradually, when you initiate all these conversations in a normal phase. Like when you're sitting in a group of friends, just when you say, I have a headache, I think I'm feverish, I'm not feeling well. Just make it a normality to also talk about, I think I'm feeling anxious and I'm not able to concentrate. See how there's a pin drop silence around you and people have nothing to say. When all of us start talking about this in a normal manner, then only we can normalize this. Ki haan, aise baat kar sakte hain. This is how you usually talk about it. So yes, don't ever stay away or take a step back that what will people say. There might be places where you have to be on your tiptoes, but try generally, especially in family, close net circle, friend circle, try talking about it. Maybe once or twice people don't pay heed to it, but maybe next time, times come forward, they start accepting, and maybe the other person who's actually troubled at that time, they have courage with you coming out and saying that I have this complaint. They might come out to you and both of you can get professional. The main reason that we are encouraging this conversation is so that people come and seek help. You can't like go to anybody's house and force them to take help. Unless somebody comes to you, it's very difficult for you to reach people. So even with, I am saying, the all therapies that we have, all the medications that we have, we really can't help people until they come up to us. So many a times, even if your family is unaware of this, the family also can't get you the right treatment. And even if the family is unaware, then it's completely a different scenario. How will they get you treatment for something that they don't know you're suffering from? Completely agree with people. Yes, these are a lot of informations, a lot of misconceptions that we have regarding our mental health. Do you guys also feel that if somebody opens about these things, you become kind of a topic about office gossip? Like people in groups talking about, she has anxiety. She took a day off for like this way, and she's going to a psychiatrist for help. She has depression. So a lot of time people have come up and told that, please, can you give me a word where I can tell people what I really have? And they're not ready to take word as depression and anxiety because they feel they have such negative connotations attached to them that what if I tell people this and they'll start judging me? So very innocently people ask, ma'am, please tell me something what I have. Why am I going to the doctor? And just tell me one word. So you're like, why can't you tell this? They're like, people start judging. So, but no, sometimes when it is really severe and you feel your work is being affected, then we give you words like that. Okay, tell this. Until you're fine, go and tell this. But this kind of behavior we have to change. As I said, one person coming forward and talking about this, even if not for yourself, maybe you're just feeling transitory anxiety. Okay, exam is here, I am feeling anxious. Something, my promotion is coming, I'm feeling anxious. You might just talk about that anxiety. And imagine the person sitting in front of you that actually suffering from an anxiety disorder. They hear you and they are like, okay, if she can do it, he can do it, I can do that too. Maybe they share and the person who's actually in need of help gets the right help. We don't talk about mental health. Like, you will be surprised to know women tend to have depression in 3:1 ratio than men. So nearly more than twice. But do you know men have 2 times more suicide ratio than women? Why? But this is something you actually think about, that why is that I'm seeing it like this? Is it really that men have depression in a lesser prevalence, or is it it's reported or not? Why? So yes, both of them are the real issues. First of all, the society has conditioned men in this kind of a way that be a man, you need to be strong. You get it? We hear these things a lot, that you are a man up. Why are you being sad? You have to take care of the family. Why are you feeling anxious? Boys don't have these kind of things. Boys don't cry. Why are you crying? Are you a girl? Tell me what other things you have heard about. Men, please come here and tell us what kind of this toxic masculinity traits we hear day in and day out, which are so wrong. You see little boys, when everybody around you starts telling you things like this, what happens is with you, this changes your processing of emotions here. So when you grow up, even if you have an issue, you would not want to go ahead and tell this to people around you because you feel that I'm not man enough. I'm not manly enough. Or you might feel like, what will people think that I'm not strong enough if I open up about this feeling? Hence, this is a lot of reason that translates directly into more suicide numbers than depression numbers. It's not like men are having depression way less than women. Yes, they have somewhere less than women. That again has a lot of social, cultural, emotional beliefs. But men don't come forward. Secondly, due to this inadequate emotional processing, I would like to say, what happens is that females very normally, they have these complaints like feeling sad, mood swings are happening, they can cry out easily because it's fine for women to cry. Like, she's a crybaby, let her cry, though even if they are processing their emotions in that. But when it comes to men, we see that depression usually presents in form like decreased concentration in work, just having a low appetite, just having a low libido, having difficulty in sleeping. Why? Is their presentation different? No. Why is that so? Because they don't know how to process their emotions. Nobody told them since the beginning that it's okay for you to cry. It's okay to accept that I am sad. It's okay to accept that I feel low. But no, how do they then, due to this emotional processing problems that somewhere due to society problems, cultural problems, growing up, emotional factors, they start expressing their sadness in anger. Very commonly, men will come and say, I feel not angry and I don't know why I'm angry and who I'm angry at. This might just be a presentation of how they are expressing what they are feeling. Depression can be presented in n number of forms. That's why we say it's not like a one stitch like fits all. Very, very tailor-made. Everybody, it's even if two people in the family have the same complaints, it won't hit you the same. So different for everybody because you never know who feels what. Personality type, family structure आपका कैसा है, are there any people supporting you in the family or not? This is not. So how can we change this? Whenever you have a young boy in your family, you have a smaller cousin, you have a nephew, future when you have kids of your own, start promoting this kind of behavior. Many times when couple come to us for therapies, for treatment, these are some lines I tell them when they bring a little kid along with them. Do you frequently tell your boy not to cry? Do you tell them that you hit like a girl? Do you tell them to be strong? Please stop saying words like this. And they are sometimes confused that we came for ourselves and why is she telling us things like this for our son? Because until unless we change the narrative everywhere, this is not going to change. Men really need to come forward and we need to be supportive and accepting of this fact. So change something within yourself also, that your boyfriend, your brother, your father, your cousin, anybody can come up to you and they say, hey, sis, I'm not feeling good. Can you help me? I think I'm not able to concentrate these days. What can this be? Never ever shy away from getting a professional help, because what else can happen? Nuksan kya hoga isme aapka? What can you lose? Just one consultation, that much I think privileged enough people who are really privileged enough, you spend this much on one person. That much amount just taking care of your mental health is a big deal. What if it was just a thing that you were thinking about and it's not a professional, like clinical disorder? At least you'll get the satisfaction that, okay, this was just something I was overthinking. So at least you're relieved that something is not happening with me. Encourage, and women also, be accepting of this fact that whenever males are coming to you, don't rush off and saying, oh, be strong. You have to support me. I've seen a lot of times when there are many women in the family and less male members, like brother is there and they have this kind of responsibility. Oh, you be strong, you have to take care of sister in the future. Who will take care of? And many times girls have retaliated saying, why, I don't need his help. I can do that enough. That is also something good to say, but the best thing to say is that we are here for each other. He's going to help me, I'm going to help him. And it's not just about one person doing that, it's about both of us doing that. Any other complaints that you guys have about how we can change the narrative, please send them here. I'm seeing the comment section. I'll surely be able to reply to whatever questions I can hear. Yes, you're right. It is a very common talk in the Indian family. I think not even Indian family. This is a more of a South Asian, like global issue as per se, 100%, but more over a South Asian issue. Here we have a lot of gender biases, and many a times when we talk about feminism, we feel it's only about women. No, it's about equality, equal share, equal work everywhere. You will also get some lightened of the burden, and men really need to come forward, encourage men around you to come forward and talk about these issues, because I always say it's not about helping one person. One person coming forward and telling about their complaints encourages many more people to come forward and discuss what they are feeling right now. Tell me some of the changes that you have seen in people around you or in your family, that something that you said that annoyed your family members and you thought that it was just a normality because you thought this is happening everywhere. Like, I agree that I have sometimes initiated difficult conversations and people in the family were taken aback because, oh, that's not the normality. How is she talking about this? So yes, as I said, there is a generation gap. There are things that you feel cannot be corrected like that. But when you say this day in and day out, I don't mean to be like you should be offensive in this manner, but try and putting your point forward. Let's see this, I am feeling this, and how, what can I do about it? Or like, yes, very frequently we hear these kind of things that, okay, I'm feeling, so what? This is something normal. Like when we talk about anxiety, parents or grandparents, they're usually saying these are new things that have been invented. Pehle ye sab nahi hota tha. No, this used to happen a long time back. It might just be that you weren't very much aware, and yes, the prevalence has increased, no doubt, but the talks around mental health were not there. Previously, people like physically theek ho jaye, wohi bahut hai. Okay, yes, somebody has brought up a very nice point. Now people are more accepting to have a me time. Me time is like a topic for another day. especially with women, I would like to say this kind of thing. You felt that, okay, when you were born, you were taking care of your father, brother, mother, and the family. Then you grew up and you were like told to be the ideal daughter who needed to learn to cook, clean, and take care of the family members. Then when you were married and you started serving everybody in the in-laws house, and there was no scope of me time, there were no house helps. All that you were doing was for others. This frequently led to a lot of frustration, a lot of anger, suppressed emotions, and that translated a lot to family and marital problems, like women coming up and saying, I really don't need to feel intimate. I don't just feel like it's fine. I just make love to my husband whenever he wants to. I don't ever feel like doing that myself. Why? Because she never somewhere got the position of the idea of a wife more. She was more like a helper around the house or a mother to everybody in the family, that she's taking care of everything by herself. She was so exhausted taking care of everyone that she somewhere had this like a vacancy in her, that there's no me time. You were not pampering herself a lot. Yes, absolutely. You never, बहुत सारे factors हैं. Me time में भी ना, first of all, no house help, so you will not have time. Second, because there's no concept that you have to take care of yourself. If you are women, you're born, take care of others, and that's all. That is the purpose of life, to please others and work for them. When women started realizing that I am a person, I am not a helper, I can do a lot of things for myself, and I deserve it. I am a human, first of all. So this also got a lot of change, retaliation from the family members, because families are not accepting of this fact. They always feel that more educated women, more woke women, or who are more aware of these rights don't make good daughter-in-laws. Another topic, yes, that they'll be more demanding of their rights, which people don't feel is a good thing. That why do we don't talk about it? But somehow we don't realize each and everything is related to mental health. If you don't feel that you can change if you feel that you can change your mental health without changing your surroundings, that's not possible. You somewhere have to change everything that's going around you, only then. It's just the same like if there's a kid and you keep hitting the kid and you start saying that don't cry, that's not going to happen. You have to change the external factors also. Somebody has rightly commented, interdependent is the need of the hour. And yes, independent from both sides, completely. If both men and women are working, it is their responsibility that they should, and if they can, like share the load everywhere. Be it household chores and as well as outdoor chores. Be it finances, if you are both earning enough and capable enough to help around the house, finances, household chores, laundry, cooking, cleaning, basic human skills. Why are we shying around saying that men don't cook? Do we know the best chefs are males? Like, why? This is a very important point somebody brought out of that. I saw this in the movie, I don't remember the name, that when women cook, it's like a duty and responsibility. When men cook, it's like something to be applauded and rewarded for that. Hence, we see all the male head chefs, and women are mostly working at lower paying jobs and just cooking in the home every day. Why? Because society does not want to reward you for that. Another very common mental health myth which we are going to bust right now. Anxiety and depression is in your head. It's not a real thing. Head में ही होगा ना, पैर में, पेट में नहीं होगा. See, there are two things. First of all is brain. Second is the mind. Everything is interrelated. Your brain has a lot of changes which leads you to having depression. Please go back. People who want to know more about this, go back to my channel. There are a lot of videos explaining why these things happen. It's not like there's one complaint happening and you get depressed. There are a lot of factors that come into interplay when a person is diagnosed with clinical disorder, clinical depression, clinical anxiety. It's not like I got one exam bad and I'm in depression. बहुत लंबी लिस्ट है, criteria satisfy होना चाहिए, then you have a clinical depression. Very common solution that people give is it's not a real thing. मंदिर जाओ, पूजा करो, ठीक हो जाएगा. A lot of elders say that because they feel that this is something that you've just made up. Why do they Imagine saying this for things like physical illness. Oh, you've broken a bone. This is all in your leg. Rest and it will heal itself. That's not how it occurs. We all know that. Similarly, with the mind, it's not something that you're just thinking. Your brain undergoes changes, and that's why its receptor level, its neurotransmitter levels, that causes you to have anxiety and depression. See, we all have anxiety at one or other point in our life. That is a normal response. You have an exam, you have promotions, day-to-day activities, overwhelming work, you can get anxiety. You will feel sad. You will feel happy. You feel excited at one or the other point. These are normal emotions to experience. But if any of the emotion goes beyond a particular set criteria and duration, and it's not letting you work, it's not letting you sleep or having a normal life, then it becomes a clinical disorder. No, it's not good to have stress, not positive or negative. Stress is a thing that I would say it's good to have motivation to work forward. But if you end up, one more thing that our generation has glorified is overworking and burnout. I have myself been like a target or a person contributing to that, because earlier I used to feel that if I am not that tired by end of the night, and if I end of the day and if just not crashing and sleeping, then I'm not worked hard enough. So chronic burnout, if chronically you are stressed, you're having anxiety, every day you're putting in your 100%, you're bound to crash. It's okay to have some off days. Take your off days to yourself so that you feel relieved. Please send me more mental health myths so that I can bust them over here. Please send them in the chat section below. Completely agree. Yes, men are cooking these days. And basic life skill, you should know how to cook, clean, do laundry. But where is this good meme? I read it somewhere. Men wrote that women are so much invested in these days talking about and learning how to do makeup. Will they feed makeup to their husbands? And a girl replied to that oh, men are ready to eat makeup but not use their own hands. So that is just a satirical way of saying things. But yes, बेसिक लाइफ स्किल्स हम सबको आने चाहिए. कुकिंग, क्लीनिंग, आप अकेले एटलीस्ट अपने आप को सपोर्ट करने लायक होने चाहिए. बेसिक फाइनेंशियली, emotionally, socially. Okay, very good question. How can this awareness go to rural areas? I have a very interesting thing to tell all of you. We somewhere feel that we are very progressive and modern, especially the socio-culturally, economically, the middle class that we deal with every day. You will be shocked to know how much people in the rural area are aware. I'll give you the reasons why. First of all, they don't feel as stigmatized. Jitna you will see in a tier 2 or tier 3, in a good society, you see people will not visit a psychiatrist that is in their area. They will go to another area. Many a times what you will feel is that people will hide things. What will society say? How will this happen? And they don't get the right treatment. Somewhere or other, especially with severe mental illnesses in rural areas, people are aware that once or twice they will do that jhad poop, they will do magic or religious healing. But what will happen after that is that they know that there's a doctor in the town or in the city who can cure this. They don't know your name. They don't know your label, that you are a psychiatrist, or for them, you are just a doctor. They will come to you, they will do the whole treatment right time, and they will go back and tell other 10 people that yes, these things are treatable. You can go to so-and-so doctor and they will treat you. Even in the middle class, so-called modern society, even if a person is taking treatment, they won't go back to 10 of their friends and tell them that, oh, my anxiety got cured and it's just treatable, you should do that too. Because they feel stigmatized that what will my friends say? हमारी स्पेशली हमारे आसपास की सोसाइटी में स्टिग्मा बहुत ज्यादा है, and that is the reason people don't talk about it and they hide things like this. But yes, how can we take this to rural areas? Talk to your house help. बहुत ज्यादा दूर सोचने की जरूरत नहीं है. Start with your home. I am just saying take care of one person, not even taking care, just often on ask them about how are you feeling. Very common example, if these days you're registering yourself for the vaccination, it gives the option of registering for 3 more people. You can register your house help. Very small things will take these things forward and we can help society as a whole. Thank you, Tarini. Very good question. Do you think pandemic has given a rise to mental illnesses? The mental illnesses are at an all-time high and they're just expected to increase. I say this a lot. We never were ready for a health pandemic and you can never be. But we are surely not ready for a mental health pandemic, which has just double, triple the rate of mental illnesses that are happening. But yes, it has also given us a time to think more about it. When everybody was at home initially, last year, March, do you remember everybody was cooking and making that Dalgona coffee? This used to happen a lot. Why was this happening? Because people as a family never had time this much to stay alone with the family, get this time in the life where they could do anything at all. Secondly, many people came and said it is awkward for us to be with the family. We don't know what to do with them. Because we have never lived as a unit. You were going school, parents were going to work. So everybody of us did not have this time to stay together and stay connected and talk to each other. Many families had these complaints. But yes, it did give us a time to think about our complaints, like what I can do, what I cannot do. And is there something that we really need to think about and get ourselves analyzed? Anybody has any other mental health myth that I can bust here? Otherwise, I would just like to end on this note and say this again and again. There's no wrong in seeking professional help. See how much your life can improve by just one formal consultation. You will see the difference yourself. Thank you so much, everybody. You sent some amazing questions and I've loved busting these mental health myths. This is one of the kind of my favorite thing to do when people tell me myths and I'm like, no, that's wrong. I'll tell you the scientific logical reasoning behind that.
Thank you so much, ma'am. There are a few questions in the question and answer session. They are not myths essentially, but a few people have asked a few questions. I'll read out a few. How to deal with someone if they demean you or don't allow you to speak in any conversation just because of a little age difference?
I think you'll have to be a little bit louder, right? Can't
louder?
Yeah.
Am I audible now? Is this better? Is this better now? Okay. So my question was, how do you deal with someone who demeans you and doesn't allow you to speak in any conversation because of a little age difference?
Very common issue. I think a lot of people face this at home also, that whenever I try to talk, I get these queries that whenever I go to talk to my parents and grandparents and they brush off by saying that these things are not real and they kind of demean you that तुम्हारी जनरेशन ने ये नई नई चीजें बना ली हैं, ये पहले हमारे टाइम में तो नहीं होता था. As I said, a lot of things will not change by doing this. Nobody of us has a magic wand, but what we surely can do is that just start subtly. If you are not in treatment right away, if you don't feel that you need help, if you're just talking about for the sake of creating awareness, introduce these topics little by little in your family, and it's better to involve people of your age first so that you are more in number. But majority banane wali baat hai starting mein. A lot of your youngsters, if your cousins, friends, if you can get together and just talk about these issues, then it would be really helpful. Then go about their parents and eventually grandparents. But again, as I said, you can't make them unlearn things that they have learned in 50 years by you are 20-year-old something and telling them something for 5 minutes. That's even if, just imagine it in the same way. If a 5-year-old comes to you and says things and you'll be like, oh, you don't know anything, you're such a stupid child. Normal response that you feel I'm older and I'm wiser. So imagine how much they have fixed notions and believe when they're 50, 60 years old. But basic things, I would say, if you are privileged enough and a major, that is a person who's 18 years and above, and if you really feel something somewhere is wrong, your pocket allows, please seek professional help. Due to COVID, a lot of doctors are on telehealth and you can consult them at the comfort of your home. And many doctors, including myself, are providing it at a very, very reasonable rate with the medication and therapy both. Have a look out on such thing if you are in need for help. if you are an adult, we don't need consent from any other member in your family to start your treatment. But just for the awareness sake, I would say go little by little. Start talking about something that are very basic like anxiety, which they are hearing in news also. And have you seen them grimacing, like making such faces when they hear about such things in the news, that पता नहीं क्या क्या दिखाते रहते हैं आजकल टीवी पे. सब बच्चों का दिमाग खराब कर दिया इन्होंने ऐसी ऐसी चीजें सिखा सिखा के. So yes, it is going to take time, but then again, to change the whole world is somewhere not on your shoulders. You can change one person, and that is you yourself. That's why I said be more accepting also, not just more giving. That if anybody else is coming to you with complaint, you also have to be more accepting. You just can't expect that I'll just tell all my complaints and the other person just understands. Little by little, it's baby steps, one step at a time. Start by introducing lighter topics, start by talking about very basic things around the household, like mom's cooking, why are you ordering her? Very small but very yet very powerful conversation. That उठ के अपनी प्लेट लगा सकते हो यार, इतना वो कोई बड़ा काम नहीं है. एक ग्लास पानी का आप ले सकते हैं. वो थोड़ा एक पेट्रियार्कल सिस्टम थोड़ा थोड़ा चेंज करने में टाइम लगेगा, बट ईच एंड एवरीथिंग. Imagine if our parents change a lot of things that our grandparents did. Imagine if we change the narrative forward, we are building a more better, safer, happier future for the next generation.
Changing the narrative at this point in time is the need of the hour. Since our audience is a bunch of young psychology enthusiasts, a lot of us have this question on self-care tips. So we all, find ourselves in situations where we are usually overwhelmed with, it can be academic related stress, or it can be something within our personal lives. So we always need to find ways in which we can take care of ourselves. And a lot of them were wondering if you had something to share on the same.
I'll just take both of these questions together, one of them in the comment section also. That seeing negative news affects our mind, and does it create anxiety? So yes, with the younger generation, I understand you guys are not going to colleges. You have the study from home kind of situation, and you feel that every day you are just stuck at home and there's nothing to do, nowhere to go. And this constant fear of in the mind that what will happen? What if my exams get cancelled? What if I don't get a job? What if I don't complete my training? So yes, there is a lot of anticipatory anxiety that is happening about how, when, where, what that is happening in your minds right now. Believe me, it's somewhere normal to feel such kind of emotions. In the past 1.5 months, because of being frontline in the COVID, I have experienced same things every day, and it's absolutely fine to experience them at this time. That's why what I said is sadness, anxiety, happiness, these are normal emotions. You will feel them at one point or another. But if they are persisting beyond one particular point, you need to seek the right treatment at the right time. Moreover, our basis for this pandemic is survival, not excelling. Just survive the pandemic. If people you have not gone out, you will not realize that if at this time you have a roof over your head, you have food to eat, and you have all the members in your family, how privileged and lucky you are. This is such a big deal right now. Might be like sabke saath hota hai. Believe me, when you go out after this pandemic, you will realize sabke paas ye sab kuch nahi hota. Even a very, very well-to-do people lost a lot of things in this pandemic. Somewhere or others, do some grounding techniques, which I'm sure a lot of psychology students are already aware with. Journaling is very, very basic technique that I advise to a lot of people. If you're comfortable with that, do start journaling. It's for yourself also, not just for your clients and patients. Whenever you get time, seek some kind of soothing activities for yourself. And yes, psychology is a very, very booming branch, and is 100% going to pay well, both economically and satisfactory level also in future, because unfortunately we are going to see a lot of mental health issues, and we need a good army of good well-trained psychologists to deal with that.
That we are at the end of our question and answer session. I'm sure you had a very busy schedule, and the fact that you were able to still put in 45 minutes of your time with us, explaining to us, debunking our own misconceptions about mental health as budding mental health professionals. I think it was something that was a very, very important task that you undertook. And I'm very grateful for your effort and your kind work that you've been doing in the field. Thank you so much.
Thank you. Thank you so much for having me. I always say I learn so much from each and everybody I meet every day. Even your patients teach you, even you do these live videos, you always learn something. And it warms my heart every day to see young girls, young professionals like you working on this cause, because every day go back yourself and see, was I that aware at that age? You will get this answer, no. Even for girls like you, when you are at 10, 21, you talk to a 15-year-old and you will feel, my God, she's so aware, I'm not. So that is not something to be worried about. That makes me so happy that people are so aware these days. And hopefully we can take this awareness forward. A 5-year-old, 6-year-old, we are trying to do that. We are trying to teach them boundaries. We are trying to teach them how to say no. So from here, just make things forward.
Yes, ma'am. And as a token of our love and appreciation, I'd like the tech team to present to you with an e-certificate at this point. Thank you so much, ma'am.
Thank you so much. Okay, take care, everybody. Stay home, stay safe, and get vaccinated. Thank you. Bye-bye.
Thank you so much, ma'am. Bye-bye. With that, I'd like to call Sanya to introduce to us our next speaker.
Good evening, everyone. It is my privilege to invite our next speaker, Dr. Deepti Puranik. Dr. Deepti Puranik has a PhD from the University of Mumbai. She is the assistant professor at Amity Institute of Behavioral Science, Mumbai. Dr. Deepti is also the founder of Lighthouse Psychological Consultancy. She is an associate member of the British and European Polygraph Association and has a total of 27 research papers to credit, which have been published and presented at national and international conferences. She has reported more than 1,000 cases related to forensic psychological evaluation and has stood as an expert witness in the court of law. Deepti ma'am has a total of 18 years of experience in the field of forensic psychology. Welcome, ma'am. I'd request you to share your valuable knowledge about the field of forensic as well as psychology with all of us here.
Okay. Thank you so much. Am I audible?
Yes, ma'am. Yes, ma'am.
Okay. So great to see you all today on this session on forensic psychology. I know forensic psychology has been somewhere a very exciting field, or also a field wherein you are very curious about what exactly happens, or what is it that is done by a psychologist for the criminal investigation. Now, to begin with, before I move to today's session, which is purely on forensic psychology, but what is important over here is also to understand the link between psychology and the forensic sciences, because as a forensic psychologist, our work is not just to deal with the behavioral aspect or the psychological aspects pertaining to the law, but also pertaining to forensic sciences in general. So what I will be covering, obviously, I will be covering different aspects pertaining to maybe forensic sciences a bit. Then also, what are the various roles that a psychologist plays in the entire investigation process, as well as later on when the case is in the court for maybe for the evidential purpose or for any other purpose. So to begin with, when we talk about forensic sciences, what happens is forensics originated from the Latin word forensis, which meant deliberations in the open court. So whenever any application of physical or social sciences is to provide scientific evidence to the court of law, that would come under the purview of forensic science. So if we talk about India, we normally say the burden of proof is on the prosecution. So why the burden of proof is on prosecution? Because it is the responsibility of the government or the prosecution to prove that the person who has been arrested has committed this offense. So there are different types of evidences. There could be direct evidences, there could be indirect evidences, there could be circumstantial evidences, or there could be corroborative evidences. Evidences also could be in form of physical material. However, what is important for us is the evidence that we gather through the human beings or the virtual mode, because when we talk about human beings, that is where our psychological aspects would come into picture. So when we look at the Indian codes or what are the laws pertaining to it, so forensic psychologist opinion or forensic experts opinion are admissible under the section 45 of the Indian Evidence Act, and also section 293, which states that any scientific report by the government scientific expert may be considered as a evidence, and he or she may be summoned only if the court wants it to be summoned. Now, taking it a bit ahead, when we look at forensic sciences, we always look at lab, and probably all of y'all must have seen it, especially on Sony TV, either through CID, which ran for almost 16 years, wherein Dr. Salumke was the best known forensic scientist, and he has been performing a lot of experiments and how they are able to, find out who's the perpetrator using forensic sciences. Obviously, what we see on the television is going to be very different from what we really do in forensic labs. But yes, few things that we can learn is that scientific evidence, forensic sciences would help the scientific evidence to be linked to the actual incident that may have occurred, which is a crime. It can also help us to link the crime with the particular offender. It would help us to fix up a offense place. Where did the offense happened, or whether the offense place was different, and whether the body which has been found is in a different place. It would also give us some directions to understand what would be the motivation behind the crime that has happened. It would also help us to establish the fact which we can present to the court, and the evidence cannot be denied. So when we look at forensic science, we say that it is not time related because we have an authentic scientific tool in the hands of law enforcement agencies and the honorable judges, which can use it to take right decisions, or it helps us in the decision making. At the same time, forensic sciences can also give clue to crimes which may have happened years ago. So some crimes which may have occurred years ago, maybe around 10 years, 15 years ago, could also can be solved using the forensic sciences techniques. So now what happens, or what are the various fields of forensic sciences? We have forensic chemistry, DNA fingerprinting, toxicology, physics, cybercrime, speaker identification, video authentication, biology, anthropology. So there are ample fields of forensic science. And when we look at the forensic psychology, what do we understand would be how are our mental functions and our behaviors, but in relation to the crime that has been taking place. So when we say that forensic psychology, it is an application of our psychological principles to the criminal justice system. So it can be used in various forms. For example, we may use it to, for malingering, or we may use it on field for investigation purpose, or it can also be used in civil arena. Now, what we have to understand is what is the difference in forensic psychology and the various other fields of psychology. So, um, forensic psychology, in fact, a lot of the theories that you may learn in it are somewhere related to the other theories that we learn in psychology. But whenever we apply these principles specifically for the purpose of crime and to help the legal team or the law enforcement agencies, that is when it would come under the purview of forensic psychology. For example, counseling is something that you may have learned, or we hear a lot about counseling, and we do it in our regular practice as well. However, when a case happens and as a psychologist you are working along with a attorney, or maybe the court has assigned a case to you, and after counseling you are to submit your report to the court, that area would then come under the purview of forensic psychology. So in forensic psychology we always say that it is a very unique area in forensic sciences. Why? When we look at forensic sciences, every time what we are dealing with is physical evidence. अरे blood samples मिला क्या, वहाँ पे खून के धब्बे है, fingerprints है क्या. But when we look at forensic psychology, that is the only field in forensic sciences which is directly dealing with human beings, because what happens for such a long time, or for years, since years we have been depending a lot on physical evidences, wherein the crime ultimately takes place from the brain of the perpetrator. So that is where our psychological investigations come into picture, because it has been, in fact, we would say a neglected variable for long time, but it is one unique variable that can give us information directly from the person who may have committed an offense, and not from any kind of a physical evidence. So this branch, specifically forensic psychology, attempts to understand the human behavior which is related to the legal system, as well as it has application in criminal cases as well as also in civil law. So as a forensic psychologist, what we need to be aware of is not just about the psychological principles, but also about the certain laws that are pertaining to the specific jurisdiction. Now, this was in brief about forensic psychology. Now, going ahead, suppose, okay, what are the various roles that would be played by a forensic psychologist? Suppose a crime takes place, okay, you can just think about a room. A room is there and you see a body which is lying there. There are lots of blood which is oozing out of the body. You can see various injuries marks, and you can see the entire room bikhra pada hai. So this is the kind of situation that probably you are seeing. Or in other contexts, there may be another kind of an event wherein you have seen that a body has fallen from 27th floor of a skyscraper. Now, you don't know whether the person was being pushed, whether the person jumped off, or whether it was just an accident. So now why I gave you this situation is to look at the different aspects pertaining to this crime. If we look at the first situation, which was about the room where you are seeing different injuries, one thing is certain, that someone else's presence is very clear. While when we look at the other situation, wherein the person has fallen from the 27th floor, we don't know exactly what may have happened. So when we talk about crime generally involves two things. One, property versus body crime, or it could also be a combination of two. For example, body crimes means there is an individual who is involved. While when we talk about the property crimes could be something wherein there is basically a place which is involved, or also some kind of valuables that may be involved in a particular crime. So now this is where we would try to assess whether the crime that has happened, or the incident, rather than talking it in terms of crime, let's take it as an incident, whether this incident is a crime or whether this incident is not a crime. Again, that can also be understood or can be studied by a psychologist who, along with the investigating officers, can give various throw different light on the entire situation. So what is one, if we are taking about the other kind of the situation, suppose we take this case about, you know, the person who has fallen from the 27th floor. Okay, now we don't know whether it's an accident, whether it is a suicide, or whether it's a murder. Okay, or a homicide. We are not sure about what exactly it is. So then what do we do? So as a psychologist, what I would perform at that particular time is a psychological autopsy. So a psychological autopsy is a behavioral, scientific, impartial investigation of the psychological aspects of a particular death. So you have all, you may have all heard about what is autopsy. Okay, autopsy postmortem तो करते हैं, hospital में ले जाके चीरफाड़ करते हैं, and then we get to know what may have happened in that particular way. Now, what is psychological autopsy is where we are now trying to understand or get into the person's various aspects, for example, their behavioral aspects, psychological aspects, that possibly could be the reasons for the person's death. And it would basically, what we would over here conduct would be various kinds of interviews, or we may analyze various personal documents like suicide notes, diaries, journals, or even other material including FIR reports or PM reports. So overall we are looking at it in a very holistic manner, and we are trying to analyze each and every aspect that could be related to the death of the person. So here, why psychological autopsy? Because now we are trying to understand the psychological aspects, or we are trying to describe the psychological aspects of the person after his death. So this particular concept, okay, is a very important technique, we say, wherein you know, very important in terms of it's a kind of report which would be developed after the person's death, and usually wherein, you know, it is suspicious death, and so we are able to, using these techniques, throw light on what could be the reasons or what could be the various um, circumstances that have led to this date. Or when the mode of death is clear, or we would say unequivocal, okay, then the autopsy, psychological autopsy, may help us to understand the factors that may have led to a particular act. For example, if we are clear that it is a suicide, what we are going to try and understand is that what were the reasons for this person's death, or why did the person commit suicide. While in other cases, when the reasons for death still remain suspicious, we may try there are lots of puzzles that have come into picture. So what we would try to do is we would try to reconstruct the motivations or the psychodynamics or the existential crisis of the individual. So here what we would do is we would either go for a suicide psychological autopsy, wherein we are clear that the event or the person has committed suicide. Then we would try to identify what were the psychosocial factors that may have contributed to suicide, and when it is when the reasons are not very clear, we will try to interview or study, analyze the data, and give some clarity to the investigating agencies that whether it is possible that it was a suicide, or was the person, has the person purposely, or is it a homicide, or whether there is a possibility that it could be clearly an accidental death. Now, suppose this is one aspect wherein, you know, we are working on the crime scene, and uh, we have used psychological autopsy. Now, suppose it is like I gave you a first situation wherein it is clearly a murder. Now, what do we do over here? So, as a forensic psychologist, we would be working, or what we can perform is the criminal profiling. Okay, so criminal profiling can be also called as offender profiling, or we have geographical profiling, or we could also call it as behavioral evidence analysis. These are various different terminologies which are used for the process of criminal profiling. And maybe if you have seen Mindhunters have given a web series which is there on Netflix. So it has given, how the entire process of criminal profiling started. So now somewhere we move from inductive profiling, or maybe we will go from deductive profiling. So we start from, general, wherein what is assumed that probably all criminals may share some common traits. So, if I have a crime scene in front of me, I see a crime, I observe a crime, and on the basis of this particular crime, I can say that this crime could be a cause, or someone like a psychopath may have committed this murder. Now, how did I came to the conclusion that it is a work of a psychopath? So that's where, we would have used different kinds of techniques like inductive profiling or deductive profiling. So to give an example, few years ago, probably you may have seen cases of serial killing cases. So now how do we come to a conclusion that it is a work of the one person? Because here what you are trying to analyze is the behavioral aspects of the crime. So every crime that happens, okay, lives behind certain behavioral traits, and as a psychologist what we are identifying are these behavioral traits. For example, what would have been the actions, motor actions that would have been performed by this offender, and these kind of actions are studied to pick up or to understand the link between all these different crimes. So we say that the person may have left behind a signature, okay, or a signature would be something that whenever I commit an offense, just like rather than offense, I have a form to fill, a bank form that I am trying to fill. Whenever I fill in my information, after I fill in my information, I sign on it, which means that I am kind of owning that it is me who has given all this information. So somewhere take the responsibility for the filling up of the form. So similarly, when we apply the signature for a crime scene, what we can over here understand is that the offender is trying to own his act. So whenever they commit an act, they are leaving behind their signatures to say that this has been done by me. I have done it. So, catch me if you can. And that's where, we have to try and analyze these various signatures. Another important aspect in criminal profiling would be to understand what could be the modus operandi. That is, what is the mode of operation of a particular offender. So again, that is something that we try to study. Also, many a times in especially on serial killings and all, we see that whenever a person commits an offense, they also want to take something away from the crime scene. So that's what would be called as a trophy. And the person probably there was one serial killer, very famous serial killer. He used to take a part of the person's body with him. So this is the kind of behavior that the offender would have been showing, gives us an indication into his maps in his brain, or what could be the thought process, what kind of satisfaction is the person getting after committing these acts. So there are various aspects again that we would try we try to analyze using criminal profiling. So sometimes we may compare one particular crime and try to compare it with the other crimes of similar nature, or sometimes we may take it or study a crime as a unique crime in itself, and that's how we can start working on it. So obviously there are various methods, there are many processes that are involved, but in short, if we look at criminal profiling, a very interesting field, and also somewhere wherein the psychologist works very closely with the investigating officers and to reach the offender. And apart from that, there are also various important aspects that a psychologist or an investigative psychologist would highlight in terms of what would be the progress in the investigation, in terms of what are the important aspects of a crime scene that can be highlighted. You would also have a list of suspects. It's not that we may only have one person, okay? It's not that every case is the case of a serial killing. So individually also criminal profiling can be applied to individual cases as well. So then in those cases I have around 4 to 5 suspects. So now what would I have created a profile, and I am trying to match the likely characteristics of the offender, so that I am able to somewhere figure out whether amongst the suspects that I have, who could be the actual suspect. So then accordingly, we would also create a list that prioritizing the suspects, okay, which suspects could be taken or interviewed first, which suspects can be interviewed later. We would also try to look for or assess the offender's location, or what are the different locations in which crimes takes place. How is the location also somewhere closely related to the individual who may have committed the offense. Apart from that, we also very closely study the victimology or the victim characteristics in terms of what is it that the victim may have done, or why was this victim chosen to be the victim. I mean, what are the reasons why the person is a victim. So now that itself can again help us to reach to the perpetrator. So in terms of whether the person is known to the victim or unknown to the victim, whether the victim was a higher risk victim or a lower risk victim. So there are various aspects that we would study. Now after that, suppose I have done the psychological autopsy, I have done criminal profiling, and now I have my suspects ready who are brought for investigation. So now there are various aspects where what we talk it in terms of there would be various techniques that, or we say modern scientific tools of investigations that we may use. But before we move to that, we will directly start with the interviewing process. Now, psychological interviewing techniques are very important, especially investigative psychologists who works with witnesses or victims try to use, or interviewing is a very good tool to extract information from the person. So in UK especially, they have a peace approach, which is best considered to be the best practice in UK. For interviewing purpose, we also have cognitive interview, which is most commonly used, especially when we have to interview a witness or a subject. So these are the interviews that we start with. Now talking about it in Indian perspective, okay, so we have various techniques. Suppose the person has been brought to a forensic lab. Now we can do psychological profiling, we do polygraph, which is also commonly known as lie detector, or we may do brain signature, brain electrical oscillation signature profiling, or narco analysis. Now, what is the process? I'll explain you all in short when the cases are brought to the lab. Okay, so suppose a case is referred to the lab. So it's a psychological evaluation process begins. So that's where we start with the interview with the investigating officer. We also, try to do the pre-test counseling, wherein you are trying to prepare the person to undergo the kind of test. You would provide them with the information pertaining to the test, And then we will move on to conduct the psychological profiling. So what is psychological profiling? It's not same as criminal profiling, okay? Psychological profiling is where we are doing it or dealing it directly with the person who's sitting in front of us. So wherein we are doing a holistic study of the person and his psychosocial background. So wherein we may use personal history interviews. So we have, how we collect history or family history. So this is again an in-depth history, a historical interview wherein we are trying to understand the background that the person may be coming, or what are the kind of personality traits. We may also conduct a mini mental status examination or use different kinds of psychological assessments tools, and also interview, but to get an understanding of what is the background that the person is coming from. Now, after we have done this, we in a way, we are not over here using any kind of, we are basically trying to assess whether the person is fit to undergo any kind of technique. So once this process is followed, we also interview the person in terms of the actual crime that has taken place, or what are the questions that the investigating officers may have asked us. And then we would take the person for, suppose, a technique like a polygraph. Now, what exactly is polygraph? Polygraph is basically what we talk is in terms of, it is a psychophysiological tool for investigation. So poly means many, and graph is the diagrammatic representation of the data. So basically what here we are measuring could be in changes in terms of, physiological responses, like we have blood pressure, we measure respiration, upper and lower. We also look for, sweat or electrodermal activity. Now, polygraph tests are also used for, credibility, and they are mainly psychophysical in nature. Now, what happens, okay? In fact, since years, okay, or we would say, everyone wants to know, right from our parents to maybe even law or to society, everyone wants to find out whether or how good or how truthful or how honest we are or dishonest. So if we look at it, years ago, there were various techniques that were used. But obviously, for example, ordeal by fire, or we used to, there are other techniques as well, or you may have also learned in different stories like Akbar Birbal stories. Maybe you may have seen how Birbal used to use these various situations or give situations and try to find out who is the person who's lying or who may have committed an offense. So it was assumed that when a person commits a crime, they feel guilty about the act that they have performed. And because they feel guilty, there would be physiological changes that occurs in their body, and that is the reason why they may have been, that's where the changes are seen in the physiology. But if we try to apply it to the current situation, wherein most of the crimes that we see are planned crimes, okay, wherein you see that there are all these actions were planned and the person does not feel guilty for what they have done. So then how do you probably use a polygraph in such situation? So that's where we have to understand the brain mechanisms related to it. So what happens is, in our brain there are various parts of our brains which are related or which exercise control for the decision making and other aspects. In fact, in neuropsychology, that's what we learn a lot. So one important part is the anterior cingulate cortex, which exerts a supervisory control for our actions. How does it do? It looks for advantages and disadvantages, and that helps us resolve conflicts by choosing the best option available in this situation. So what happens is physiological changes would take place when the person is caught in a conflict. Do I need to tell the truth? or should I escape from this situation? And that's where the response conflict would take place. And this is what we are trying to find out through the polygraph. Now, polygraph is not just, we are measuring their physiological, but what is very important is also the kind of questioning techniques that we used. Okay. And we use different kinds of questioning techniques, like we have comparison question technique or concealed information test, peak of tension test, directed light test, guilt knowledge test. Now, which test or which technique should be used for the purpose of evaluation would depend on the kind of crime that has been committed and how we need to best get the results from this situation. So there would be various, obviously, when I'm talking about polygraph, there are lots of these technical aspects also that we have to, look for. We conduct minimum of 3 trials. We don't just look at the physiological changes and measures and say that the person is lying or being truthful, but obviously there are lots of statistical analysis which are also performed before making a decision about whether the person may be lying or whether the person is being truthful. Okay. Now, suppose we look at outcomes. So when we look at the strength, it's a non-invasive technique in terms of we are not injecting anything inside the body of the person. Rather, we are only attaching various parameters over the person's body, and so in no way it is harmful to the person. It is a very good screening tool, but it will also have its own limitations also. Like there are various questions pertaining to its reliability, but that's where we use inter-rater reliability and all to make the report more accurate, and various things have to be taken care of, especially when we are conducting these kinds of tests. Now, this was one test. Another test that we have been using is what we called as brain electrical oscillation signature profiling, or rather we call it as brain signature profiling, or BOS in short. So that is a scientific technique that analyzes the electrical activation related to the presence of our memories, or memories which we acquire when we participate in a crime. For example, okay, if we are talking about different aspects, there are two things that you have to remember. One is, you may have learned, in fact, in cognitive psychology about episodic and semantic memory. So similarly, when we talk about BOS, BOS is in fact, the theoretical model for BOS is on the Mandler's dual process memory model, okay, which was given, which had highlighted the two aspects. One, what we call as conceptual knowledge. When we say conceptual knowledge, this kind of a knowledge we may have acquired by reading or maybe watching news. While when we say experiential knowledge, you will get an experiential knowledge only when you participate in it. However, just think about a situation, okay? For example, it will be very difficult for y'all to tell me what did y'all have for dinner on 1st February 2018. Okay. However, maybe one or two of y'all may still be able to remember it, provided it could have been your birthday or some significant event in your life. So what here we are trying to, what I'm trying to say is that whenever we talk about experience, we get an experience when we willfully participate in that event. Okay, and there would be actions, there would be emotions. All these aspects are very important when we are trying to understand BOS. For example, when a person commits crime, it's not like having a cup of tea. Rather, the crime, okay, whenever a person will commit a crime, he is not going to be able to easily forget the crime he has committed. So what over here we are doing is, we are trying to refresh the person's memory, use a tool. So in BIOS, what we are using is EEG. Okay, so there are two rooms. One is the subject room, wherein the person has to sit with a electrode cap. There would be various electrodes on the person's brain, and then we have done criminal profiling also. So what here we do mainly is reconstruct the actual crime scene. So after we reconstruct the crime scene, we would feed it into the system, so how the crime has actually happened, and then the person only has to sit and listen to the various probes. Here we don't ask questions, rather we present to them the probes in a auditory manner. Probes are small statements of the actions that may have occurred during the commitment of a crime. For example, we have seen the body which was lying. Okay, you have seen various injuries. So you have studied the house. So you actually reconstruct the crime, that how this crime may have happened, what may have happened, what could have been the different actions that would have been performed, and in that manner you will create smaller probes which would be then presented to the person. So what happens, just as if I ask you all to you know uh, remember your first day of college, automatically your college image and everything would come in front of your eyes, or you'll start visualizing. How did that come in front of you? Because you have been there. Okay, now if I ask you all to describe your first day of college, you will be able to give minute details about it. Why? Because it has significance to you. So in that similar manner, when the probes, maybe around 100 200 probes about a crime, are going to be presented to the individual, the person would automatically remember his participation, and then the part of brain which is related to remembrance, that is the anterior cingulate cortex, will get activated. However, if a person is an innocent, they did not have any kind of experience of participating in a crime, so then in that case, what will they remember? They will only remember something that they may have read about it. So then what happens is there will still be activation. However, there is a different part of the brain, which is dorsolateral prefrontal cortex, which may get activated when you remember information. So that's where what we have to understand is the difference in information and the difference in the experience, actual participation. So technically, obviously, it is very in depth, but this was just in short I was trying to give you all. Then third kind of technique that you may have commonly heard could be about the narcoanalysis. Then narcoanalysis is yet another technique, but narcoanalysis has always been in controversy. Rather because polygraph and BIOS have been non-invasive. However, narcoanalysis is an invasive technique wherein a drug would be injected in the person's body, and then the person would be taken to a semi-conscious state, uh, wherein there would be an interview taken pertaining to his suspicion about the crime. So whether he has done it or whether he has not, we will try to extract more information. So what you have to understand is polygraph is to be used for lie detection purpose. We use BIOS to figure out whether the person has an experience of committing the crime. And when you want to gather more information about the crime, you would use narcoanalysis. Now, narcoanalysis, obviously, we don't conduct it anywhere, but it has to be conducted in an operation theater only. It's an entire team of people who work, so a forensic psychologist, a psychiatrist, anesthetist, general physician and cardiologist would be there in the hospital, so in case of emergency, but supportive staff, everyone would be there together. And once the anesthetist has injected the dose very slowly intravenously, after that the forensic psychologist would get into the interviewing mode. Now obviously that's the reason when I say it's an invasive technique, it has lot of the ethical issues and also ample of aspects. But then why do we conduct it? We conduct it only when we have a court order. So a court has ordered you to conduct this test, only then you will conduct narco-analysis. Secondly, you have to be very careful when you are conducting narco-analysis. So the person, informed consent in fact will be taken in all the three cases, but the person's lawyer and all also can be present when the test has been conducted. So the lawyer can be present from one-way mirror. They can just see how the test has been conducted. And there are ethical guidelines which have been given by Supreme Court in 2010, and before that by National Human Rights Commission for psychological techniques to be used with accused. So these are the ethical guidelines that we have to strictly adhere to whenever we are conducting any kind of techniques. Now, apart from that, we have latest new techniques are, we have forensic statement analysis. We also have layered voice analysis. We have fMRI based lie detection. So there are various new techniques which are also coming in. Now, these are basically used for the investigation purpose. Okay. So suppose now we have used various investigative tools, and we have identified the person. We could gather evidence from psychological autopsy, criminal profiling, interviewing, investigative psychological techniques, and now we have caught the perpetrator. Now they are presented to the court. Okay, now not so much here, but especially in US and all, they still follow the jury system. So especially when we are talking about jury system, so again, that is a very important area where psychologist works along with the attorneys to select the jury members. So they may use there are traditional jury selection methods as well as scientific jury selection methods. So a forensic psychologist will try to assess or the jury and the attitudes, the beliefs they have, whether they are being biased towards the offender, because as a jury you have to be completely impartial. So that is again a very important area that a psychologist performs. Now you have a jury, suppose. Okay, now when the court a person is taken to the court, and now the trial begins. Okay, as a psychologist there are various other areas of also services that you would perform, especially after the beginning of a trial. For example, or even in investigation, one area which I forgot to highlight is about eyewitness testimony. So as a psychologist you would also help the investigating agencies to get the best accurate testimony from an eyewitness, because there have been work by various cognitive psychologists like Elizabeth Loftus or by Hugo Munsterberg, who had highlighted what are the issues with eyewitnesses statements. And so as a psychologist we work a lot to get the best testimony from an eyewitness. So again, we would be presenting in the investigation as well as during the court. Now, apart from that, there are other areas, specific areas which come specifically in clinical forensics. Okay, like criminal responsibility. So to assess whether the person, when the person committed a crime, was the person or is the person capable to assume responsibility for his or her actions. Okay, or whether the person who has committed an offense has any kind of a suffering from any kind of a psychological disorder. So again, that would be the area wherein you would there are various tests which you would use to figure out whether the person is capable of taking the responsibility. You'll also try psychologists also play a very important role in competency to stand trial, wherein we try to assess an individual's capacity to understand the legal proceedings. Or you may have seen in movies and all ki judge ask the person ki क्या तुम्हें पता है क्या क्या होने वाला है, मतलब ये ट्रायल के वक्त what how अगर तुम हाँ बोलते हो तो उसके repercussions क्या होंगे. So there are these kinds of things that have to be explained. So as a psychologist you would assess the individual's capacity to understand the legal proceedings. Then apart you would also look at malingering, that is whether the person is faking any kind of a mental disorder. Okay, there was a very famous movie few years back, Divangi, which had Ajay Devgan, Akshay Khanna, and Urmila Matondkar, if I'm not mistaken. But basically, wherein they had highlighted how a person was malingering. In fact, recently, if I'm not mistaken, even there was a series of um, breathe into the shadows, wherein at the start they have shown where during the entry of Abhishek Bachchan, wherein as a psychiatrist he says that the person does not have any kind of a psychological disorder, rather they are faking it. So this is again a very important role that would be various assessments and all, which would be done by the forensic psychologist, clinical forensic psychologist. And there are other areas. I mean, if I go on talking, I can talk about it for almost like 2-3 hours. Wherein there are so many areas, like we also have social issues on litigation, or forensic psychologist also plays lot of important roles when it comes to guardianship, or whether a person, okay, especially when we are talking about human trafficking and all, and a minor child has been rescued, so can the child be handed over again to the parents, or whether the parents themselves had forced the child into this kind of a situation, so whether there is any kind of a immediate danger if the child is sent back to. Then we would also look at risk assessment, also domestic violence. There are various areas, especially if we look at forensic psychology. It's a very vast field. And you know uh, so obviously, I mean, I'll now try to, because otherwise I'll keep on going, and so I'll try to stop over here. But this is basically in short about what is the kind of work that is being done by forensic psychologists throughout. So depends on how the court highlights, or in courts they would assign you a specific job, so then you are supposed to perform whatever you have been instructed by the court. Otherwise it may also be considered as contempt to court. Now talking about so this was in brief, I would say, obviously not in detail, but in brief about what is the work done by a forensic psychologist in India as well as abroad. I'll just take 1 minute last. There are various courses which have been, in fact, in India also, various universities are have started diploma courses or degrees also in forensic psychology. For example, National Forensic Science University have a course in, they have masters, MSc in forensic science, and also MPhil. Even there is Raksha Shakti University, which has MA criminology, and there are various other institutes also who give it as an elective. Okay, so it may not be complete specialization, but also as an elective it is offered to these students. And ultimately, like I said, forensic psychology has developed from all the other fields of psychology. So you have to look at it in the holistic perspective, and that's where I would like to stop.
Thank you so much, ma'am. We have a few questions if you're willing to answer.
Sure.
Yeah. Okay. So one question is, between forensic psychology, criminal psychology, and law psychology, what is the difference, and how are they related with criminal investigations?
See, there are lots of times when there is a overlap. However, there are many a times when we have to understand the difference. Like I said, criminal psychology would be wherein we would more try to understand the psychosocial causes of a criminal behavior, or what could have been the reasons why the person has committed an offense. So we look at the various social, for example, we learn social learning theory and you apply it for the criminal behavior. Okay, so all, or even rehabilitation. So we would look at all these parts in criminal psychology. However, like I said, whenever a court, okay, as a psychologist you have to stand in the court of law as an expert witness for the work you have done, and you have to submit that report in the court. You also would be questioned by the prosecution as well as by the defense, and in a way you have to prove that you are an expert witness. Okay, so you're not a witness, but you are an expert witness, and you are helping courts to make the decision about the person. So that's where all those would come directly, where it has a direct legal implication, it would come under the forensics.
Right. Okay, ma'am. The next question is criminal psychology inclined more towards desk work or practical involvement with the crime?
It's more obviously practical involvement with the crime. I mean, desk work. I would say desk work is also equally important, because whenever we do any kind of work, we also have to document it properly. Only when I would document it would I be able to submit these documents in the court whenever I have been, asked for. So it's both, but obviously it's more of the work that you do on field and not into sitting in a room and doing a work. We have to go a lot of times on field when we are working.
Right. So Vrinda asks how cultural differences makes an impact in forensic investigation, as this subject was started in US and a lot of research is done in western part of the world.
But that's what, like the theories, if we try and understand, we also try to compare it, or we try to apply it in the Indian context. So same theory, for example, if we take malingering, okay, if you're taking malingering as an area, though a lot of work has been done in US or in UK to find out whether the person has is faking about a psychological disorder, but you would still use different, maybe not the same test, but the tests which are suitable for the Indian population. So the reliability, validity of those tests would have been already established, and those tests you would again use for assessing whether the person is malingering. So now you are using MCMI. Suppose you are using MCMI. MCMI again has been used in US, but also we have an Indian adaptation of it. So you would, that's where the choice has to be, you have to be very careful about the assessment tools that you use, and that's what you learn through the training that you gain and the supervision.
Right. Okay. So the last question is to how much extent is polygraph test reliable, since the bodily reaction increases in breathing and sweating? Could it be also a result of anxiousness? So how reliable is polygraphy test?
See, as a psychologist, okay, first of all, I have to assess my client's comfortness with the test, okay. So whenever we are taking a person for a polygraph test, we do ensure that the person is not very anxious. There is going to be some amount of anxiety, which is normal. So but if the person is too anxious about a test, then at that time we don't conduct the test. We will give them another appointment. Maybe that particular date the appointment would get cancelled, the person would be called next time, to in a more, we conduct it in the most relaxed manner, and for support, like I said, as per our court, no one is going to be convicted on the basis of a polygraph test. That's the most important part. But yes, it is more being used for the purpose of investigation, that it can be used as an aid to investigation, but provided the person has given his own consent. They are also free to have their lawyer who can be present when the test is being conducted. So when you follow all these ethical guidelines, I don't think that is so much of a problem. But obviously, if you're asking about reliability, from various research which have been done, it's around 85 to 90%. Can't hear you.
Yeah, sorry. Thank you so much, ma'am. This has been a very informative session. I'm sure whoever is interested in forensic psychology and didn't have any knowledge of it, enough knowledge, all their doubts and clarifications are done with this. I hand over to Sunya to thank ma'am and give away the certificate.
Yes, ma'am, like how Gloria shared with us, it was a very informative session. And through all your knowledge and experience, we definitely got an insight into what it looks like to be a forensic psychologist. So as a token of our love and appreciation, I would request the tech team to present to you with an e-certificate. Once again, ma'am, thank you so much for your time and for sharing with us what it looks like to be a forensic psychologist.
Thank you so much for joining us, ma'am.
Thank you so much.
With that, I would like the next MC to take over.
Good evening, ladies and gentlemen. It's my privilege to invite our next speaker, Lynn Franklin. Leaders on Rapport, Secrets to Creating Successful Connection. Her TEDx talk on how to be a mind reader went viral with over 4 million views. Our speaker is Lynn Franklin, knows what it's like to graduate with a degree in psychology and then look for a job. Lynn's first position was a counselor in home for troubled boys. One of them, a 14-year-old named Fred, threatened to kill her with a machete. Then Fred chopped the phone cord, Lynn's only lifeline, and told her if she tried to call for help, he would cut her too. 20 minutes later, after she did some fast talking and sweat through everything he had on Fred, gave her the knife. Lynn says that's the litmus test for her job. As long as no one pulls the machete on her, she is having a good day. Lynn is a leadership communication expert. She calls herself a neuroscience nerd. Lynn studies how the brain works, then shares with leaders who want to reach their goals by creating a culture of trust. She wrote, Getting Others to Do What You Want, and is working on her next book. Now, Lynn will share more ideas on how to create better connection with potential employers during next job interview. Ladies and gentlemen, let's give her a virtual round of applause in the comment box. Welcome, Lynn, and the stage is all yours. Ma'am, I kindly request you to unmute yourself.
There we go. Namaste from Chicago in the US. It is morning here, but you have spent an entire day listening to fascinating people with interesting knowledge and wisdom. And I am grateful that you decided to stay here for my session today. But because your brains are very full, let's do a combination exercise of neuroscience and silliness to bring us all together so that we can get as much as we can out of our time together. So to do that, what I will ask you to do, it's participation. So I will ask you on the count of 3 to push down the space bar on your computer, which will unmute you. And then together we will go. Okay, so 3, 2, 1, space bar, go. Do it. Do it again. Wonderful. Finger off space bar. Okay. The technical term for this is a state change. And if you would like to know what that means, then type state change in the chat, and sometime before our program is over, I will explain why this works. So now let's dive right in. I remember well being in the position that you're in. I had just finished getting my degrees in psychology and English, and I needed to interview for a job. And this is where I started to work, St. Joseph's Home for Children, which is the story you just heard about Fred and the giant knife. What I wish I had known then is all of the things I know now about how to interview for a job and to say the right things that increase the chances that I would get hired. The good news for you is that for the last 28 years, I've had my own communication practice, which means that every day I talk to people about getting work and the things that I have learned that have allowed me to be in business all these many years, I'm about to share with you. Here's how today will look. We're going to talk about 3 things specifically: how to write down your goals and the importance of this from a psychology and a neuroscience perspective, how to create the messages you're going to share during an interview, and then how to tell useful stories. And frankly, if we have some extra time, I'll have a few bonuses for you as well. But let's begin. Write your goals. This is the first thing you will do to prepare for any interview. And you write goals down longhand for a reason. It engages your right brain, which is your creative side. It engages your left brain. Your creative side is engaged because you're literally writing things down. You're moving your hand across a piece of paper. Your left brain is engaged because you're using words. So you have both sides of your brain working with you. The other thing is that you're using your conscious and your subconscious mind. Your conscious mind can remember somewhere between 10 to 50 bits of information. Your subconscious mind can process 14 million bits of information per second. So for example, right now, your subconscious mind knows how your behind feels in your chair. So how many of you are now thinking about how your behind feels in the chair? Right. Your subconscious mind knew this before, but your conscious mind told it it was important. So it started bubbling it up. This is what happens when you write a goal. Your conscious mind tells your subconscious mind what it wants. And then it makes all of these connections with all of this information that you have and lets things come up to help you. Here's the important thing to know about your subconscious mind, however. It cannot tell the difference between a positive message and a negative message. Meaning that if you say to yourself, oh, they're never going to hire me, guess what? Your subconscious mind will hear, never going to hire me, and it will find ways for you to mess up the interview. So always feed your subconscious mind positive messages. The message that, yes, indeed, this is a job I want and I will get it. So this is the power of goals in your brain. And when you write your goals, let's move me over here. The acronym for this is SMART goals. You want your goals to be specific, measurable, attainable, relevant, and timely. Specific. So you know you're going to have a half an hour of time to speak with this person on a particular day. Measurable. You want to make sure that you set goals that you'll know whether or not you've reached them. Attainable, meaning that you want to be able to make that happen in the amount of time. So for example, an unattainable goal might be that they offer you the job on the spot. Don't set a goal that you know you can't reach, because that means it disincents you. It means that you will give up because you know it's not possible. Relevant, meaning that it's important for what it is that you want to achieve. You could have a goal of wearing, having a good hair day, and maybe that won't be important to getting a job if you happen to have the same haircut all the time. And timely is what we talked about before, in 30 minutes. So a good goal for you, for example, for an interview would be within 30 minutes on 4 June, I will ask good questions, listen more than I speak, present my value, so that they will want to take the interview to the next step. You see how much different that is, how specific that is, versus I want to have a good interview. When you do this, you engage your brain and you get excited about this interview as opposed to worrying about it. So the first thing you do is you sit down and write your goals, and you use specific, measurable, attainable, relevant, and timely when you write a goal. So let's do a little bit of this together. When you think about what it is you want to achieve in an interview, so get ready to type things in the chat. What kind of impression do you want to give somebody in a job interview? So write in the chat what you want people to think of you in this job interview, because this will become one of your goals. So go ahead. What kind of impression do you want to make? Do you want people to think you're intelligent? Do you want people to think you're smart? Do you want people to think that you have something to give? Okay, so they're starting to come in. You want them to have an optimistic impression, or give an optimistic impression of yourself. Positive and smart, good, reliable, a leader. These are all wonderful. These are wonderful things that you will want to include, reliable, promising, things you will want to include in your goals, the impressions that you want to make with the person who's going to hire you. This is wonderful. Already you're on your way to creating goals. Best version of me, love that. Be a little bit more specific though, because the best version of you in speaking, the best version of you in how you look, be specific, because that helps your brain, your subconscious mind, bubble up the things that you can actually do. This is great. Okay, so let's move on to the next thing. Now that oh, by the way, do you have any questions about what we've talked about so far? Because I'll break after every section to answer any questions that you have. So now you know the power of writing goals, what it does for you in your brain, and now you know the best way to write goals. So if anyone has any questions, feel free to write them in the chat or to ask, because I'm here to make sure you get what you need. And so far I'm seeing no ma'ams, but if you do have any questions, feel free to write them and I will get to them. So that's the first thing you do. You write down your goals. Now you know the power of this. The second thing you do is you create the messages that you wish to share in this conversation that is your interview. And I have here, remember the question behind the question. No matter what question people ask, the question behind it is, are you the right person for this job? Are you the right person for the job? That is their goal, to hire someone who's going to fit in well and who will make a contribution. So whatever question they ask, know that's the question behind it. And that is the question that you need to answer. And in part of that, remember what I call the rule of three. So this is neuroscience again. People can only hold 3 ideas in their short-term memory without their memory becoming full. So if you go into an interview and there are 5 things that you want to share, by the time you get to number 4, they have lost number 1. What this means for us then is that it's very important for us to sit down and think, what are the 3 things I want them to remember once the interview is over? And to emphasize those things and to reinforce those things, so we make sure that our messages come across clearly and succinctly. So you could write down 10 different messages. You could brainstorm and write down 10 different messages that you want people to remember. And then once you have that list, pick the top 3. And I'll be even more helpful there on what kinds of messages it is that you need to share that people who are interviewing you for a position really want to know. And they are these 3. What is the pain the organization is in? What is the experience that you have to deal with this pain? And what is your vision for what life will be like after they hire you and you're doing a good job? So let's take them one by one. Pain. Before you interview for any position, you're smart. You'll do your research on the organization, and you'll figure out what their problems are. Because I'm here to tell you, no one will ever hire you because you're good looking. I'm sorry. What they will hire you for is because they have a problem and they need your help to solve it. And now that you know this, it is your job before you ever do any interview to find out what the pain is in this organization that this job will help solve. And one of the messages that you will share is, I know your organization is facing this pain. So I told you that my first job was as a counselor in a home for troubled boys. If I were using this formula, I could say to them, your pain, there are three pains that you have. The first is the pain of making sure that someone you hire is a good fit. The second pain you have is making sure that this person will work with these children and bring them to a better place. And the third pain that you have is turnover, because this is a highly stressful job. When I say these things to somebody who's interviewing me for this position, they think, she knows this job, she understands. So the first thing you do is talk about what the organization's pain is, so that they understand that you understand. The second type of message you'll want to share is your experience. And so because you're usually pretty young in your career at this point, you'll talk about the things that you've studied. You'll talk about the situations that you've been in. Perhaps you've had an internship in the field. And even if your internship has not been in the field, you have learned things. So you will talk about, these are the responsibilities for the job. Here is why I'm a good fit. I know these things. I can do these things. I can share these things. That's what's important. You want to show how you fit, the benefit of working with you. So that is your experience. And once again, you can come up with up to 3 messages about your experience, which make it clear that you would be the right person to hire. You're doing their job for them. You're showing them you understand the organization and you have the experience, either in your education or in the jobs that you've had or in your life experience, that makes you the right person for this position. This is where most people stop, but not you. You're going to go on to the third message that you have, which is vision. Research shows that one of the most important words in any language is the word imagine. So to invite people to imagine what this job would look like after they've hired you, after you've been there for a year, because you'll come into this interview with ideas on how you want to make this a better place to work by solving the pain, by applying your experience. And how will this place look in 6 months or in a year after you've been there? And you paint this picture of how the department or the area will look because you have made these contributions. You invite somebody to see the future of having hired you and all the benefits they'll get from it. These are 3 very powerful messages. You understand their pain, you have the experience to solve this problem, and third, this is what the future will look like because they've hired you. So one of the things you'll do is you'll brainstorm on all of these different areas, and once again, you'll pick the top 3 because you know people can only hold 3 ideas. No 4 or 5 pain messages, only 3. And the top 3, which means you're focused on the things that are truly important. So creating your messages. Let's have you pick one of these as well. Experience. You already know the kind of position you want to have. So in the chat, type one of the things you want people to know about your experience. It could be how you've worked together on teams, what you have studied that makes you a good person to be a good addition to this team. So type in the clearest, clearest of speech I've heard. Thank you. Okay, so type in one thing, one quality that you have, one experience that you have that will be a contribution to the next place that you work. So we have team leading, hardworking. These are good. Leadership. These are good points. These are things that a potential employer will want to know about you. Good working under pressure, understanding that you're assertive, that you're knowledgeable. Yes, these are all points that you will want to share. You'll want to make them among your key messages. This is perfect. See, already you're well on your way. And if anyone has any questions about creating clear messages, please type them in the chat or ask them, because I want to make sure that you get the information you need. But now it makes your preparation really clear, doesn't it? So you'll go in there with a goal, you know what you want to achieve, and now you'll go in there with the 3 key messages that will connect with a potential employer, the pain the organization is facing, the experience that you have that will help them solve that pain, and then your vision for how things will look after they've hired you and you've made a difference there. Good. Then that'll take us to number 3. And this is something I rarely see anywhere, so you are already going to have an edge. Tell useful stories. It's one thing to say that I'm knowledgeable. It's another thing to tell me a story so I understand how your knowledge will help me as your future employer. So, for example, I've got 2 stories here. And by the way, they are created by a woman whose name is Annette Simmons. She wrote a book called Whoever Tells the Best Story Wins. And here are 2 of the types of stories that you can tell strategically that will make a good impression on people. The first type of story is called a who I am story. So this is a story that tells about a mistake that you've made or a flaw that you have and what you have learned from it. Because the idea is to show that you are human and approachable. So for example, if I were going to tell you a who I am story, I could tell you a little bit more about the story that you heard in the introduction. My first job when I was a counselor. And I would say to you, Fred is a 14-year-old boy standing 3 feet away from me. But in this moment, I cannot tell you anything about how Fred looks because all I can see is that he is holding the world's largest machete, saying, if you try to call for help, I'm going to cut you. I am the only adult in a boys' group home. Fred ran away 3 days ago, and now he's back. And when he showed up, I thought, I'm the adult. I need to tell Fred what to do. So I told Fred, go to intake. You can't be here until they clear you. And Fred said to me, I'm going to my room. It's like, Fred, why are we having this conversation? Just go to intake. No, I'm going to my room. We can do this the easy way or the hard way. Just go to intake. No, I'm going to my room. So I go into the office to call for backup to have somebody work with the other boys while I work with Fred to get him to intake. And that's when he pulls out this giant machete and he brings it down and chops the cord on the phone, my only lifeline to the outside world. And now I know that at that moment, I lost my mind. All I can do is babble. So I say, but Fred, I like you and you like me and you don't want to hurt me. And there's nothing in how Fred's looking at me that says he's agreeing with anything I'm saying. So I just keep babbling. And you don't want to get into the world of hurt you're going to get into if you hurt me. At which point I see Fred blink. And later he'll say to me, I started thinking about what my life would be like if I knifed you. I wouldn't be living in Daniel Cottage with everybody else. The police would come and they would take me and lock me up in jail. All I saw was Fred blink. And somehow I knew it was my chance. So I said to him, Fred, just make it easy on yourself and hand me the knife. And I was scared to death he was going to bring that knife down and chop my hand. But I knew I had to keep my hand out there. I knew I had to show Fred I thought he was a good kid and give him the chance to act like one. I can't tell you how long I stood there sweating through everything I had on. And so Fred finally took a sigh and handed me the knife. And then we sat down and talked. And later, my supervisor came in and he wanted to kick Fred out of the program because we can't have kids bringing knives in and threatening staff with them. And I said, but we have to keep Fred. He trusted me. And I was telling Fred what to do, and what I needed to do was to listen to Fred. And once I listened, everything got better. We kept Fred, and he graduated from the program, and he gave me a marvelous lesson, which is you need to learn how to reach unreachable people and spend time doing that and connecting with people and listening to people, and better things will happen. So that's a who I am story. I told you about a mistake that I made. I was telling Fred what to do rather than listening to him, and then what I learned about it. So type into the chat some of the things that you learned about me as I told this story. Some of the qualities I had, the mistakes I made, some of the things that you learned. Just type them in the chat. What did you get from that story where I shared this mistake that I made? And then you learned more about who I am. Because a lot of times what I'll see is, okay, strong person, I see, good. Resilient, good. Very composed, I didn't feel quite that way at the time. A quick thinker, okay, wonderful things. Because if I had said to you, guess what? I'm resilient, I'm a quick thinker, I can do empathic listening, you would have no reason at all to believe me. But because I told you a story and I gave you an example of this, you came to those conclusions on your own. This is what a powerful story does. It allows you to show people rather than tell people. The second type of story that you may want to tell in an interview situation is called a why I'm here story. And the purpose of this story is to talk about you don't have a hidden agenda. You are actually here to help. So I'll tell you a why I'm here story. I was asked to give a 15-minute keynote address to a bunch of high school students who had come to an evening to work on their resumes. And they told me the title of my speech, which was The Power of Resume, which already had me kind of bored. I didn't want to talk about the power of resume. And I thought, yeah, I can just imagine what these kids are thinking. Some old woman is up there talking to them about the power of resume. I'd check out too. I needed to find a way in. So I stood up in front of them and I said, if you were to ask any of the adults here who are helping you with your resume tonight, what they thought about writing their own resumes, and they were being honest, they would give you a look like a cat coughing up a fur ball. None of us like to do our resumes. But we won't get a job unless we do. So how do we turn this into a better experience? Since it's what you have to do tonight. So what I want you to do is shout out your favorite superheroes. And you can type your favorite superheroes in the chat too. So it could be, I heard Spider-Man, I heard Batman, I heard Wonder Woman, I heard Black Panther, Captain America I see in the chat, and and Supergirl. There you go. Somebody already nailed it. And I said, that's great. An even better answer would be yourself, because you have a skill or a talent that, at least one, that none of your friends or family have. You are your own superhero. So the job of your resume is to tell stories about your superpower, to show a future employer how lucky they would be to have you doing it there. So a Why I'm Here story talks about you're here to help people, and you overcome any impression they might have that you're not here to help them. And let me give you just a little bit of information about the power of story anyway. Our brains are wired for stories. So let's get back to neuroscience and the psychology aspect of it. When you tell me a good story, what happens is that you bypass all the resistance in my frontal cortex and speak directly to my emotional brain. That is where I make decisions. So tell me a good story. You've already lowered my resistance to anything you're about to suggest. This is powerful stuff. And then when you include details, what ends up happening is that here's something tricky about your brain. Your brain cannot tell the difference between something you imagine and something that's actually going on. So when I was telling you the story about Fred and the knife, my brain was reacting as though I was actually back there having this go on. So the fear center in my brain, my amygdala, was lighting up as though I'm in danger. When I was talking about seeing the knife, my visual cortex was lighting up. When I was talking about sweating, my sensory cortex was lighting up as though I was actually sweating. That's interesting. But what's cool is that your brain was lighting up in the same way. Your fear center lit up, your visual cortex lit up, your sensory cortex lit up, as though we were in this together, which means you tell me a good story. And what ends up happening is that our brains are in sync with each other. Our neurons are firing in the same way, which is one of the reasons why resistance gets lower. We now have those 3 key messages you want to share. Find a story that talks about your experience and share that. And what ends up happening then is that you help people visualize, see who you are. Rather than tell them, you show them. And you bypass all the resistance in their thinking brain. You speak to their limbic system, to their emotional brain, and then you have this great connection on a molecular level. That's the power of story. So if anybody has any questions on stories, feel free to type them into the chat. And we have a little time, so let me do the bonus. The bonus number 1, prepare your video handshake, because most of you are going to be interviewing by computer rather than in person. So there are a couple of things that you need to know in advance that will be helpful. First, what to wear. You already do your research, so you'll go online. You'll see how people are pictured on the websites. What kind of clothes are they wearing? So wear clothes that are similar to those. If you're interviewing for a job where everybody wears suits, wear a suit. If you're interviewing for a job where everybody is in jeans, do yourself a favor and dress 1 level up, because you want to show that you're professional. And make sure that your clothes are very clean and simple, and that you don't wear colors that go wah-wah on the screen. Next, check your background. You want to keep it very simple, so declutter it. Make sure that you have good lighting so people can see your face. Make sure it's all very clean, because what you want to do is have them focus on your face and connect with you, not be looking at all the things that are going on in the background. So if you can, which gives us the control of your environment. If there are other people that you're living with, let them know you're going to need some peace and quiet during this time. If you have a barking dog, have somebody take your barking dog out of the house. You need to clear that space, number 1, so people can hear you and understand what you're saying and not be distracted. And number 2, so that you're not distracted. And so you don't get distracted by some noise going on and lose your train of thought. So control your environment, set these things up, and do Zoom tests, because you know Zoom accounts are free. So do a test to see how you look and how you come off. Which then takes us to the second bonus. Give your attention. So this is what you do during the interview. Eye contact. Research shows that 80% of the people in the world value eye contact, but computers are not set up for eye contact. Here's what I do whenever I'm in a meeting, and you've already experienced it some. I tell people, when I'm speaking, I'm going to look directly into the camera because I want you to know I'm speaking to you. But when you're speaking, what I'm going to do is I'm going to look at your image on my screen, which may appear that I'm not looking at you. But what I'm doing is I'm getting the entire image of you. I want to see your background. I want to see how you look. I want to pick up on your body language. And when you set this up at the beginning, so they know why you're looking at the camera or why you're not looking at the camera, it helps them relax and understand. I don't hear anybody else talking about this. So once again, you create connection when you speak by looking in the camera, and when they speak, you look at them, and they know that you're paying attention to them, that it's not that your attention has wandered. Okay, smile. There is in the US a phrase, it is called resting bitch face. What this means is that when people are concentrating and they're not speaking, their faces oftentimes look unfriendly, like this. Okay, if I want you to hire me, the last thing I want you to see is this. Pay attention to what your face is doing when you are not speaking. And the best resting face to have is one that has a slight smile. So no big teeth, because that looks fake. Just give me a nice smile. And because we're nervous, we're not paying attention to whether or not we're smiling. But raise that in your consciousness level, because people want to be around people who are friendlier. And if you're not friendly during a job interview, they figure you're not going to be friendly once you show up on their doorstep. So smile and listen. Listen, there are two types of listening. The first is listen to respond. So you listen to what's going on and you're thinking about what you're going to say next when the person stops speaking. Okay, there is also a deeper level of listening, listening for understanding and empathy. So if a person is talking about, a person who's interviewing you is talking about the tough day that he or she had before the interview started, give them a little bit of empathy. Oh, that's difficult, as opposed to saying, oh, you think that's a problem? Here's something that I'm facing. No, not going to build rapport. So be there for them and obviously ask questions. Do this in advance, because a lot of times there's so much going on, it's hard to focus in the moment. So ask questions, write them down in advance so you have them there. And then when the point comes up that it's opportune to ask, you will be prepared. All right, so those are our two bonuses. We've covered a lot of ground today, haven't we? In a short amount of time. Now you know you need to write your goals and you know the importance of them. It gets your short-term memory and your long-term memory and your left and your right brain and your subconscious mind and your conscious mind in tune to be specific and get what you want. So specific, measurable, attainable, relevant, and timely. Makes it very clear what you want and helps you bring that into being. Create your messages. Now you know you have three. There's one about the pain of the organization, so you make it about them. There's one about your experience, the gifts that you bring, and then your vision, what life will be like once they've hired you and you are there doing a great job. And now you know two, and you know the three. Three is important. People cannot remember more than three things in their short-term memory. And finally, you know now the power of story. Tell a who I am story, which explains a mistake that you've made, but what you've learned from it. And a why I'm here story, which explains that you're here to help people and to work with them, and you don't have a hidden agenda. And now you have those 2 bonuses as well. All right. Guess what? I've taken notes for you. And if you want the notes from this presentation, all you need to do is send me an email at lynn@lynnfranklin.com and put the word interview in the subject line. And if you want to say something nice in the email text, I'll be happy to take that. But once you do that, I will email you the notes, the outline from all of the stuff I've covered so that you have that handy. And here you'll also see a link to my TEDx talk, How to Be a Mind Reader. 11 minutes, it's good information, which is also helpful for you in a job interview. I have a YouTube channel, which has all kinds of great videos on it about how to be more persuasive and how to connect with people. I do a weekly blog. 1 week it's a short article, the next week it's a short video. If you like the stuff I've talked about today and want to get a steady diet of it, that's it. That's where you can find it, sign up. And then finally, I'm on LinkedIn. If you want to connect on LinkedIn, let's do that. Now, are there any final questions in the minute we have left? And I don't know about the people who are running this, but if you want to stay a little extra time and ask some questions, I will be happy to do that, because it's been a pleasure being with you this morning. And the skills that we've talked about, these will serve you for your entire career. And I am so grateful for the chance to share them with you. And let me see if I can do this right. Dhanyavad. Thank you. Thank you for spending this time with me.
Thank you so much, ma'am. We actually do have a few questions in the chat box as well as on the Q&A section of the video. I will be taking them up so you can answer them accordingly. There are a few questions which ask about how one can improve their communication skills. Because I think one comment that you did mention while you were speaking is your speech is so clear. We were all so engrossed into what you were saying that I don't think we barely looked a minute away and got distracted for even a second. So how can one talk in a way that we can grasp your attention and be able to retain it?
Okay, so the first thing is record yourself as you speak. And I know we all hate the sound of our voices, but what you're looking for is data. So this is like an experiment. You're listening to how quickly you speak, how well you enunciate, and then the things and the things that you do well that you do not need to change. But the other things, and it could be some people mumble at the end of a sentence, for example. They run out of air. Their sentence is too long, so by the time they finish speaking, they've run out of air, and and we all want to breathe with them. And when you get nervous, you have a tendency to do these things. So have somebody interview you, do a mock interview, and play it back. And you don't play it back to beat yourself up. You are looking and listening for things that you do that you can do better, and the things that you already do well that you don't need to mess with. So those are two things that you can do. Record yourself. And once again, use the idea of the power of 3. People can only hold 3 ideas in their short-term memory. So don't overload them with information. Then they will forget. So speak clearly because you've paid attention to it, and then give clear messages and know what those are in advance and stick to those things. It helps everybody else. Good question. Thank you. Next one.
There's another question. Is there any specific process in choosing the right story which would connect with the most of the viewers?
Okay, so what I recommend on stories is literally sitting down and doing a brainstorming session with yourself. What kinds of stories do I have? Because the first thing I hear from everybody is, oh, I don't have any stories. Well, gee, the story of you being here today and all of the things that you've learned, that's a story. Everything is a story. And when you decide that there are good stories all around you, you start paying attention and then you start writing them down. So for example, the two stories I told today, the one about Fred with the machete and the other one about the high school kids who had to write resumes, I picked those stories because I knew they would be more appealing to you. So you pick stories that you know will have a good message for the people you're trying to reach. If I were speaking before a group of engineers, my stories would be much different. So what you do is you create a portfolio of stories that you can draw upon. And when you're doing an interview, you take a look at these different types of stories, and then you figure out which one is going to make the most sense to tell here. And that's what you share. So I call it strategic storytelling. You tell a story for a reason. You don't just tell a story. And tell you what, when I send you the notes from today, I will send you the entire cheat sheet from the Annette Simmons book, Whoever Tells the Best Story Wins, so you can see the different types of stories, the ones that you're brainstorming, so you can have good stories to tell. Okay, next question.
Tend to feel anxious during an interview. So what can we do at that point to calm our nerves?
The best thing that you can do is breathe. When we are nervous, we stop breathing, we hold our breath. So breathe. Also sit with both of your feet on the floor, because this brings the earth's energy up into you and makes you literally feel grounded. So breathe calmly. And if it's possible, you can even say, I'm a little bit nervous. I just need to take a breath. This makes you human to the other person, who probably remembers when he or she was in an interview situation and understands. Because the most calming breath you can do, and we'll do it together, is one where you inhale for a certain number of beats and you exhale for twice that amount. So let's do that. We're going to inhale for 3 beats, and then we're going to exhale for 6. And this is great to do before you start an interview. So let's inhale 1001, 1002, 1003. Exhale 1001, 1002, 1003, 1004, 1005, 1006. You can feel your body calming down already. So do that beforehand. As a matter of fact, do things you know calm you. I was working with the president of a company who would get very nervous before he had to do phone calls with investors. And I said to him, find yourself a nice private place and do the downward facing dog. Because what that does is it slows down your breath, it sends blood down to your brain, it calms you. Just hold that pose before you do the interview. And the same thing may work for you. So find the things that help you feel calm and do that. And when you feel your mind racing in an interview, pause and take a breath. And once again, and if you say, I'm so excited about this job and I'm so excited about the chance to work with you, I just need to take a breath. Nobody does that, and it will make you different and human. So good question. We all get anxious during interviews. So do these things that calm you.
In the presentation, you mentioned that we should ask questions during an interview. And somebody has asked you to give an example for the same. What kind of questions should we ask?
Okay, so there are basically, there are a couple of types of questions you can ask, and you will create the one that is specific to this organization. It could be, what kind of person do you want to hire? Who's the ideal person for this job? Because that will give you insight into what they're looking for. And then you can tie your answers back to the points that they've made, which shows, number one, that you've listened, and number two, that you have the qualities they seek. So that's a good question. What's the ideal person for this job? What is the biggest problem that you need this person to deal with on this job? What's the biggest gift they can bring? What's the biggest problem that you need solved by the person who takes this job? Or what are the biggest challenges of doing this job successfully? And depending upon whether or not you have a clear indication of what this job is, you can certainly ask about the responsibilities of the job, because some of them may not be clear. And you can say, I really want to understand the job and to be clear about what it is that you're looking for. So can you tell me a little bit more about this? You can ask about their culture. Tell me, how do you describe the culture of your organization to people who aren't familiar with it? So these are deeper levels of questions that you can ask, which shows that you're thoughtful about what's going on and that you really do care and want to understand about the position, which, once again, most people believe that the person who's interviewing them has all the power, and this is an unequal relationship. But the truth is, this is a conversation where you have the same amount of power as the person who is interviewing, because frankly, you're also interviewing that person, aren't you? Because there will be jobs when somebody is interviewing you and you realize, I don't want to work here. This would be a terrible fit for me. You have just as much reason to interview them as they have to interview you, which is why you ask good questions. There are things you want to know to decide whether or not this is the right place for you. So write down those questions and ask them. It's not just that they have all the power and you just have to respond. You are there for a reason too, and make sure that you get your questions answered as well.
Another question we have is, would you say it's a good idea to be more yourself in an interview, or be the self that the interviewer or the organization wants to see?
Okay. So the first bit of advice I have is don't apply for a job that is not you. And it's true. There have been times in all of our careers where we have applied for jobs that we knew were not a good fit, but we needed a job. All right. So if you have to do that because you need a job, then yes, be the person you think they want you to be and get the job and get some income, and then go find yourself a job that better fits you. It's part because we talked about the goals of an interview. You should also have a goal for any job you take and to know why you're taking that job. In this point in your career, it is rare that you will find the job that will be a fit for you for the rest of your life. When I went into the children's home and I was working with Fred and the other boys, my initial goal there was I'd spent all of these years on me and my education, and I wanted to give back to the community. And so I wanted a job where I could help people. That was my goal. And I quickly realized that social work was not a good place for me. It's true. Most people stayed in that job for about 6 months, and I stayed in it for a year. So I was at 22 a grizzled veteran in that job. But ultimately, I realized this is not where my gifts lie, and I needed to find a better place for me. So for me, today, and as you grow in your career, please be yourself. And certainly, there's something about being professional. It's true. The way you talk in an interview is going to be different than the way you speak with your friends. But it doesn't mean you have to be somebody else in an interview. It's true. If you have a tendency to slouch when you're hanging out with your friends, you'll probably sit up straight in an interview because you know that makes a better impression. That doesn't mean it isn't you. But be as much of yourself as you can, because the last thing you want to do is go into an environment where they are expecting you to be smiley and happy all the time because that's the way you were in the interview, and that's not who you are. You'll automatically, number one, set yourself up for failure, and number two, feel like an imposter. That these people would not accept you if they knew who you were. That's not the kind of experience you want to have. So my default answer is be yourself. But as somebody said in the chat earlier, be the best version of yourself in this instance.
With that, ma'am, we have come to an end of the questions that we had. Thank you
In that
so
case,
much.
then let me do one more because I promised you I would talk about state changes, right? So keeping my promise, a state change happens when you want to change the level of energy in a room. So here's the neuroscience. People can only listen to a talking head for 7 minutes without their brains wandering off and going someplace else, which means that every 7 minutes when you are making a presentation of any kind, you have to create a state change. And so state changes, you saw at the beginning, it was writing in the chat. It was writing questions. It was listening to my stories and telling me what it was that you saw. State changes can be everything from asking people to imagine things, to ask each other questions, to ask you questions. What you do is every 7 minutes in any presentation you give, wherever you are for the rest of your life, you will ask people to engage with you so that you keep them in the room. Because your comment, oh, bless your soul, you said to me, you were so interested in what I was talking about that your attention didn't wander. Part of that was by design. I made sure I was asking you to do things with me, and it wasn't just me talking. So that's a state change. You change the level of energy in a room, whether or not you're with the person or you're on a computer screen, to keep them with you. Use it. State changes are wonderful.
So much, ma'am. To be very honest, on the day of the dry run, since I had personally seen a glimpse of the presentation, I was wondering if it would still be as much fun listening to you on the day, because I kind of had a glimpse of the presentation beforehand. But it was the most wonderful 1 hour I have had. And especially on a day where we've had around 8 to 9 sessions prior to this, and this was the last session of the day. I think the fact that you were still able to engage the audience in such an interactive way, that just goes on to show the impact that your message has, the one that you're giving us, and how we can use it ourselves. So thank you so much for taking time out and coming and speaking to our audience, relating with our vision and giving your message to our young crowd. I hope that they have learned a lot from this and that they can take away some good inspiration for their interviews as well. With that said, I'd like to hand it over to the tech team to present to you with an e-certificate for your as a token of our appreciation and love for your work.
While we're waiting for that, I'm going to read the stuff in the chat.
Yes. In the meantime, can the tech team present the e-certificate?
Okay, it is not okay to lie just to appear to be a better person. So I'll answer that in the chat.
Thank you so much, ma'am.
Thank you, everybody. Enjoy your evening. Go out and empty out your brain.
Have a great day, ma'am.
With that, we have come to an end to the second day of sessions today. Thank you so much to everyone who joined with us today. We hope you had a fantastic time. Join us again at 10 a.m. tomorrow for another day of amazing sessions. I'm Angela, signing off for today. Good night and take care. Over to the tech team to play some videos.
In India, the rate of mental health practitioners is 0.3 for every 1 lakh people as per the World Health Organization.
There is a great gap that exists between the providers of health and people in need.
With this global pandemic, things have gotten worse, and it is predicted that after this, we will be having a mental health pandemic.
We are a growing population with complex issues but not enough resources for help.
Psychology is seen as an interesting blend of science and art. It is becoming a popular choice for many students.
However, there exists a taboo regarding mental health and the field of psychology. This prevents a large section of society in urban India from seeking help, while rural India suffers from lack of resources.
The mental health scenario in our nation is highly disorganized to pockets which are inaccessible to the most. The regulatory bodies are not structured either.
All these reasons have added a lot of instability and lack of guidance for students who want to come in the field as well as have a rewarding career.
There's a huge scope and imbalance psychology despite what people might be telling you. So come join with us and explore the field of psychology as well as latest trends which you might have never heard before.
I'm super excited to talk about Encyclopedia event. It's one of its kind in the world. It is designed by the student for the student. There are eminent speakers coming from the various field of psychology to discuss, to answer all your kind of a question, whether you are a PhD student, you are a UG student or PG student or school students.